Ücretsiz olarak bu konferansa katılabilir, oradaki sunumları dinleyebilir ve bu sunumların esas ekseni de akciğer hastalıkları ve özellikle de COVID-19 hastalığıyla ilgili bilgilendirme konferansları, bilgilendirme sunumları yapılacak.
Bugün burada esasen Türk Thoracic Derneği'nin çok gurur verici, ulusal ve uluslararası boyutu olan bir kongresini tanıtmak için beni davet ettiniz. Teşekkür ederim.
Teşekkür ederiz hocam.
Bu konuşmamız esasen o konu ve herhalde sizin de soracağınız COVID ile ilgili sorular olursa onun üzerine olacaktır.
Evet hocam, bu koronavirüsle ilgili uyarılarınız. Bir de yine hem bu konuda, çünkü sizin sloganınız Hayat Nefesle Başlar, Türk Thoracic Derneği 26-27 Şubat tarihlerinde yine bir halk buluşması gerçekleştirecek. Geçen sene bu toplantıyı, buluşmayı yaptığınızda ne kadar kişi sizi takip etmişti? Şimdi beklentiniz ne? Burada neyi konuşacaksınız? Hangi uyarıları yapacaksınız? Paylaşır mısınız?
İlker Bey, 2020'nin 29 Ekim'inde sanal ortamlardan Facebook, YouTube, Instagram 150 bin kişi bizi izledi. Yani bu çok iyi bir sayı. 150 bin kişi. Şimdi gene 26-27 Şubat, yani haftaya cumartesi, pazar günü göğüs hastalıklarının ilgi çeken ve de çok sorulan, yani ne bileyim öksürük, balgamında kan geldi, hava kirliliği, sigara veya elektronik sigara veya ısıtılmış tütün ürünleri, yani akciğerinde nodül var veya koah, astım hastalığı, tüberküloz gibi bütün konularda ülkenin bu konudaki uzmanları, yani bu konuya vakıf uzmanlar sohbetler yapacaklar ve sonra da gelen tabii ki soruların ancak bir kısmını cevaplandırabilecekler. Bu sene ayrıca yani böyle bir halk kongresini dünyada ilk kez gerçekleştirmiştik geçen yıl. Bu yıl bunu biraz daha dedik genişletelim. Yazıştık. Avrupa Solunum Dernekleri, Amerikan Thoracic Derneği ve Uzak Dünyaya ve Pasifik'teki bütün doktor ve hasta dernekleriyle yayına geçerek, iletişime geçerek bu kongremizi YouTube'dan İngilizce olarak da vereceğiz. Dolayısıyla Türkiye'den dünyaya böyle bir eğitim bazlı bir toplantıyı gerçekleştirmiş olacağız.
Sağlıkla ilgili bir bilgilendirme yapmak istiyorum. Şimdi şu dönem, özellikle Covid yaşadığımız bu dönemde ağırlıklı olarak akciğerimizi de çok konuştuk, değil mi? İşte Türk Thoracic Derneği'nin bir çalışması var, bir kongresi var daha doğrusu. Halk için Akciğer Sağlığı Kongresi başlıyor ki sizler de takip edebilirsiniz. O nedenle söylüyorum. Türk Thoracic Derneği 2020 yılı Ekim ayında birincisini düzenlemişti bunun. Şimdi halk için akciğer hastalıkları ve COVID-19 kongresini bu yıl 26-27 Şubat tarihlerinde, yani cumartesi ve pazar günü düzenliyor. 2 gün sürecek bu kongre. YouTube'dan, Instagram'dan, Facebook'tan, Twitter üzerinden takip edebileceksiniz. 50'den fazla uzman var. 25 konu hakkında halk sağlığı için bir araya gelecekler. Aynı zamanda şöyle söyleyelim, İngilizce olarak simultane tercüme de bir yandan gerçekleştirilecek. İşte astım, koah gibi kronik akciğer hastalıkları olanlar, yine işte biliyorsunuz dünyada en büyük ölüm nedenleri arasında gösteriliyor. Özellikle koah mesela, aynı zamanda. İşte zatürre, verem, akciğer damar tıkanıklığı, akciğerde hava kaçağı, akciğerden, daha doğrusu ağızdan kan gelmesi gibi hastalıklar, bunların hepsi burada konuşulacak ki Pandeminin tabii ikincil etkilerinden bir tanesi bu hastalığın yükünü arttırması oldu. Şimdi Türk Toraks Derneği'nin bu etkinliği, bu kongresi dediğim gibi 26-27 Şubat tarihlerinde gerçekleşecek ve burada mesela işte akciğer hastalıkları için check-up yaptırmalı mıyım? Akciğerimde nodül saptandı, endişe etmeli miyim? Temizlik hastalığı beni akciğer hastası yapar mı? Veya vesaire, neyse bütün bu sorulara cevap bulabileceksiniz sevgili dinleyiciler. 26-27 Şubat tarihlerinde saat 12'den sonra toplumun büyük bölümünün izleyebilmesi için de hafta sonu gerçekleştiriliyor. Özellikle bu etkinlik Türk Toraks Derneği'nin tüm sosyal medya hesaplarından canlı olarak ücretsiz bir şekilde takip edebileceksiniz. Altını çizerek hatırlatalım.
Merhaba, Geniş Açı'yla karşınızdayız. Bugün Geniş Açı'da bir kongreyi tanıtacağız sizlere. Bir kongreden konuşacağız. Türk Toraks Derneği'nin düzenlediği bir kongre bu. 26-27 Şubat'ta, yani bu hafta sonu Akciğer Hastalıkları Kongresi düzenleyecek Türk Toraks Derneği. Kongre Başkanı Profesör Doktor Füsun Topçu bizimle birlikte.
Bizim bu kongreyi yapma amacımız hem halkımızı hem hasta yakınlarını hem de hastaları, akciğer hastalıkları ve COVID-19 konusunda bilgi vermek amacıyla bu kongreyi düzenliyoruz. 26-27 Şubat, yani bu hafta sonu cumartesi pazar saat 12'de başlamak kaydıyla 18.30'a kadar süren 25 konu başlığıyla çok güzel konularla sizlerin karşısında olacağız. Nasıl gireceğiz derseniz, bunda Türk Toraks Derneği'nin sosyal medya hesaplarından YouTube, Instagram, Facebook ve Twitter'dan bize ulaşabilirsiniz. Hepinizi kongremize bekliyoruz.
Ömer Bey, siz de girişte ifade ettiniz. 26-27 Şubat'ta Toraks Derneği olarak biz halk için akciğer hastalıkları ve COVID-19 kongresi düzenliyoruz. Sosyal medya hesaplarımızdan da ücretsiz ve canlı olarak yayınlanacak sorularla, yurttaştan gelen sorularla onları doğru bilgiyle buluşturmayı ve bilgiyi toplumsallaştırmayı istiyoruz. Ama tedavi konusunda atmamız gereken çok adım var.
Evet, çok sayıda, yani çok kapsamlı bir kongre bu Türk Toraks Derneği'nin 26 Şubat Cumartesi ve 27 Şubat Pazar günü olacak olan kongresinde. Yani pandeminin neden bitmiyor, bu bir kaderimiz mi diye sizin de konuşmanız var.
Evet, evet.
Çok yoğun bakım meseleleri, pandemide yitirdiklerimiz var, hava kirliliği ve iklim krizi meselesi konuşuluyor. Yani olabilecek bütün önemli, çocuklarda nasıl seyrediyor meselesi gibi pek çok kronik akciğer hastalıklarında solunum rehabilitasyonu gibi.
Merhaba, ben Doktor Oya İtil, Türk Toraks Derneği Başkanı. 2 yıldır pandemiyle mücadele ediyoruz. Bu pandemi bitecek mi? Yoksa kaderimiz mi oldu? Pandemiyle ilgili gelecek senaryolarımız neler? Yeni varyantlar ortaya çıkıyor. Kontrol programları var. Ama bu kontrol programları yeterli mi? Pandemide acaba küresel aşı eşitsizliğinin rolü nedir? Sağlık çalışanları giderek tükenmekte. Bu konuda son durum nedir? Yine ekolojik yıkım, iklim krizi bu pandeminin neresinde? Uzmanlık derneklerinin pandemideki rolü nedir? İşte bütün bunları, pandeminin geleceğini, nasıl başladığını, alınan önlemleri, hepsini sevgili meslektaşım Doktor Osman Elbek'le birlikte tartışacağız. Hepinizi 26-27 Şubat 2022 Türk Toraks Derneği COVID-19 ve Akciğer Hastalıkları Halk Kongresi'ne bekliyoruz. Teşekkürler.
Good afternoon. My name is Dr. I'm the president of the Turkish Thoracic Society. Turkish Thoracic Society has been organizing this pulmonary diseases and COVID-19 Congress for the public. And this is the second day of our Congress. I'd like to welcome you all to the second day now. Osman Elbek is with us. He's the chair of the Health Policies Working Group of the Turkish Thoracic Society. We're going to discuss, is pandemic ending or is it our fate? You know, we have been fighting against the pandemic for the last 2 years, and there are new variants, and the number of cases has been increasing and deaths are increasing. And in the last 1 year, vaccination has been ongoing across the world, whole world. Is it enough? Could countries have access to a vaccine equally? Is there any vaccine inequality at global level? What would you say, Osman? Professor Oya, we have to clearly say that this is not our fate. The pandemic occurs is not our fate, and it's ongoing. It is not our fate either. So this is the result of our conscious preferences, and then the pandemic is ongoing because of our conscious preferences and choices. As you said, there is an inequality as regards access to vaccination. You know that COVID-19 is a global pandemic. It started in China and it then spread across the world in just 3 months. But the reflexes and responses of the countries are national responses, just within their boundaries. But COVID-19 indicates that there is just one world, and we need to be egalitarian, and we need to be equal to everyone. So we are now embarrassed because of this inequality in vaccination. I have to make a presentation for that. If we had implemented public health measures, if we didn't create Omicron and Delta, we created them because we did not take the necessary public health measures. Now, we could have reached out to 62% of the world's population through our vaccination. Then we could have brought a pandemic to an end. We created Omicron and Delta new variants of COVID. So this is not our fate. This is just our preference, conscious preference. So although it seems that we have vaccinated 62% of the world population, but the population of the wealthy countries and poor countries has not been vaccinated at the same level. So 80% of the population in wealthy countries was vaccinated, but it is only 12% in poor countries. Can you imagine 3 billion people cannot access vaccines today? And the healthcare professionals, which are at the highest risk group, was just vaccinated by 25% in African countries. So there is such an inequality. COVID-19 pandemic just demonstrated that this world is just one world. So is it possible to prevent that? Because of the economic policies, we could not prevent it because capitalism wants to generate more profit. The vaccines can be manufactured less than $1, but they want to sell it to wealthy countries for $30 and $40. They don't even care about people's health and pandemic. That's why we could not end the pandemic. And World Health Organization had some philanthropic studies, but this does not work a lot because they always focus and insist on patents and also profits. The CEOs of the vaccine companies just abandoned the whole world to death and this disease. As you know, the scientists that developed polio vaccine said, how can I get a patent for the sun? And how can I get a patent for this vaccine, he said. Now, the CEOs of the companies won't be scientists. We have to give very clear and strong answers to that. Vaccine is the most fundamental human right. It cannot be abandoned to healthcare and economic policies. If done so, the pandemic cannot come to an end. Of course, there are some local pillars for that global pillar. So the specialty societies should be the strongest pillars. As the president of the Turkish Thoracic Society, you are here, so it's not for me to speak about that. So what do you think about the national perspective through this pandemic? Thank you very much. In recent months, together with the Turkish Thoracic Society, the Clinical Microbiology and Infectious Diseases Society, and public health experts, Society and also Clinic Probiology Society work together as Turkish Thoracic Society in the last 2 years, starting from the beginning of this pandemic. We tried to provide accurate information to the public, and we try to guide the health policies in our country. The health authority, which is the Ministry of Health, since the beginning has been consulting the relevant specialty societies like Thoracic Society and other professional organizations and Turkish Medical Association and local authorities. It could have worked in collaboration with these societies, and we could have provided these solutions. We had press releases and opinion and position reports, and we organized several webinars in order to impart accurate information to the public. In the meantime, in the initial months, we had some problems in personal protective equipment, and we tried to assist our frontline healthcare professionals, and we tried to deliver and supply PPPs to them. Actually, that's why specialty societies exist. As we always highlight and underline, we need to increase the number of tests, and also we need to spread and disseminate vaccination and accelerate vaccination practices, and schools should be kept open under certain measures while deciding on normalization and lifting up of the restrictions. They all have to be based on scientific evidence. Not economic policies, and the data should be shared and exchanged transparently as we demanded. As the Turkish Thoracic Society, we conducted survey studies and we produced information and data, and we made it available for public health and community health. So all societies should identify problems, which is quite important, and it is important for them to also find some solutions to these problems identified. Do you think that a good control program has been implemented in Turkey? What are the components of the control program for the pandemic? I can't say yes to this question because in terms of the world population, although Turkey ranks the 18th in terms of the population, but the number of the cases ranks the 7th in the world, and we have more than 200,000 deaths. It means that we didn't implement a robust control program. The most important component of a control program is our objective. Do you want to suppress the pandemic, or do you just want to mitigate the impacts of the pandemic? To be honest, Turkey never wanted to suppress the pandemic. If it did so, it would have implemented what you have just suggested. We could have performed more tests, and through early screening, we could have been more successful. And it just wanted to mitigate the impacts of the pandemic. And the basis of successful healthcare policies, transparency, honesty, and trust in the public authority. So we just discussed, is it just a patient or cases? In a medical doctrine, it is unacceptable because data has been concealed and there was no transparency in the country's policy, from the UK to Denmark. From vaccination to the number of cases, age group of the cases, and also their professions. I could find the data, but in my country, I could not find the data, and we need to have a holistic perspective. Of course, the call to stay at home was an important call, but while making that call, there may be some people who cannot stay home, and you have to create an environment where they can stay inside. That's why we need to put some money into the pockets of people if they can't stay at home. And we need to stand by the poor people. Those who can stay at home have higher socioeconomic status. And in Istanbul, according to the survey that we conducted, we also demonstrated that blue collars were the main elements for the transmission. And we needed to support the blue collar, the workers. And one important problem as regards our control program was the healthy transformation program. But you know that the medical center, which was the strong primary level healthcare center, we introduced a family medicine model. That's why we could not reach out to households. That's why we tried to establish separate screening teams. But in the history, we had a very strong vaccination programs. So we can see the negative implications of the transformation in health program within the context of this pandemic. We can see that impact. Of course, whoever makes a promise has to achieve it. Actually, the public authority, political authority should be a role model. The funerals should not be so crowded, the congresses would not be organized, because people just look into your eyes. Whatever you do, they will do. That is what is meant by role model. The political and the public authorities should have been a role model to the society, but we could not do that. Because of that, we had a very high number of cases and also mortalities, declared or non-declared, and as a result, we had the greatest implications of that as healthcare professionals, because we were pressed under a very huge workload. You know that as the president of the society, because this control program has failed, all the healthcare professionals were exhausted. What do you think? Yes, the healthcare professionals in the last 2 years had to work in the front line with great sacrifices. We had duties, never-ending duties, and we didn't have any leaves of after the duties, and the workload was not distributed equally, and they were exposed to mobbing, and they could not use their leaves. And also, in order not to avoid transmitting to their family members, they had to stay away from their family members' children for a long time, and this was really traumatic. And in the first month, when there was no vaccines, several healthcare professionals were ill, and we lost so many colleagues of ours. And as of today, now we have lost 550 healthcare professionals. These are just numbers. They all have families, their children, and these are huge losses for us, great losses for us. And as a result, we were pressed under this workload, and which was not distributed equally, and in the regions especially, together with the pulmonary diseases specialists, we had some regional meetings because they were working in this field, and they said that the workload was not distributed equally, and they were quite exhausted. In some places, chest diseases, in some places, internal medicine specialists and infectious diseases specialists undertook this role, and there was inadequacy in pandemic control. As a result, physicians were exhausted. They were very tired and worn out. But did they get the return of it? Unfortunately, no, they didn't get any additional payment, and they felt away from their professions, although they had great self-sacrifice, and although they struggled for the community health, they are still subject to violence. A few days ago, a chest diseases specialist was exposed to or subject to violence, and she quit. And there are people who retired, resigned, and now they do not get prepared for the exam of specialty, so they attend German language courses in order to go abroad. These are great losses. Our young colleagues move to other countries, so this is brain drain, and we are very sorry for that, because we should protect the value of the physicians, because it is a reputable profession in society. We need to preserve the value of our profession. COVID-19 is an occupational disease, especially at hospitals when there is not adequate protection in wards and outpatient clinics. They are working in cramped areas without any ventilation, and they got sick. And we mentioned about this position of the hospitals. Apart from distance, hygiene, and masks, ventilation was quite important, as we suggested, and the hospitals were not ventilated adequately, we said. For that reason, healthcare professionals without any casualty association, when they got infected with COVID-19 or they died, their children and family members are victimized. So this has to be acknowledged, recognized as an occupational disease, definitely. So what will be it like in the future? Will it come to an end, or is it our fate? What can be done? What would you say? So the science tries to answer this question with certain scenarios. Roughly, there are 4 scenarios for the future. The most optimistic and impossible scenario I'd like to start with. So in spring, in autumn of 2022, and also in the winter of 2023, there will be another wave. but we don't know the size and extended that way. There are three factors for that. A new variant may emerge. I don't say may, I say it will emerge. And the transmission and also pathogenicity for severe form of the disease, we don't know that. Is it going to be milder or more severe than the current variant? So if that, it is possible that such a new variant will come, according to a study that I read very recently. For example, so there is a new variant described in some deers with white tail in terms of SARS-CoV-2 people. So if this variant is similar to Omicron in terms of virulence and transmission, and if it is avoidant vaccine less than Omicron, so after the last peak and away, there will be a smaller peak after the autumn. So now the number of the mortalities, or that is 300. Now, this is the most optimistic scenario. In the most possible scenario, there is a more positive but pessimistic scenarios. So according to the optimistic one, there will be a similar variant like Omicron in autumn. It has similar transmission and virulence, and it will get away from the vaccine similarly. So this is the optimistic part of it. In autumn and winter, there will be a similar peak like the one that we had recently. So on a daily basis, the number of deaths is like 300 now. I'd like to underline that. And there are people who could not access vaccines. There are vaccine hesitants and anti-vaxxers. So in autumn and winter, they will start dying to a significant extent. And there are risk groups, including patients under cancer therapy whose immune system has been suppressed. So in the next autumn and winter, they will be affected significantly by this wave. And also the pessimistic scenario claims that there will be more infectious variants and will be avoiding the protective effect of the vaccine, but it won't have a higher weight than the Omicron. It means if this pessimistic possible scenario is realized, the next autumn and winter, there will be a higher peak. It means more disease, more mortality. So the most pessimistic scenario is as follows. The new variant will be more infectious than Omicron. It will be more virulent, causing more severe disease, and it will not be influenced by the vaccine compared to Omicron. So it will be less affected by the vaccine. So it means there will be a huge wave. It may mean that the pandemic will start all over again. There is only one way to prevent it. We need to continue taking public health measures, increase vaccinations, and produce more effective vaccines. And vaccine should be provided and supplied to the whole world on an equal basis. If you deprive every society from vaccine, it may mean that there will be a new variant. That's why SARS-CoV-2 tells us that either you will get rid of it and you will be saved altogether, you have to protect each other, or under national interests, for the sake of national interest, these variants will continue. Of course, SARS-CoV-2 does not suggest solidarity between people. It says if you destroy ecology in this way, that you will see more pandemics and you will see more outbreaks. What would you say, Professor, about this ecology? So it all starts with ecological destruction and also a climate crisis. We are in the same, we are sharing the same ecosystem with plants and animals. We are sharing the same environment. So we need to look to the health from a holistic perspective. That's why we say One Health. If animals lose their habitats, for example, if forests are destroyed, lost, and burned, if they lose their habitats, and they will abandon their own habitats and move to cities, and they transmit those infectious diseases to people there. In any part of the world, if there is an increase in temperature of 1 to 3 degrees, it may change the migration routes of the mosquitoes. So destruction of ecosystems in order to do mining, for example, burning forests for mining purposes, or climate crisis, may lead to the spread of the infectious diseases. All communicable diseases, at least 60% of them are zoonotic. For that reason, we should avoid destroying their habitats, and we need to prevent illegal trade of animals and also illegal hunting and gaming. These are quite dangerous, and COVID-19, that's why COVID-19 started in Wuhan in China. For that reason, we need to have a holistic perspective to health. We need to protect ecosystem for health, and we need to prevent climate crisis. This should be the objective and target for all countries. Of course, we are now encountering this cold phase of war. Wars are also an important factor. Ecosystem is destroyed because of the bombardments and firearms, nuclear weapons, biological and chemical weapons destroy the ecosystem, forests, groundwater, rivers, and also habitats of people and animals. So the greatest pandemics occur in war times. This also happens in the past. For example, many years after the Gulf War, COPD and also shortness of breath, respiratory distress developed because of those firearms and bombings that were used in that war. What I would like to highlight at this point is that peace is also required for health. What do you think? Isn't it important? Quite right. We are entrusted to one another. We are not wolves to each other. So we need to be in solidarity in order to be healthy across the world. What we mean by that solidarity is that we need to stand by the poor. And that's why we need to protect each other. And people are not ruling the nature. We are just parts of the nature. So people, human beings should live together with the nature, plants, animals, and also the nature. So we need to look from a holistic perspective to health. Otherwise, any problem that may occur in any of these parts of the nature, there will be a world full of wars and destructions. For that reason, the pandemic is going to lead to the restructuring of the whole humanity. So instead of economic policies, instead of profit and earning policies, we need to give priority to plants, animals, people, and we need to care the whole world from a holistic perspective. Otherwise, we are going to deepen the destruction in this world. So I remember the last sentences of the Turkish Thoracic Society, not sustainable development, but for sustainable future and life. We should not base everything on profit and earnings. We need to favor people, nature, and one health. For the final remarks, I'd like to give the floor to you. Thank you very much, Osman. So we will continue fighting the pandemic, and we should eliminate vaccine hesitation. We need to accelerate vaccination and disseminate vaccination, because vaccines will protect not only individuals but the whole society. As Turkish Thoracic Society, we will continue telling the truth. And thank you very much for listening to us, for your attention. I also would like to thank Professor Osman Elbek for your attendance to this session. Have a good day.
Hepinize merhaba. İnternette gördüğümüz her sağlıkla ilgili ve COVID ile ilgili bilgi doğru mu? Yanlış bilgi sosyal medyada nasıl karşımıza çıkıyor? Bütün bunları araştırmacı, bilim adamlarıyla beraber konuşmak üzere sizi Türk Toraks Derneği'nin düzenlediği 26-27 Şubat'ta online olarak yayınlanacak olan Akciğer Hastalıkları ve COVID-19 Kongresi'ne bekliyoruz.
Merhaba, ben Mertcan Yılmaz. İnternetteki şüpheli içerikleri inceleyen bağımsız doğrulama platformu Teyit'te araştırmacı olarak çalışıyorum. 26-27 Şubat tarihlerinde Türk Toraks Derneği'nin düzenleyeceği Halk için Akciğer Hastalıkları ve COVID-19 Kongresi'nde sosyal medyada COVID-19 aşılarına ilişkin yayılan yanlış bilgiler üzerine konuşacağız. Aşı dezenformasyonunun ardındaki perdeyi veriler ışığında aralayacak ve halk sağlığını tehdit eden yanlış bilgilerle nasıl bir iletişim stratejisiyle mücadele edebileceğimizi tartışacağız.
Merhabalar, ben Onur Varol, Sabancı Üniversitesi Bilgisayar Mühendisliği Programı öğretim üyesiyim. Bu hafta sonu sizlerle Türk Thoracic Derneği'nin düzenlemiş olduğu Halk için Akciğer Hastalıkları ve COVID-19 Kongresi'nde konuşacağım. Çalışma konularından olan sosyal medya manipülasyonları ve dezenformasyon faaliyetlerinin halk sağlığı üzerine olan etkilerini tartışacağız.
Görüşmek üzere.
Distinguished members of audience, good afternoon. My name is Junaid Salturk. I'm a chess specialist and I am in charge of social media and IT in the Turkish Thoracic Society. As you know, internet is active and it is one of the utilities, and internet is one of the main sources of information for us, but internet unfortunately is not always containing the correct information, and during the COVID-19 pandemic we have seen that quite thoroughly, and the power of the internet can be misused and there can be misinformation, and we could see the bad examples of that, and we are here to talk about those bad examples. I have two distinguished scientists who are working for TEIT.org. TEIT.org is a website which reviews the information on the internet and trying to objectively verify the correctness of the information. They are completely impartial and independent. We have two scientists, Mertcan Yılmaz at Uppsala University in the Department of Peace and Conflict Research Assistant, Onur Varol, Sabancı University Computer Engineering Department and teaching at and they are two distinguished scientists. So welcome. Thank you very much. It's an honor to have you. Thank you very much for accepting our invitation. So during COVID-19 pandemic, we have seen that quite frequently, especially concerning the vaccination. There was a lot of information, and that could be detrimental to the public health. And regarding the vaccination, there were a lot of misinformation. What are the basic mechanisms? What are the basic factors? What are those people's benefits in order to misinform people? What is their purpose? Why do they do it? So let's start from Mertcan Yılmaz. The floor is yours. Well, so I would like to talk about TEİT.org and what we do. As you have underlined, TEİT.org is a website and it's a verification platform, and it reviews impartially the information on the internet. So critical thinking, and we would like to ensure that critical thinking is involved in all processes across the world and in Turkey. There are dozens of information and misinformation which is disseminated through media, social media, and conventional media. Well, of course, a person cannot check and read all of them. So we have a certain methodology, we have a selection and prioritization criteria. And in order to underline, I can say that when there is a claim, we check its significance, its urgency, and also reality. So these are the main criteria. When we look at the pandemic period, we had aspect. I mean, there were some claims regarding COVID-19, the pandemic, and there were some claims concerning the vaccinations for COVID-19. And I mean, they were significant, and they also met the urgency criteria. And from time to time, they could become viral. They could be shared and posted, reposted by many people. There are many reasons for that. We can discuss that later on. But our team in Turkey, I mean, starting from March 2020, when the first case was observed in Turkey, more than 500,000 content was produced by our team, and majority of them were about the vaccines. And regarding the vaccines, we tried to catch up with a certain pattern because certain names were prominent all the time, certain themes were prominent in the front line, and we used our insight and we looked at the data, and we wanted to focus on primarily the data that was available under the leadership of Onur Varol, Ege Özener, Özgecan Seçkin, and from Edinburgh University, Aybüke Atalay worked with us. And in collaboration with them, we focused on the misinformation about vaccination on Twitter and how it was propagated. Okay, Mr. Onur Varol, so what about your aspect? How is the misinformation systematically propagated? What are the tricks or mechanisms in social media to disseminate the misinformation? Social media in the last 10, 15 years has become very popular, and it is an information sharing media, and gatekeepers are there because access to information can be controlled on social media. And social media is such a platform. I mean, it is now very much present in our life, like newspapers, like TVs and radio, and it is really important to confirm the accurateness of the information propagated. Just like in any platform in social media, one of the risks is to have misinformation being propagated. It's important to focus on the mechanisms to prevent that. Television and newspaper, these are classical ways of propagating information, and there are moderators, there are journalists, and they are responsible members of the profession. But in social media, everybody can produce information and contribute to the ecosystem of information. So journalists make posts and they have some reaction, either positive and negative, and we can see that there is a lot of feedback, and over the time the posts changed, and within the system people receive feedback, and those feedback have become very valuable, and that had an impact on the way of behavior. So impacting the way of behavior, everybody can contribute, everybody can be involved, and of course how much of those accounts are really organic and controlled by real people, and how much of them are automated and automatically controlled by certain software and applications? So that is also another important question that we have to ask, because usually, people tend to believe in what they hear, and there are some shortcuts that they follow, some heuristics, and some of those shortcuts, is like, if a piece of information has been shared many times and by their close circle, they are more willing to believe in it. So they have bias perspective. And as a result of that, based on their bias, by social bots, which are the automatic accounts, and those pieces of information can be shared many times. One content can be shared by bot accounts, social bots, and people have increased tendency to believe in the misinformation that was initially shared. So the medical workers, you have a very crucial role in informing people, the patients, their relatives. And on social media, some people can imitate to be a medical doctor, and people see them as authorities. One of the questions that we ask is the number of followers. Are they really real? There are 10 million followers in one account, and 10 million, are those really real followers, or those exaggerated numbers which are inflated by the social bots? So what we do is, usually we are trying to detect manipulative activities on the internet, and we are trying to identify the social bots on the internet. We look at the propagation of information, and we check whether it is organically propagated, or are there some other hidden motives behind sharing that information. The third thing is, people believe in information, and if they believe in it without checking its validity, without verifying that, we look at the producer and we check the accounts that share the pieces of information, and we try to check whether the followers are really organic. So the main purpose is to detect the manipulative activities on social media. During COVID-19, we focused on the medical aspect, the health aspect, and for selection and for other activities, online activities, in the discussion of important activities, it is really important to protect social platforms from these manipulative activities. One of the things that we do in Tate.org is, on social media, there are posts concerning COVID vaccination, and we are trying to detect the accounts that create the misinformation. These are misinformation actors, and we also look at the groups of society that consume the misinformation created by them, and this is referred to as the audience. They consume the misinformation. And the third thing we want to look at is the mechanisms through which these content are made popular. Social bots, and again with the user bots, some topics are made trending topics, and we try to identify those manipulative activities. Okay, I can also have an additional comment. So we identify the accounts which are active in propagating the misinformation. And another thing that we focus on is the main narrative. So, there are some actors propagating the misinformation. One way to fight against them, to deal with them effectively, one way to do it is to look at their main arguments, the main narrative through which they are propagating the misinformation. Tate previously identified 36 misinformation actors, and we have identified that they are in the most effective 5% in the discussion concerning COVID-19 vaccines. Throughout COVID-19, they increased their number of followers, they had a lot of interaction, and they grew in tenfolds. Well, the narrative is important. There are 5 main narratives that were identified in our study: mRNA-centered, side effect-centered, global oriented, rights-based, and also new variant-centered misinformation narratives. So, what we have identified was the following. There were some actors propagating misinformation, and they did not content with only one narrative. They focused on mRNA misinformation. When they share that, they also add some misinformation regarding the global orientation narrative. So this is really important, because this is about a communication strategy. mRNA is one of the narratives, and they have a strategy. So we have to fight against that strategy with a certain perspective, and the same applies to the others. Ali Osman Arabacı and with Öykü, we worked on a study, and we also focused on the actors of vaccine misinformation and their main motives, because we wanted to identify the main motives. So, I mean, people may think it's economic, it's financial. You might immediately think that these are the main reasons. This is another aspect. It's not only money, right? No, there are other interests, right? Yes, the most important thing that we wanted to attract your attention to is the three main motivations which we have identified, possible motivations. So, I mean, you have already identified and you have already rightfully mentioned. One is the financial, the economic motive. And the second one is social status related motive. And the third one is another motive, social status motive. Well, in sociology, there are social group concepts which we have to focus on. So in a certain time period, some individuals come together with certain principles, and they are called a social group. Families, tribes, and nations, we are talking about a social creation. So there is an anti-vaccines group in Turkey. They have their own norms, principles, and values. And there are people playing for leadership. They want to be the opinion leaders of that social group. And here, I mean, regarding anti-vaccine group, their main motive has to be leadership, and they have to focus on misinformation, because without misinformation, they cannot maintain the group. So the actors playing for the leadership of the social group instrumentalize misinformation, and they try to propagate misinformation. And when they encounter the facts, they do not step back, because if they stepped back in the group, the hierarchical order would be broken, and that would be stepping back in the hierarchy. This has such a power that, I mean, they didn't have this power in the past. Maybe, I mean, they did not have the power to impact one's behavior. So those actors all of a sudden disguise themselves as opinion leaders, and they feel that great power having an impact on others' actions and behaviors, and that can be their motive. The second motive, sorry to interrupt. Well, you have described it very well. During the COVID-19 pandemic, as doctors and healthcare specialists, we were talking about preventive and protective measures. We always mentioned the same things, trying to mention the values about the vaccine and also fighting against the pandemic. When we say things, I mean, people have a prejudice, they are biased. But when you are impartial and making these statements as an impartial organization, people can figure it out better, because economic motives, social status motives, in order to be famous on social media, they can rise on social media, they can increase their followers on social media, and they want to be popular, they want to occupy some space in popular media. So these are the motives. So I would like to ask a question regarding the end user, members of the public. People are members. So, I mean, I have been following your website, tate.org, and you are verifying all the information that is available, and you have conducted so many studies. But how can the end user understand what is the pattern, what is the methodology? I mean, they read something, and when should they doubt that information they read, and when should they be suspicious? What should the end user pay attention to? First of all, I would like to mention a couple of things, if I may, Onur Bey. We can think that if the bush is moving, the assumption is there is a lion. But this is a very evolution-related assumption. Well, in the beginning, the first human beings didn't know that this was the case. So, I mean, we have some muscles of suspicion. We have to strengthen them. We have to know our own self. What are my biases? What are my prejudices? How reliable are the sources of information that I read on social media? So it is really important to have scientific literacy when we talk about the public health. So you can look at the verification platforms. And of course, it is really important to play the role as the verification platforms like TAIT.org and other institutions and organizations such as the Turkish Thoracic Society. Yes, that's why this Congress is very important. We want to eliminate the misinformation, and we are here to provide them with the facilities so that they can use these facilities in order to have access to the facts, not the myths. Well, yes. We wanted to invite people who are effective on social media so that they can share the messages. So, Onur Bey, what to pay attention to, what the end users should pay attention to in order to access the facts. We talked about 5 different themes, especially regarding the argument of the anti-vaccine group. There are some conspiracy theories like global powers, the vaccines having chips and people being inserted with the chips through the vaccines. And there are some other claims which cannot be understood from a reasonable perspective. Another aspect is the correct information, the facts cannot be disseminated immediately, and myths emerge. mRNA vaccines, for example, I mean, there are scientific researches and studies. Although these facts are shared with the people, I mean, people cannot drive lessons, and it will take some time for them to learn those messages. And there are uncertainties, and anti-vaccine group make use of those uncertainties, and they use persuasion campaign. Those are operations for changing the perception of people. There are certain mechanisms they utilize. The first one is feeding on the uncertainty, and the second thing, they find figures, important public figures. For instance, on WhatsApp groups, there are messages circulating like, my old friends brother is a doctor and he said the following. So there is an authority figure that they use in order to persuade people. Although there is no information confirming that it's a fact, people tend to accept those things. And in an uncertainty environment, until there is a certain fact which is clear for people, people tend to believe in the uncertainties. And these are evolutionary mechanisms underlined by Madjan. These are survival mechanisms, paternity and agency. What we refer to as agencies, if something occurs, there is an actor making it happen. So we should be able to describe it. Behind the bush, having a wild animal, during the evolutionary process, we have acquired that if the bush is moving, there is a lion. But I mean, we have to think about it from a reasonable point of view. So when there is an uncertainty in today's world, we have this insight to believe that the assumption, the uncertainty is actual, is real. Patternicity, so that is trying to link things. So linked to patterns. So what we are trying to say is that in a hospital, someone dies, and this is immediately related to a side effect of the vaccine. So that is because of the patternicity. And over time, by being skeptical, by taking into consideration what we read among the sources of information we have available, by exercising our suspicion muscles, we can improve ourselves. Of course, it will take time. The scientific congresses like this one and TAIT.org is also very important. I agree with information literacy. We most of the time underline the fact that we have to be sure about the facts that we read. But I mean, which sources of information are reliable? It is very difficult to measure that because I mean, it can be a magazine, a newspaper, or social media page that we consume every day. All of a sudden, with different motives, there might be some misinformation propagated by that social media page, and all of a sudden the reliable page starts producing some misinformation. And when that happens, you cannot really adapt at once and react at once to the misinformation produced all of a sudden by that previously reliable social media page. So, I mean, we have to check the facts whenever possible by using the sources available. Only a small amount of time left. Mertcan, do you have anything to add? I can mention one thing, which is a minor remark. So there are different motives, economic motives. There are other motives like social status and also being famous. So regarding the economic motive, some anti-vaccine actors have sales on social media, and they are selling some natural stones and vegetable extracts, herbal extracts. And what they sell are those products, and they are selling those products because they are popular, and their popularity is what sells the product rather than the products themselves. In products such as herbal extracts, we can see that these are under the control of Ministry of Agriculture. So it is important to give the message using this Congress. Maybe this type of product should be controlled by the Ministry of Health, which could be better because there are some claims about people's health, and those actors are making those messages more prominent while selling those products. So these actors have economic motives, and they are selling products using the anti-vaccine narrative. So this is really very good piece of information. You can find that on teyit.org. Thank you very much, both of you. Information is very valuable. It's very important. We have to be skeptical and we have to read further, because while buying a product, you have a detailed research in the market. Do not immediately believe in everything you see and you read. Do not take it as a fact immediately. We have to be skeptical, question the source, the quality of the source, and Turkish Thoracic Society, the ministry, public institutions, government bodies, the impartial sites and organizations are here for you to trust, which is very important. And it is really important to question the sources of information when you read piece of information. Thank you very much once again. Thank you for joining us. Have a good Congress. And next question is going to be about COVID and what to pay attention to when you are at home at rest for COVID. Thank you very much. Have a good Congress. Thank you. Thank you for your kind attention.
Türk Toraks Derneği'nin bu yıl ikincisini gerçekleştireceği Halk için Akciğer Hastalıkları ve COVID-19 Kongresi'nde ben de varım. Akciğer hastalıkları ve COVID'in birçok yönüyle tartışılacağı bu kongrede halkımıza alanımızla ilgili bilgilendirmeler yapmayı hedefliyoruz. Geçen yıl oldukça ilgi gören ve halen videolarının izlenme oranlarının çok yüksek olduğu bu konularda güncel bilgileri paylaşacağız. Küresel salgının başından beri COVID-19 ile ilgili bildiklerimiz değişti ve gelişti. İlaçlar konusunda, uygulamalar konusunda farklılıklar oluştu. O yüzden güncel bilgileri edinmek için bu kongreye katılmanızı öneririm. Biz de meslektaşım Doktor Öner Dikensoy ile beraber 27 Şubat 2022 tarihindeki oturumumuzda COVID'i evde geçirirken neler yapmalı, nelere dikkat etmeli sorularına yanıt arayacağız.
Pandemi döneminde sadece ülkemizde değil, dünyanın en gelişmiş ülkelerinde dahil sağlık sistemi üzerinde oluşan yük nedeniyle hastaneler doldu taştı ve çoğu hasta hastaneye ulaşmakta, hekimine ulaşmakta çok ciddi sorunlar yaşadı. İşte tam da bu noktada pandeminin çok doğru yönetilebilmesi için en önemli konulardan biri olan hastaneye ne zaman gitmeli, her zaman hastaneye gitmeye gerek var mı? Evde COVID takip edilebilir mi? Ve evde COVID'i takip etmek için, COVID hastalığını takip etmek için kritik noktalar nelerdir?
Bu zamana kadar en çok duyduğumuz sorular arasında yer alan bu soruların yanıtlarını halkımızla paylaşacağız. Özellikle karantina döneminde evde geçirilen COVID sürecinin bir takım kaygılara yol açtığını, çok farklı seyreden hastalıklarda sık sık sağlıkla ilgili soruların hekimlerden yanıtlarının arandığını biliyoruz. Hatta teletıp uygulamaları bunun için oldukça iyi bir araç. Biz de bu oturumumuzda en sık sorulan soruları derleyip COVID'i evde geçirirken yapılması gerekenleri sizlerle paylaşmak istiyoruz. En önemli kısmı hangi aşamada hastaneye yatmak gerektiği, o zamana kadar kullanılacak tedaviler, alınacak önlemler belki de hastaneye yatış gerekliliğini ortadan kaldıracak. Eğer hastaneye yatış artık gerekiyorsa o zaman da vakit kaybetmeden bir sağlık kuruluşuna gitmenin yollarını konuşacağız. Oturumumuza katılmakla, bizi çevrim içi izlemekle bu sorulara yanıt bulabileceğinizi düşünüyorum. Onun için lütfen takviminizde 26-27 Şubat 2022 tarihini, o hafta sonunu Türk Toraks Derneği'nin Halk için Akciğer Hastalıkları ve COVID-19 Kongresi'ne ayırın.
2 senedir pandemi süresince çok başarıyla yürütmüş olduğumuz bu halkı bilgilendirme konusundaki önemli adımlardan biri olan Halk Kongresi'nin ikincisinde 26-27 Şubat tarihlerinde sizlerle buluşmak, online olarak sorularınızı yanıtlamak ve birlikte olmak için sabırsızlıkla beklemekteyim.
Burada görüşmek üzere. Sağlıkla kalın.
Welcome to the second day of the Pulmonary Diseases and COVID-19 Congress for the Public, organized by the Turkish Thoracic Society. And now we're going to talk about what we should concentrate at home if we have COVID. Thank you very much for your attendance and for your attention. Maybe at your home you were infected with COVID, or maybe your relatives and members of the family were infected with COVID, or you maybe in the future. So if that happens, what you can do at home, what you should concentrate your efforts on. My professor, Dr. Öner Dikensoy, and I will try to inform you about these aspects. Öner, welcome. Thank you very much, Göksel. So, as pulmonary disease specialists, both of us saw patients and followed up COVID patients at home. So, in the last 2 years, this pandemic filled our lives. First, accurate information is required. So how that disease is infected and how the symptoms, how the diagnosis is established, and also for the people to understand this disease accurately, we'd like to share some information over to you. Of course, COVID-19, this infection is a disease caused by a coronavirus. There are 3 ways of transmission. The most common one that we observe is in the form of aerosolization or droplets. So in the air, they can be suspended for a long time. So these are, like while we are speaking, droplets coming out of our mouth. As they are very light, the saliva particles are attached with viruses and suspended in the air for a long time. In such an environment, if you don't wear a mask, it is the most common way of transmission. Another way is In theory, they can be infecting people through the surface contact. If you touch and contact a surface infected or contaminated with a virus and then touch your mouth and eyes, then this may be also another way of transmission, although in theory this seems to be possible, but in practice it is quite rare. That's why wearing masks is very important, because it can prevent transmission to us to a significant extent. That's right, because we spend our time with the loved ones at home, so it's important to protect our loved ones at home. So we need to know how to prevent the transmission. So we frequently hear that, although we take measures, when you just one moment abandon those measures, there were so many patients stating that they were infected. And there is also incubation period after infection. So at home, we spent the time without those measures. So at home, what kind of measures can be taken? World Health Organization recommended 5 steps of COVID treatment. I think it's not in Turkish, but it's in English. There are great pictures and photos in that guideline for the people at home. So there are step-by-step explanations or descriptions what to do at home. First, if possible, isolate yourself in a separate room. If I am infected only, for example, if the other members of the household tested negative, if possible, self-isolate in a room with a window, if possible. If other members of the family will be contacted, or if you have to contact them at home, in the same environment, everyone must wear a mask, definitely, and also there must be a ventilation at home by opening the windows, for example. And distance is quite important. At least 1 meter or 1.5 meter distance should be kept between the individuals. And also the pulmonary tools that we use should be separate at home. And even, Ms. Göksel, the infected person, when you clean your nose, for example, those wastes should be collected in another bag, in a separate bag, and that bag should be tied up very tightly, and it has to be thrown away very carefully. I mean, the other members of the household should not contact any material that I use as an infected person. But most importantly, if you are in the same environment, we need to isolate ourselves as much as possible from the other members of the family. If you have to spend some time together, for example, someone has to bring food to us in our isolated room, they have to wear a mask, and we have to have a good ventilation in that room and at home. So we hear from people around us, when they have sore throat and fatigue, they isolate themselves immediately in order to avoid transmitting the infection to other people. So when to suspect, when to have a doubt, and what should be done for diagnosis, and then we can proceed with what we can do at home. COVID is a viral disease. Because of that, compared to it has similar symptoms like cold and flu. And the most common symptoms include, especially after the emergence of Omicron variant, runny nose, especially sore throat, and also itching in the throat, cough, a fever, and other similar symptoms, sometimes being cold and also trembling, fatigue, malaise, also headache. And if one day before that, in the last few days, if you've been to such an environment where you can be infected with COVID, possibly, in a few days, if those symptoms develop, you should be tested. And of course, for diagnosis and in order to avoid transmitting the infection to other people, that is important. In the first 3 months, everyone tested positive and diagnosed were hospitalized, regardless of whether they had mild, moderate, or severe form of the disease. And now we see such patients at hospital. So there were some challenges in the isolation period, but for a long time, many patients are now followed up at home. What are the reasons for that? Göksel, in the first periods of the pandemic, we don't even remember those days. Everyone may remember very well at TV programs in other countries, foreign countries. So people died on the street like zombies. And also in Turkey, we watched those TV shows, and no one knew what to do, and no effective treatment was available, especially physicians thought that this was the end of the day and we would all die. So in such a period, not only we, but also the whole world crammed all the hospitals with the patients tested positive for COVID and diagnosed with COVID. So even patients who tested negative but had some symptoms were subjected to tomography, and they were hospitalized, and serum and also vitamin supplements, antibiotics, which were available, were given to patients, and some drugs that were considered to be beneficial but then understood to be harmful were given to those people. But in 3 months of time, we could recognize and know the disease, and through some studies about the disease, we could obtain the data more objectively. And we understood that one of the biggest mistakes done at that time was to hospitalize every patient in that way, and that the workload was increased for the healthcare professionals, which might even lead to exhaustion to healthcare professionals, not only for the COVID patients, but you know that even in the most developed countries, the health system collapsed, and even non-COVID patients were harmed and damaged. So the world could understand this very clearly, that hospitals' workload should not be increased, should not be cramped and overcrowded as much as possible. So if possible, we try to follow up these patients at home. It is possible now because we know that there isn't any known effective treatment for COVID disease. It's not always necessary to prescribe any drug or medication for that disease. There are 2 stages. First, after the virus gets into the body, it proliferates in the body and flu-like symptoms develop. This is like 1 week and 10 weeks. After that, in the second stage, if you have an over-immune response, it may lead to lung damage and causes pneumonia, shortness of breath, and respiratory distress. This may evolve to such a stage. For that reason, the group that needs to be hospitalized is that group. Now, to understand that, if you don't have any shortness of breath, if you do not feel fatigue in a way that you can't get up from the bed, and if you don't have any palpitation or shortness of breath, that picture of shortness of breath or respiratory distress is not available. It means you don't have to present to the doctor. Have a rest at home and consume adequate water, and other treatments that we will talk shortly may be adequate, and you may not need to get any test done most of the time. Because of this pandemic, a psychological condition was described, which is coronaphobia. This is pathologic level. So this may be associated with COVID, and they go to the healthcare facilities immediately. So this is one of the most important reasons why that increased workload at hospitals. And there are different scenarios, because this disease also leads to mortality. And you know that there are 300 deaths a day, although started increasing recently. So such numbers, every death is too much. So they still have that fear at home. They try to reach out to a healthcare professional they know in order to understand what they need to do, and it's very difficult to get out of home during quarantine. So what should they do at home? What shouldn't they do at home? As I said before, Göksel, if compared to the normal state, you feel too exhausted and tired when you go for a toilet, if you've become short of breath, in your fingers, in your lips, if there is a bruise or discoloration, if you lose your appetite, you can't eat at all, if you have vomiting, you should definitely present to a healthcare facility or a doctor. And also, you know, very recently, it has been understood that oxygen level is very important in these patients, and this there is a way to follow up this, monitor this at home very easily through pulse oximetry. It is like a clips attached on the finger showing the oxygen saturation on the device. If you have serious symptoms, if this is recommended by a physician to you, you can buy it through online shopping as well, and it is available in almost all pharmacies. And if you buy that device, you can measure your oxygen for a few times a day, which is quite important monitoring method. And in my daily life, many other professionals and colleagues' daily life, they just prescribe this to patients followed up at home. This is one of the most reliable methods that we use and recommend for our patients treated at home. So after learning how to measure saturation levels accurately, from 90 to 90%, they have to be alert, and we don't want that saturation level below 90. And if the saturation level is 95%, it's no problem, because oxygen saturation decreases in lung involvement, and lung involvement is the most concerning symptoms. But if you don't have any complaint or any shortness of breath, so the people may go to hospitals for tomography to see if there is any lung involvement or not. This is very important. In this process, what I observed was in Turkey, maybe in many countries in the world, the diagnostic and treatment. There is an overdiagnosis and overtreatment. There is a basic principle in medicine that we try to educate our medical students starting from the first year. The treatment, if treatment and diagnosis is unnecessarily used, it definitely causes harm. That is why it is very important and it should be highlighted. If patients are followed up at home, if the oxygen level is more than 95%, if there isn't any extreme condition, there is no need for a blood test or tomography either. And also in these patients, apart from the medications that lower the fever because they are symptomatic patients, one of the important problematic symptoms is fever and painkiller. Apart from painkiller and anti-inflammatory drugs, there is no need to prescribe any other medications. Adequate dehydration is important. It's like 10 or 12 glasses of water will be enough. Maybe 15 glasses, maybe more ideal for the people that have fever. And they need to have a good nutrition. They should not decrease their diet, and they should get adequate nutrition. We need to have adequate nutrients in our body, and we have to sleep well, and we should not lie down all the time. Because we need to sit upright in the upright position, and sometimes we need to do exercise and walk inside home because it prevents the closure of the lungs. These are the basic things that can be done at home. There is no need for any test or any medication in general. Paracetamol, for example, is prescribed as an anti-febrile and painkiller medication if there is too much pain. Other painkillers, anti-inflammatory painkillers can be prescribed. And also cough is really disturbing and important trouble when there is no marked lung involvement without being hospitalized and receiving any cortisone. It is possible to cut that cough. There is a cough in the acute phase, and also cough in the other stages of the disease after day 5. This is clearly available in all the guidelines. For example, even drinking milk with honey, and this is very conventional and traditional old methods for children. This is used. The less harmful, most natural methods should be used, up to Odein. Odein is used for the cough treatment in severe cases. And also, especially after the emergence of the Omicron variant, after day 5, we see a picture of bronchitis because there is a wheezing and phlegm secretion. So, in order to expand the airways for a short time, asthma medications can be used for intervention to relieve cough. So antibiotics is unnecessary. Yeah, antibiotics is not indicated. It must not be used. And even I can say that, antibiotics have a negative impact on the throat flora and intestinal flora in our body. You don't do something good, you just suppress your flora and you suppress your immune system when you use antibiotics. What about the chorospine? This was mentioned yesterday in most of the sessions. Its routine use is not recommended if there is no shortness of breath. No chorospine-like medications are recommended. If they are using it for any reason in the past, will not discontinue it. They have to continue taking them. So you explained what needs to be done, what shouldn't be done. So there is also a question about the injection for anticoagulation. It's not needed at all, but if it requires hospitalization in case of shortness of breath, it may be required. So we don't have disease, we have patients. It has a different course of age patient. Cough receptors from the tip of the nose to the throat, they are available everywhere. So it's quite natural that they may cough when they have sore throat. We need to understand the reason for that. And healthy nutrition and diet is important. We should avoid smoking. We should not smoke. And to protect other beloved ones, we need to take some measures to overcome this process, I believe. And also in this process, to avoid anxiety and concerns, they should watch the videos like we produce as Turkish Thoracic Society. I think it will contribute significantly. While following up these patients in this process, what are the mistakes, the most common mistakes people make at home? One of the most important common mistakes, is that they are taking too many medications. It's a kind of standard now. So when you test positive, immediately after that, relative calls or you call a pharmacy so that you receive like 9 and 10 supplements and medications in a bag. And people try to start taking those pills or medications. Unfortunately, in Turkey, which is not a situation in the Western societies and communities, there is a behavioral pattern in Turkey, contrary to Western societies. Even the apartment servants, drivers, and everyone gives you an advice, and this is too confusing for you. People ask you if you had tomography or vitamin, why are you taking this vitamin, and you have to take that antibiotic or that antibiotic, and patients are too confused. Although we warn our patients, some of the patients still make those mistakes, which we can't prevent, unfortunately. Almost all patients can self-isolate consciously. They try to stay at home. They try to protect their members of the family. And I think this is one of the most common mistakes I see. I mean, unnecessary tests, unnecessary medications. But there are some patients who visit physician after physician in order to find solutions for evaluation. I think this is because of lack of information, lack of knowledge. So when they are guided and advised by several different people, if they call the right persons, they can call us and we can assist them. Now we have access to vaccines, and vaccinated people have a milder course of the disease. Hospitalized ones are either unvaccinated or very frequently, I say that they just postponed their booster doses and they got contracted with the virus. So anti-vaccine hesitance, anti-vaccines should not be present in 21st century, but there are many social reasons for that. I mean, to understand them and inform them. So when they have booster doses, full doses, they have flu-like symptoms in Omicron. They may have severe disease, and they have some pulmonary sequela. To protect themselves against that, they have to do their best. There are some questions. I have some complaints. Should I get tested? Definitely. And I was tested positive, but no one at home was tested positive. Do you think that test was not reliable? There are some people in a group that does not get the disease. So frequently the genetic studies, epidemiologic studies will show that if everyone who has a complaint should get tested, everyone should be tested. I should give an example from South Korea. You know that in South Korea, It is one of the best countries that controlled the pandemic well, and this is what lies behind its success. Every patient with a symptom was tested, and after that, so in just 9 and 10 days, retrospectively, every contact person was identified and they were tested free of charge. Everyone who tested positive was isolated, which is quite important because if they have symptoms, they must be definitely tested so that they can prevent possible transmission through isolation. That's why it is too important. In daily practice, I really frequently observe that I follow the patients at home very frequently at many households. Only a few people are infected and tested positive, but the other members may not be testing positive. There are a few reasons for that. The first one is that, as you said, some people maybe transmit in a difficult way and they are not infected easily. And they do not infect easily. You know that PCR tests are not 100% accurate. As soon as the symptoms develop, the positivity rate is around 70%. For that reason, other relatives of the patient I'm testing them definitely again, because maybe in other tests there is a likelihood of being tested positive if it is especially symptomatic. That's quite right. Because contact persons should be warned. That's why it is important to see if there will be other cases and to prevent their new contacts. Self-isolation is not adequate. So that process should be performed well. I mean, that's affiliation, contact tracing. So for the nose, is there any problem using the medications? No. So I think fever varies across people. If the fever is more than 5 days, longer than 5 days, those patients should be followed up very closely, because there are 2 reasons. First, during the proliferation of the virus, they may have flu-like, cold-like fever, and also especially in the immune response stage, when there is a damage in the body, there is fever. For that reason, after day 5 and 7, if there is fever that started on the first day and longer than 5 days, we need to closely monitor these patients, which may be important. Thank you very much, my dear colleague, Professor Nardika, for sharing this information. I'd like to thank Turkish Thoracic Society for giving this opportunity to us. We hope that no one is infected with COVID, even though they are infected. I hope this will be mild, but if you want to stay at home, I hope that this information will be useful for you, for a healthy life for you. Thank you very much. Healthy futures for all of you. Thank you.
COVID-19 mu geçirdiniz? Ya da yakınlarınızdan COVID-19 geçirenler mi var? Aradan günler geçti, aylar geçti, hala şikayetleriniz devam mı ediyor? O zaman long COVID ya da uzamış COVID olabilirsiniz. Uzamış COVID-19 hakkında bilmek istediğiniz her şey bu kongrede. Hepinizi kongremize bekliyoruz.
Türk Thoracic Derneği'nin düzenlediği halk kongresinde de nefes darlığını işleyeceğiz. Hepimizin bildiği gibi nefes darlığı en önemli yakınmalardan biri. Hastalar bu yüzden hastanelerde ve yoğun bakımlarda kalıyor. Neden nefesimiz daralıyor? Bu nefes darlığımız ne zaman düzelecek? İşte bu konuyu halk kongresinde tartışacağız.
COVID-19 en sıklıkla akciğerleri etkilemektedir. COVID-19'a bağlı zatürre geçirdiğimde akciğerlerim tam olarak iyileşebilir mi? Ne zaman iyileşirim? Ya da bu hastalık akciğerlerimde hasar bırakır mı? Bunun gibi sorularınızın cevaplarını bulabilmeniz için sizleri halk kongremizdeki oturumumuza bekliyoruz.
Good afternoon, everybody. Welcome to the Pulmonary Diseases and COVID-19 Congress for the Public, organized by Turkish Thoracic Society. Welcome to our session. We are going to focus on a very important topic. I had COVID when my shortness of breath will be okay. So we have a guest from Istanbul University Faculty of Medicine, Professor Dr. Züleyha Bingöl. We are going to discuss this with Professor Züleyha Bingöl. We had invited another professor from Kocaeli University, Serap Argun Barış. However, last month she had COVID and she said she still has shortness of breath. Therefore, she couldn't make it to the session today. So this is a very frequently observed symptom. As you already know, the pandemic is still ongoing and all across the world, millions of cases are detected. So there are 434 million cases all across the world, and around 6 million people were killed by COVID-19, and 12 million people were impacted by COVID in Turkey, and around 100,000 people were killed due to COVID. Of course, these are the official figures. The real numbers we know are far greater. Therefore, shortness of breath is a very important symptom in COVID-19, and this symptom has to be dealt with. There are millions of people that present to the hospitals and to emergency services with shortness of breath. So, Professor Züleyha Bingöl, what is the importance of shortness of breath? Is it observed in every patient? Why do we have shortness of breath? Who has shortness of breath? Can you talk about those? Yes, of course. I would like to wish all of you a good Sunday. So it has been 2 years since we had the first case in Turkey, and we are now discussing a little bit different topics from where we discussed in the beginning. So, shortness of breath is one of the most negative symptoms. This is one of the most negative complaints, and it can be very problematic. And it is one of our agenda items regarding COVID-19. It's an important complaint. Normally, COVID-19 infection has an impact on the upper respiratory system. Usually, the patients have complaints which are similar to influenza: sore throat, muscle pain, sore muscles, a headache, and also similar things. Shortness of breath is not something that we expect primarily in COVID-19, but in a few number of cases, shortness of breath can also occur. And the reason for shortness of breath is can be an indication that there is a pulmonary problem in that patient. And there might be another reason. In COVID-19, we have to differentiate between two things. So is this infection limited to our upper respiratory system, or is it not limited to upper respiratory system? Did it have an impact on my lungs or my heart? We have to differentiate between these, first of all. So, Professor Bingöl, shortness of breath is an important symptom. It's an important symptom which shows the severity of the disease. Can we say that? And during the pandemic, the severity of the disease, I mean, one of the reasons why people presented to the hospital, was the oxygen saturation. We check the oxygen saturation. If oxygen saturation is below a certain level, there are some hospitalization criteria for treating patients as inpatients. So when should they present to the hospital? What should be the level for oxygen saturation? Majority of the patients, as I said, had mild symptoms. They had mild complaints that started initially. And I mean, those people coming to the hospital and being hospitalized is not always necessary. There are some alerts, there are some red flags. One of them is the shortness of breath. If one person had shortness of breath, then he had to go to the hospital. And if he goes to the hospital, it has to be evaluated from the perspective whether he needs to be hospitalized. So when there is pneumonia, I mean, people have shortness of breath. So there should be a chest x-ray and we need to see whether there is pneumonia. And that pneumonia has some certain severity. And according to the severity of pneumonia, that person can be hospitalized. One of the factors affecting the decision making is the oxygen saturation value of the individual. Usually it has to be, we want it to be higher than 90%. In all values lower than 90%, the person has to be hospitalized and there has to be some oxygen support. And in such a case, we have to take the case seriously. So when there's shortness of breath, we need to check the other criteria. And when there's shortness of breath, individuals should present to the hospital because that can have an impact on the severity of the disease. Thank you very much for the clarification. So let me summarize by saying that shortness of breath is an important symptom. And I mean, there might be an underlying situation which is serious. And the most important organ, the lungs, might be affected. It may not be the only reason. Maybe not only lungs and other organs might be affected. That might be the reason for the shortness of breath. The heart, the muscles, and our liver and our kidneys and maybe veins, our vessel structure have been impacted by COVID. So it is important to have a perspective with a multiple approach, and we need to approach the situation with a wider perspective. Yes, lungs and heart, these are the most important organs, and when there are problems with them, there might be shortness of breath. And in COVID-19, we know that there might be a clotting problem, and that clot in our veins might be the reason for shortness of breath. Pneumonia in the lungs and also myocarditis and also impact in the heart muscle may also lead to shortness of breath, and the other systems might be impacted, and because of that there might be shortness of breath. And as a result of that, the subjective concern of the disease about the disease may lead to shortness of breath. Well, we should not immediately say that it's because of the anxiety. We need to check the vital organs and have a decision making afterwards, and it has to be done by a medical doctor. Okay, Professor Bingöl, during the pandemic, we heard both from the patients and the medical doctors one word, that is the disease going to the lungs, going down to the lungs. Is it a red flag? When does the disease go down to the lungs? Does it happen in all the cases? What happens when it really occurs? What are the changes in the patient's complaints when the disease goes down to the lungs, and does it cause shortness of breath? What are your comments about all these questions? We would like to consult you on this. So the disease going down to lungs means that there is COVID-19 related pneumonia that developed. And this is not something that we expect in all the cases. This is something that we expect rarely in few number of cases. But if the disease is not limited to the upper respiratory system and has an impact on the lungs, it turns into pneumonia, and there might be different severity levels of pneumonia. It may not happen to everyone. With some people with comorbidities comorbid lung diseases, in immunosuppressive medication using patients, in obese patients, in elderly patients, in cases where there are risk factors, it is probable that the disease goes down to lungs. So coughing, not only coughing, because in a throat infection there might be a cough. Cough can be a red flag, but it is not the only one. Shortness of breath is the most important red flag. And if the fever is not eliminated, then we can have a suspicion that the disease went to the lungs, and we need to have a chest x-ray, and we need to have an inspection of the lungs and the respiratory system overall to see whether there is a severe problem. So there is another thing that I would like to inquire about, which is the impact on the lungs. So, in the lung tomography and the chest x-ray, this is something that we can see. We call it like there are some ice particles in the lungs. So this shows that the disease went down to the lungs. Well, the age is very important. Elderly patients have this, and those with comorbidities, accompanying diseases, need to be very, very careful, because COVID, and also if there are some chronic renal disease, chronic liver disease, and if there are some cancer cases. So these are the risk factors. And usually this group is the group that is hospitalized and that are in the ICU. But it doesn't necessarily mean that the young people will not have any problems, because there might be cases in young cases where there is shortness of breath and respiratory failure, even in young cases. But having this in mind, we have to be more careful with the elderly cases. We also have to emphasize the smoking, because in young smokers, you said that, you mentioned the young people, smokers, who are young. When you smoke, that has a detrimental effect on our respiratory system. So it is a factor that is facilitating the disease going down to the lungs. So that is also another factor we have to emphasize. So regarding prevention, message about smoking: do not smoke, and that is really very important. Quitting smoking and not to smoke is an important prevention factor. So COVID-19, so beyond a simple viral disease, it involves all the organs, and it leads to an oversensitivity reaction. The reaction of the body harms the organs, and one of the reasons where there are severe cases is the oversensitivity. That damage occurs in the lungs, in the heart, sometimes in the muscles, and the liver, and the kidneys are also affected sometimes. So, Professor Bingöl, if there is lung involvement in a patient, so if we have those picture of ice particles in the lung, what should be the treatment approach? Where should these patients be treated, and what should be the treatment modality? So lung involvement will indicate the severity. If there is mild involvement, if the oxygen support is not required, there's good level of oxygenation, then if there is no comorbidity, lung or heart disease, which is a comorbidity because that may have a detrimental effect, if care can be given at home, which is better for social aspect, those factors should be evaluated, and mild cases can be supported as outpatient. But if cases have risky comorbidities, and if they are severe cases, and if there are some social insufficiencies in terms of care, then they have to be hospitalized and treated as inpatient. The medical treatment, the medication, and also oxygen support are the most critical for treatment. High flow oxygen equipment should be used whenever necessary, and also respiratory assistance equipment should be used, and they can go as far as the ICU depending on the severity of the case. The most important thing is the oxygen support, oxygenation. Thank you very much. There's one more thing. COVID-19 has different characteristics, and there is an approach which underlines the fact that since the beginning of the pandemic, COVID-19 patients had problems such as the embolism, atherosclerosis, and vascular occlusion, and there is a lung embolism, pulmonary embolism, and many cases were observed. A lot of medication were used. What is atherosclerosis, vascular occlusion? Does this cause shortness of breath? Because we are talking about shortness of breath, and we are talking about when will it be okay. So it is important to have a good diagnosis, and the right diagnosis will tell us when the shortness of breath will be over. Who should we suspect regarding embolism and vascular occlusion, atherosclerosis? Because this leads to confusion, and from time to time there is over treatment that we might all apply. So pulmonary embolism and vascular occlusion, can you please talk about that a little bit? COVID-19, I mean, shortness of breath is not only caused by the pneumonia and the inflammation, and also embolism can also cause shortness of breath. We have to observe the cases: low level of oxygen, chest pain, shortness of breath. In such cases, we should be skeptical, and we have to have tomography, and when we see embolism, we have to use anticoagulants, and that is really very important for us to evaluate. And when there is embolism and shortness of breath as a result of that, there can be hospitalization. So when people have comorbidities that lead to embolism, we have to be more careful. COVID-19 leads to a problem, but of course, when there are people with hormone therapies, with some treatment due to cancer, when they have a genetic disposition or arrhythmia-like problems, in those people with such comorbidities, this is a higher possibility. So shortness of breath and embolism, these are very important. When embolism is detected, anticoagulants should be administered, and also we have to follow up the shortness of breath and when it will recover. So this is really very important as a diagnosis. Can we prevent that? What should we do? COVID-19 patient, can we prevent embolism in COVID-19 patients? What are the scientifically acknowledged facts in the scientific world? Who should use anticoagulants? Not all patients should use this. In mild cases, this is not a requirement. When people are mobile, not bedbound, they don't need to use anticoagulants. But in all COVID-19 cases which require hospitalization, in order to prevent pulmonary embolism, anticoagulants are used, and anticoagulants should be used. When there is a diagnosis and the disease is diagnosed, the treatment can be discussed later. But I mean, in all COVID-19 cases that are hospitalized, in all cases with COVID-19 pneumonia, we administer preventive medication, because hospitalization is a risk of coagulation. So, I mean, being bedbound, and also people under risk, when they are bedbound, when they don't take sufficient liquids, they may have clotting problem, and that also leads to further problems. And if there is chest pain and also shortness of breath getting much more serious when people are sent home for being treated at home, those new developments should be taken into consideration, and people should present to the emergency service. So there are lots of frequently asked questions. There are mild symptoms, COVID PCR positive, so they contracted COVID. So should they use anticoagulants? No, especially for outpatients, they don't need to use anticoagulants. These are not innocent medication. They lead to bleeding, and we had to deal with bleeding during the COVID-19 pandemic. In some groups, in some risk groups, and in hospitalized patients, anticoagulant treatment is necessary. This is an important message to emphasize. So, Professor Bingöl, there is another topic which I would like to consult you. There is pulmonary fibrosis, which is another phenomenon. Some patients have it so severe that they recover, they come out of ICU, but pulmonary fibrosis, the infection in the lungs still continue. What are your recommendations? Who has pulmonary fibrosis? So can you please inform us about that? So when there is pulmonary infection, COVID-19, pneumonia leads to a trauma, a damage in the lungs. And due to that damage, there is inflammation and there are some markers, there are some reactions. And as a result of that, there is a fibrosis, there is a recovery process, but the recovery process is not always healthy. If this recovery process is unhealthy, the fibrosis develops in some of the cases. And this is one of the long-term effects of COVID-19. In the early stage, we may not foresee that. I mean, we may see it months later, and you have to see the situation to evaluate the situation months later, because there is pneumonia that develops, and in lung tomography, there are some symptoms that you can observe later on. And the symptoms, some of the symptoms go away over time, but that also is very much age dependent. Whether there is pulmonary fibrosis or not, that should be evaluated at least 3 months later, and if possible, 6 months later. There might be some indications. So when there is a mild case, in 2 weeks, we expect the symptoms to go away. But if there are long COVID-19 related complaints that people talk about, we need to check the lungs to see whether there was a damage that is caused by COVID-19. We can have an interim evaluation, interim follow-up, and people who had a severe disease or medium level disease, 4 months, 6 months later, they need to be examined once again. 3-6 months later, in respiratory function, in exercise capacity, during the inspection, if there is a finding that should indicate a damage in the lungs, we need to check with tomography, and a pulmonary fibrosis should be checked. And this is a rare case. This is not something that we expect in all the patients to occur. In the past, we have had some experience, and these experiences show that over the years, the fibrosis that were observed in the initial months could disappear in later months and over the years. So we do not have sufficiently long-term follow-up results for COVID-19. We don't know what the result will be, but this is a possibility for all the infections. When the shortness of breath continues, cough doesn't disappear, exercise and effort capacity goes down, we have to consider pulmonary fibrosis, and people should see a chest specialist. This is a congress for the people, and there are some questions that members of audience wants you to answer, and I'm going to mention these questions. Hülya Mersin is asking, due to COVID-19, there are some patients with some ice particles in the lungs. So this is, so I have this, what should I do? So if it is mild, and if the complaints are disappearing and you went to your normal situation, you don't need a follow-up. But if your complaints are ongoing, if it's a medium level or severe disease, 4-6 weeks later, there has to be an initial evaluation. And according to the result of that follow-up, we need to have monitoring visits. At the end of month 3, there should be another follow-up visit. Another question, it has been 1 month since I contracted COVID. The tomography is okay, but shortness of breath continues. What should I do? This is an FAQ. So this is our topic for this session. In 1/3 cases, the complaints may continue, may go longer. Not everyone recovers in the same period of time. If it is longer than 1 month, we have to evaluate the situation. If there is COPD or asthma, which is an underlying disease, maybe COVID-19 led to its exacerbation. Therefore, the optimum treatment of that underlying disease has to be checked. Maybe Yes, maybe anxiety. Anxiety is also affecting people. A lot of people talk about COVID-19, and that might lead to some anxiety. This is how it looks. Yes, after excluding all the other reasons, we have to consider anxiety, and this is the reason with the highest probability. So anxiety related shortness of breath and also lack of exercise because of COVID-19. There's a question related to that. Please let me ask that. Maybe you're going to mention that later. So due to COVID-19, I was in ICU for 2 months. It has been 1 year, but still shortness of breath is not disappearing. I'm still using oxygen support. When will I get rid of the oxygen equipment? 1 year later, still being supported with oxygen equipment. Can it be pulmonary fibrosis? What do you think about this patient? So it might be pulmonary fibrosis because 1 year is a long period of time. 1 year later, there is still a need for oxygen support. There might be some permanent damage, might be, as I say. But I mean, in 15 years of follow-up during the other pandemics in the past, we have seen that in SARS and MERS, long-term damage can also disappear over time. So the recovery will continue and the oxygen need may decrease. But 2 months, the patient stayed in the ICU for 2 months, and that led to loss of muscle. And that may lead to shortness of breath, which will continue for a long time. And recovery will require some rehabilitation process. Maybe there is oxygen support, there is treatment, but something that we overlook is rehabilitation, especially recovering the muscle strength and recovering with the lung functions. It is really important to exercise. And I mean, these are the things that we do not really focus on during treatment. And it can be one of the reasons why shortness of breath does not disappear. We can focus on that. You can recheck how much time you allocate for exercise, for lung exercise. If you do that, I think you will have a better performance. Thank you very much, Professor Bingöl. Our time is over. I believe there are lots of more questions to cover, but I would like to thank you very much for the information you provided. I hope this session has been beneficial for people who listen to us. Thank you very much for joining us. Have a nice week. Thank you very much for having me. Thank you for listening to us on a Sunday. Have a nice week.
Yakınım yoğun bakıma alındı. Durumu çok mu ağır?
Hastamın sepsisi varmış. Ne demektir? Çok ciddi midir?
Yoğun bakımda yatan hastamla ilgili ne sıklıkla bilgi alabilirim?
Hastamın solunumu desteklemek için yoğun bakımda neler yapılabilir?
Yoğun bakıma alınan her hasta makineye bağlanıyor mu? Entübe edildiğinde ne olacak?
Hastam cihazdan ayrılamazsa ne olur?
Hastam ağrı duyar mı?
COVID-19 en zor süreç yoğun bakım ünitelerinde yaşandı. Yakınım yoğun bakımda oturumuyla biz de Halk için Akciğer Hastalıkları ve COVID-19 Kongresi'ndeyiz. Sağlıkla buluşmak dileğiyle.
I'd like to welcome you all to the second day of the public congress. My name is Özlem Edipoğlu, Associate Professor. I'm working at the intensive care unit of a research and training hospital in Turkey. The title of this session is My Relative is in Intensive Care, and we are going to answer some of the questions that crosses our mind. For that reason, we are going to discuss the matter together. My dear colleague, Professor Nalan Adıgüzel. She's from Societypulmonary, Pulmonary Diseases and Surgery, Thoracic Surgery, Training and Research Hospital, ICU. Welcome, Nalan. Thank you. Now, of course, intensive care units, it's a kind of black box for us, closed box for us. I'd like to start with that. What is intensive care? And what kind of a place is an intensive care unit? Could you please inform us about that? Intensive care is a unit where people underlying diseases people are healed. Highest level of support is provided to all organs of the bodies. They are closed units. They are monitored visually, and also they are attached to devices through which they are also monitored. Instant changes and modifications are recorded. Whenever there's a need for swift intervention, we intervene them quickly, and highest level of interventions are implemented in these units. So, whenever there is an indication for intensive care, both in emergency centers and outpatient clinics, are all patients requiring intensive care are severe cases. If a group of patients may be very severe, requiring intensive care, they may need support for intensive care, also for respiratory and circulatory systems. There is also a group of patients who have the potential to become severe, so they are monitored under ICU, and if they deteriorate very quickly, we intervene very quickly. That's why they are monitored at intensive care units. Not all patients are severe, but patients who have the potential to become severe, if we have available beds in ICUs, they are monitored and followed up. For monitoring purposes when necessary, patients that may deteriorate may also be hospitalized in ICU. Specifically for COVID-19, during the pandemic, which patients were hospitalized in ICU? Were taken to ICU? Yeah, we had a very challenging period of 2 years, and we are still going through it because of COVID-19 pandemic. So the indication for intensive care during the COVID-19 pandemic, if there is any shortness of breath, and if there are symptoms, if they need and require oxygen supplementation, we supplement oxygen and we provide and give medical therapy to those patients in ICU. If there is a need for high-level support, if there is shortness of breath in addition to oxygen requirement, these patients have the potential to become worse very quickly. High oxygen therapy is provided. Non-invasive therapies are also implemented. Pressurized respiratory supplementation is provided. And when they deteriorate too much, they are intubated and attached to mechanical ventilator and then monitored. On the other hand, we know that COVID-19 may affect all systems, renal failure, circulatory failure may develop in these patients. In such cases, dialysis can be given and circulatory support can be given to patients at ICUs. So, is every patient ventilated mechanically in ICU? As we said before, everyone has become aware of this term, intubation, and when intubation is performed, what is the process like? Not every patient in ICU is attached to mechanical ventilator. Actually, ventilation is there is a step-wise therapy. Oxygen supplementation, non-invasive, invasive mask use is first preferred if the shortness of breath and respiratory failure cannot be eliminated. Then these patients are intubated by placing a tube in their trachea and they are attached to mechanical ventilator. This is referred to as intubation. We heard it a lot amid the pandemic. They are asking most of the time if the patients have been intubated or not. So intubation indicates that a shortness of breath is so serious until the underlying condition is relieved. By relieving the pain, by enabling them to not to remember this process, they sleep and they are monitored through the ventilator. Yeah, this is a good point. When patients are at ICU, while providing respiratory support therapies, sometimes catheters are placed for close monitoring. Do they feel pain? What would you say about that to inform the public? Pain. Relief pain is very important. Pain control is very important for us. So patients cannot express their pain, and if they feel pain, they may be agitated, anxiety may develop, and this has a negative impact on the course of the patient. For that reason, pain palliation at ICU is quite important. If patients are able to speak, they are asked about their pain as every 8 hours. If patients can feel and express their pain, can't express their pain, we score, or based on a certain scale, their pain. And so we estimate their pain and we give oral or IV painkillers by looking at their body language, for example. All patients at ICU definitely receive painkillers because, as you said, many interventional procedures at ICU are painful. That's why we give IV painkillers to patients, definitely. This is also very important for us because this also impairs the physical parameters when they have pain. For that reason, we need to make sure that our patients do not feel pain. Painkillers are very important to that. And I agree with what you said. Stepwise or cascaded therapy can be given, and sometimes muscle relaxants are given in a way, so to speak, to paralyze patients. Through our therapists, but our first preference, our first choice is to provide pain killing or pain relief therapies. But how long do you treat patients at ICU? So what is the optimal duration of ICU treatment? Is there a certain standard time limit for that? Good question, Aslam. There isn't any optimal or ideal duration for an ICU stay. They may stay for 1 day, one week, or 1 month, or 3 months. Underlying disease is most important determinant. If the underlying disease is relieved or recovered in a short period of time, they can be discharged easily. But if underlying disease is not going to be eliminated, then the stay at ICU will be longer, especially in the last 2 years. In this COVID-19 pandemic, because of the COVID-19, patients that stay at ICU, they have to stay at ICU for a long time, especially when they are intubated, when they are weaned from the device until they get out of the ICU. Um, is much longer compared to the ordinary pneumonia cases in the population. So the ICU stays much longer for COVID-19 patients. Yeah, in COVID-19 pandemic, I think we had maximum duration of 3 months for an ICU stay in a patient. About that person did not have any comorbidity, and that those patients were younger, and it's difficult to estimate the time. In this period, if they cannot wean off from the ventilator, what can we do? What kind of a method do you follow at ICUs? Because there isn't any optimal duration for an ICU stay as long as they need a ventilator. As we saw in the COVID-19 pandemic, lungs are damaged seriously. So for the functions to start again, a long process may be required. What would you say about that? After they are put on the ventilator, when the underlying condition gets better, we decrease the medications that put the patients into sleeping positions. We perform certain tests for the functions, and then we know the patient from the ventilator. Our objective is to discharge patients from ICU to the wards where their relatives can also accompany them. But maybe sometimes the disease does not ameliorate or never ameliorate, or because of long stay at ICU, their muscles may become weaker. Because of these reasons, the patients cannot be weaned off ventilators. So tracheostomy it has to be performed rather than intubation. From the trachea of the patient, a tube is placed into the respiratory system tract, and so they are supported with respiration intermittently or on a continuous basis. They may be referred to palliative care units or long-term care centers where they can be rehabilitated. Tracheostomy is very important. It is important because it is a maintenance treatment because you place a tube. That period that starts with intubation, it has to be continued with tracheostomy when the process will be longer. So this may be a temporary procedure, but patients' relatives may have some concerns because they think that they may need continuous care and they will be attached to the device and machine for a long time. The intraoral hygiene, for intraoral hygiene and for eating, this is comfortable and this is also beneficial for the patient. In order to avoid such concerns and hesitations, to inform our public about tracheostomy, is there anything that you'd like to highlight? Tracheostomy for a group of patients, if underlying disease will be healed, it's a temporary process. After being discharged from ICU, through rehabilitation, their muscles will be improved, their lungs will be improved in a certain time. It takes time, and after they are healed, they can be staying at ICU, and their tracheostomies can be closed. It is essential for a group of patients, definitely, but for another group of patients, if it is a progressive disease, if that's not going to improve at all with age, if that disease is going to be worse, tracheostomy may not be closed. I mean, for the rest of his life, that patient will have that tracheostomy. These are two different groups of patients. So there are different decisions and discussions for both. After tracheostomy is opened, they can be temporary and closed after a while in a group of patients, but in some group of patients, they may still maintain that tracheostomy for lifelong. So the biggest concern of the patient's relatives is that they are staying at ICU for a long time, and they may have difficulty in getting information. In the pandemic. Certain dynamics had to be changed. So how often they can get information from you? Patient relative information is quite important. when a patient is taken to ICU after necessary procedures and interventions are performed, after the treatment is given because of a procedure, the physician informs the relatives instantly after the procedures and about the procedures and the next plan. And after that, every day, a patient's relatives will be called or face to face, informed face to face. After giving information, maybe at night time during the duty time, there may be a deterioration in the state of the patient. After the intervention is performed and after stabilizing the patient relative is called to inform them about the interventions done and also the other developments. I'm talking on behalf of my own ICU. We used to provide information face to face before the pandemic, but to protect the patients and healthcare professionals. And because of the isolation rules, we provided information through phone, telephoning the patient's relatives after the pandemic. But whenever there is a need to inform them face to face, we take necessary measures and inform the patient relatives face to face. While calling them, it may be difficult for the relatives to understand and focus on the matter because they're under stress. In the pandemic, we tried to call the patient relatives as much as possible. Is it possible to visit patients at ICU? It is possible and it must be possible. And it must be a practice. Especially elderly patients feel abandoned because they can't see their relatives and they have concerns and anxieties of their future, and they may be anxious about what is happening to their relatives. This feeling develops in ICU, and this has a negative impact on the course of treatment on the patient in ICU. At least once a day, the patient's relatives should be able to see and communicate with their patients. Unfortunately, because of this pandemic, this was also interrupted. Every ICU has a patient visit procedure which is in place and implemented, but amid the pandemic, to protect the patients and healthcare professionals, patient visits were restricted. There were restricted visits. At my unit, not every day, but we give priority to patients depending on their needs, and then we disseminate it through the time, and we take necessary measures for the patient visit. So you protect the patient relatives and also healthcare professionals and patients. It is important. That's why maybe to visit the patients that are decided by the physicians, we should have an understanding. At ICUs, specifically in the context of COVID-19, these are the patients with pulmonary failures and respiratory and lung problems and abnormalities, but there may be some problems in multiple organs. So what kind of a procedure do you follow at ICU if there are multiple organ involvements? Yeah, all the organs in our body are interacting. First, there may be just a single organ failure, but then multiple organs may be involved. It also applies to COVID-19. It does not involve lung. It also involves a heart, neurological system, and also brain. That's why these patients are monitored closely at ICU so that every failure can be detected and necessary support therapies can be given. Whenever there is a renal failure, dialysis support can be given. If there is a circulatory failure, blood pressure medications can be given, and also mechanical support therapies can be given for the heart. So at ICUs, we can provide all kinds of support therapies to all organs. That is important. As regards awareness, sometimes we inform our public and across the world. This is also highlighted on the 13th of September. There is a day that is celebrated, sepsis. Sepsis is a condition that we want people to be aware of. So when we talk about a sepsis to your patient relative, what is that? What does that mean? Sepsis is due to an infection, changes that occur in the human body. So whenever a microorganism gets into our body, our immune system tries to limit it. If our immune system, because of treatment, cannot contain that infection, then there is a diffuse effect on the body. This is referred to as sepsis in general. Our weapon for that is antibiotics. With antibiotics, we try to contain it. But despite therapy, despite treatment, if the immune system of that person cannot contain it and control it, so sepsis may be a disease that we see. This is one of the most common reasons for ICU stays. Another importance of sepsis is that mortality is much higher in septic shock. Because there's a low blood pressure in septic shock, and this may be critical, so it is important to recognize it. Thank you very much. So, when we put our patients in ICU, they are intubated for respiratory support. So, but how are they fed? Feeding at ICU is important. If the person has a consciousness and can feed orally with the support of a nurse, patients can feed orally. If the patient cannot feed orally, or they are intubated and attached to a mechanical ventilator, we, with the help of a tube, we feed them with formulas. And we follow it, we monitor it, and daily calorie intake is controlled. Sometimes the gastrointestinal tract of that person may not be used, so special solutions designated for that purpose, designed for that purpose, is used to feed patients. There are teams of feeding at ICUs, and those teams visit patients every day to see if they have taken the calorie necessary on a daily basis. So after respiratory failure develops, after extubation, they may start oral feeding. First, slowly, they used to get used to it, and then they get back to normal feeding. How about the care of patients? We need to have certain structure because they may stay at ICU for months. What would you say about that? At ICUs, personal care, oral hygiene, and also skin cleaning, body cleaning, and also hair cleaning is done by healthcare professionals when necessary, more than once in a day. Another care is required for positioning because sometimes ulcers may develop due to lying down on the bed on a continuous basis. So they are put in recumbent position on an occasional basis, so they won't be in the supine position. So we are using prone position a lot in COVID-19 pandemic. So they are placed on prone position from the supine position. One of the most important problems is the polyps, because for 16 months, minimum for 12 hours, they should be in that position sometimes. So when they are in prone position on certain parts of their faces or in contact points on their bodies, piculitis and ulcers develops. No matter how hard we try, this cannot be prevented, but prone position is essential for this treatment. It's an important point for treatment. So they should be cared and ulcers can be healed. What is important is to survive the patient. Of course, our preference is not to create such ulcers, but most of the time they developed, but we cared for them. So of course, people are analgized or anesthetized, and then their medications are given. So muscle relaxants are also given. The duration for that medication depends on the reversal of the underlying condition. Can they get back to the former state after blocking the muscles that much? Could you please share your experience about that with us? So this is a very common question to us from patients' relatives. At ICU, it is a difficult process for patients and also physicians that follow up them. So in this process, depending on the severity of the disease, therapy is provided and they are immobile at that. Because of several reasons, their muscles become weaker. And under normal circumstances, they cannot be discharged if they have severe respiratory failure. some patients can be discharged with ventilators because of chronic respiratory failures, and because of the chronic renal failure, they must be attached to dialysis. But through post-discharge rehabilitation programs, psychological and physical rehabilitation therapies should be maintained for a group of patients. Rehabilitation is very important because it can also be provided. It starts at ICU and continues after post-discharge from ICU. It may be longer, as you said. Physical and psychological damages and harms can be eliminated in time. I hope that in the future, we will not talk about pandemic and COVID. Of course, we can see severe patients at ICUs, and we can follow up the patients that have the potential to become deteriorate. I hope that there won't be any ICU stays for the COVID-19 patients from now on, and I hope that this pandemic can come to a halt. Now, what would you like to say for final remarks? I hope wars will not be here in this world. I hope there will be peace in the world. I wish this for all peoples in the world. Thank you very much. I'd like to thank Turkish Thoracic Society for this opportunity. Thank you.
Türk Toraks Derneği sizler için Halk Kongresi düzenledi. 27 Şubat'ta kongre sırasında elektronik sigara gerçeklerini, çarpıcı gerçekleri tartışacağız. Lütfen bize katılın, sizlerle birlikte tartışalım. Neler konuşacağız? Elektronik sigara, bahsedildiği gibi zararı azaltılmış bir tütün ürünü müdür? Elektronik sigara, sigarayı bıraktırır mı? Yani klasik sigarayı bıraktırır mı? Neden gençler arasında giderek kullanımı artıyor? Ülkemizde yasal mı satışı, pazarlaması, Hiç yasaklayan ülke var mı dünyada? Yoksa elektronik sigara, endüstrinin gençleri yeniden sigaraya alıştırmak için çıkardığı yeni bir taktik mi? Elektronik sigaranın içerisinde kullanılan sıvılar akciğere hasar veriyor mu? Bu yiyecek içeren sıvılar, gıda maddeleri, katkı maddeleri akciğer tarafından kullanılabilir mi? Akciğerimiz sindirim sistemi gibi mi çalışıyor? Akciğer hastalıkları farklılaştı mı elektronik sigaradan sonra? Sadece elektronik sigaranın yarattığı bir akciğer hastalığı var mı? Türkiye'de yasal değilse neden çok kullanımı var ve neden satışı engellenemiyor? Hep birlikte tartışalım mı? Bekliyoruz.
Değerli izleyenler, hepiniz hoş geldiniz. Halk Kongremizin bu oturumu...
Distinguished members of audience, I would like to welcome you to our session.
Sesi az duyuyorum ben. Genel Sekreteri Doktor Aslı Görek Dilektaşlı.
I am the Secretary General of the Working Group on Quitting Smoking. We have a guest this afternoon, Professor Elif Dağlı. Both in national and international arena in the field of tobacco control. She's one of the prestigious opinion leader and scientist. Welcome to our session. Thank you very much. Distinguished members of audience, tobacco products has nicotine, and because of that, they lead to addiction, and the most lethal and mortal diseases, cancer, and also pulmonary diseases, and also cardiac diseases are caused by the tobacco products. And also the tobacco products do not only kill their consumers, and also those people who are around the consumers, and 50% of the whole child population across the world is exposed to tobacco products, and there are some new products in the market, electronic cigarettes and heated tobacco products. And Professor Elif Dağlı, do you think their impact is reduced? I mean, there are some products for which there are claims that the impact is reduced. The heated tobacco products and electronic cigarettes, they are claimed to have lesser effects. So we as doctors, we would like to have harmless products. And when the harm is partially reduced, they are not sufficiently good enough. So for electronic cigarettes, there is nicotine, there are also aromas, and also there might be also some other products like marijuana. So, so there are some products which are used with the equipment, and they are vaporized. So when we talked about the smoking ban, we talked about a smoke-free space, and then they gave us the vapor. The vapor contains the same chemicals, therefore it is not less harmful. So there are also harms which will be detected in the long term. And of course, I mean, where are these claims coming from regarding the less harm? So the tobacco industry authorized and funded some scientists, and as a result of the studies they conducted, there are some claims coming out, but there are some independent scientists conducting studies which show otherwise. So these products are shown to be harmful, and it seems that there is a persuasion operation that is out there. And there is also IQOS. Is IQOS a safe product? IQOS means I quit ordinary smoking. So IQOS, IQOS. So here, young people, Generation Z, they are no longer using the cigarettes. They don't want to use the cigarettes that were once used by the lorry drivers. They don't like the ordinary cigarettes. They like technology. And of course, they like their mobile phones. They like the electronics. So they combined all. And they say that this is a product to be presented to young people, claiming that the harm is reduced. The logic is the following. In the past, the cigarette companies say that in the past, we used to burn the tobacco at 900 degrees. So the tobacco was burned and there was a chemical change and it had a very harmful effect to the lung. It caused cancer, but we are heating it, not burning it anymore. When you heat it, it's the same substances you get, but you have a lesser harm. So they reduce the harm, they claim. So this concept of reducing the harm since 1950s is a claim that they put in the market whenever they are in a bottleneck. So they approach you saying that this is a harmless product. There are filters in the cigarettes, and that's how they figured out with it. They said we put a filter and it's now harmless. The cigarette is now harmless. So industry talk about light cigarettes, filtered cigarettes, harmless cigarettes. They are trying to deceive people because the harm level is not so much different in the new products, which they claim to be reduced harm or harmless. So they are losing clients. So they are in a difficult situation. They need to make a new pitch. That's why IQOS and electronic cigarettes are the new products they present us with. And they say, this is less harm. Use this, please. Electronic, you want new technology. This is how we present it to you. We are no longer using the cigarettes, and this is a new product with technology. They clearly say it in their web pages, and we know that Turkey is one of those countries which they refer to as the top 3 markets. Turkey is going to be one of the top markets. Therefore, we have to be very careful about these products. So, do you think these new products will help people quit smoking? Sometimes we hear from the patients, we read from the media, electronic cigarettes, do they help quit smoking? There is no such evidence. There are some studies which are sponsored by the cigarette industry, and those studies may also show figures, but the methodologically they are statistically faulty. So, the same studies cannot be reproduced by the prestigious scientists. The same products cannot be obtained by the independent scientists. There is a scientist group who are British, and they claim that electronic cigarette is an instrument for quitting smoking, and let's use it for treatment. However, in the UK, there is a bigger group saying no to that. They are producing reports against them. So, there is not only one perspective around the world. Let's not get it this way. So, electronic cigarette or IQOS, there is no evidence showing that they help quit smoking. They help quit ordinary smoking. There is no strong scientific evidence showing that. So you talked about the futures of the new product, and these are appealing to the young generation. What about the rates of use around young people and those underage? In the United States, so in 2017, there was a boom. Between 2018, 17 and 19, around secondary students and high school students, in 1 year, there was an increase by 78%, especially among the high schoolers. So an electronic cigarette type, which looked like a stick, had a nicotine which is 20 times higher than an ordinary cigarette. And they could take it to school, and it looked like a computer. They could hide it like it was an electronic computer item. So those people the adults were surprised because when children inhale all at once, there is a lot of nicotine going to the brain. Nicotine for a developing and growing brain is very harmful, and the neurons are developing until 20 years of age. And in the frontal lobe, which has a control over the memory and decision making, there are some cellular changes and biological changes, and those changes are permanent. And tobacco industry knows that very well. Therefore, I mean, it is really very important to gain young people for the tobacco industry. So do you think this is a trap for starting to smoke? Do you think these products are a trap to start smoking? Yes, I agree with you, Dr. Aslı, because these products, I mean, are not having the target group as those middle-aged and the elderly. They have the target group as the young people, Generation Z. And these are electronic, these are appealing, they look like the high-tech computers, and this is how they were designed because their target group is the young people. There are also some aromas, some flavors. So in electronic cigarettes, there are some new flavors, and you can see those flavors. What are those flavors? Those are the flavors that children had in their food, in their chewing gums, in their sugar confectionery. They use the same aroma, and slowly they are attracting children, and they are trying to make them be addicted to those products. So those flavors should be prohibited. So that is one of the plans. European Pediatric Academy focuses on the food flavors, and it wants to prohibit the use of these flavors in the electronic cigarettes, and it is going to make a statement. It is definitely having an impact on young people. There are some other liquids inside the electronic cigarettes. Are they harmful to the lung health, to pulmonary health? Well, I mean, our body, so when a medication is produced, in order to administer and to check whether it will be healthy once administered, is something as a result reached after long-term studies and the trials. But they produced everything and presented to the market, and they want scientists to conduct studies to see whether it's harmless or not. No, you should prove that it's harmless before you put it into the market. There are some liquids, and as I said, those are flavors. Those liquids contain flavors, food flavors, and there are some bacteria, fungus, and some carcinogenic products. And of course, inside the electronic cigarette, in addition to what I stated, in order to ensure the stability, there's glycerol, propylene glycol, and there are different food flavors which are added. And these have a toxic effect in the lungs, and those have been shown many, many times. And new scientific studies show that, I mean, you are conducting a research on the toxic effect of a substance, and there is substance B, and you are checking whether it's toxic to the lungs for substance A, but there is also A, B, C, D, E substances which are combined to formulate a new chemical, and a completely new chemical substance has some effects on the lungs, some harmful effects on the lungs. These have some different metabolic effect. Therefore, a very significant research has to be conducted. In the United States, there is a group, and on an experimental basis, they look at the effects of these substances on different target groups. For instance, the cinnamon flavor electronic cigarettes, they conducted a study, and they show that the immune system is completely paralyzed once the cinnamon flavor enters the lung. And as you already know, so there was a lung disease that was observed in those people smoking electronic cigarettes, and that started with a cookie flavor. For the first time, a young girl had a pulmonary failure, and they checked what was the type of the electronic cigarette she smoked, and it had a flavor of cookies. That was found out. I mean, they are deceiving us. They are trying to deceive us. And I mean, things what we eat go to the bowels, but when those flavors go to the lungs cannot process them. I mean, you can eat a cookie, but you cannot send a cookie to your lung. When you do it, problems occur and new diseases will emerge as a result of the use of flavors. So in the light of what you stated, ordinary cigarettes cause a lot of harmful results, and these new products will also cause the same harmful results. And in addition to that, will there be other harmful results which will be detrimental to people's health? In the United States, and it is still ongoing, 3 years ago, it was kind of an epidemic, just like COVID-19 pandemic. Young people were hospitalized due to lung failure, and they were sent to ICU, intubated. One had to have a lung transplant, and a lot of them lost their lives. Their common characteristic was smoking electronic cigarettes, and electronic cigarettes were especially, smoking marijuana and vitamin E use with smoking marijuana led to combined lung damage, EBOLI. So that is lung damage due to electronic cigarettes. But later on, the pediatricians conducted studies and they showed that this is an eosinophilic pneumonia, and there is a nodular lung disease. So when you combine all these diseases, you cannot call it a mere damage. So it turned into evolved, D standing for the disease. So it's no longer EVOLI, it is evolved. So there is a different definition that we have in front of us. So all of a sudden, we already had a lot of diseases, and new diseases emerge because of the new products that are put in the market. And it is completely beyond reason to use them and to put them in the market and make people use them. In Turkey, our colleagues talk about similar experience, and they have been sharing this experience. What about their use in Turkey? And are the sales of these products legal in Turkey? In Turkey, the laws say that, so unless there is a permit for sales of a product, it cannot be sold. So it has not been licensed. So heated tobacco products, electronic cigarettes are not licensed, so they are not permitted. Their sales is not legal. How do they find them? They find them in the black market. And how in the black market do they find them? There are different sales points, and there are some groups established for prescription. There are websites, and there are also some courier companies, and some companies sending those illegal products through courier, and we reported them many times after our research. Everything can be followed up in Turkey. However, these cannot be followed up and these cannot be monitored. We are really very sorry about it. Public authorities should be more attentive. They should take measures immediately. There is no time to lose. I would like to emphasize this reminder. There's also another thing that I would like to underline. I mentioned EVOLI, and this is related to marijuana smoking. Mixing marijuana to these products which are smoked. And also there are some other oils. A nurse friend of mine wrote to me and she said that she sees patients using these products, marijuana. This is in Turkish, cannabis. And cannabis, there are some certified blends, and it seems that cannabis is going to become a legal product over time. It will be used for medicine, and if this is not controlled, there might be some other diseases and epidemics. Therefore, we have to be very, very careful about this. This is, electronic cigarettes and heated tobacco products are illegal, therefore they need to be strictly controlled. So especially recently, there is a lot of misinformation by the press to the people. Should those products be taxed tobacco industry, would the tobacco industry be willing to have taxation on the products of this kind? What about the public health consequences thereof? Well, regarding tobacco control, one of the most effective factor is the taxation policy. And tobacco industry wants to control the taxation policy, wants to intervene in the government. So they have these products claiming that they are less harmful. They say that they cannot tax them as much as the ordinary cigarettes, and that is not enough. They have some intermediary associations and foundations. They conduct projects and they implement those projects in order to manipulate people. They say that we are going to harm you less, let's pay less as taxes. So no, these products would kill you, just like the ordinary tobacco products. All types of tobacco products, all types of nicotine products, all type of cannabis products, all additives that enter into your respiratory system are harmful for your health. These would kill you. Therefore, reduced taxation is not right. These products should not enter the Turkish market. There should be no changes in the taxation policy for these products. In Turkey, why illegal sales of these products can't be prevented? I'm talking about electronic cigarettes. So I think if there is a will, this can be prevented. So thanks to this Congress and this session, I would like to invite the public authorities to take action, and I would like to call on for their cooperation with us, because later on there will be damages to people's health, and its cost and loss of lives will be much more significant. So, I mean, if we can stop things from happening without losing lives before people are killed by these products, it would be much better. There are a lot of countries who succeeded in doing that. 47 countries across the world prohibited electronic cigarettes. There is an electronic cigarette ban in those countries. Australia, for instance, the sale and import of these products are prohibited. And nicotine liquid, carrying the nicotine liquid is prohibited. This is illegal. And only with prescription you can get an electronic cigarette. I mean, if you're addicted, then you have to get a prescription to have an electronic cigarette. A lot of countries also had an electronic cigarette ban. For instance, Singapore, it is illegal to carry it. There is a penalty of $1,500. There are lots of country cases. I don't want to list them one by one, being mindful of the time, but we have to underline that an industry, what does it want to do? It wants to make money. In 1950, despite the fact that the industry kills people, still these products are sold, and 8 million people are killed because of this industry every year, and 8 million people lost every year. They need new clients, they need new customers, and they need young people. They are trying to be appealing to new people, to children, so that they can have them on board for a long time. We have to save our children from this industry. Both our medical doctors, the public authority, parents, families, and the people, they all need to work together. And the tobacco industry, they have special groups as the target group. Yes, the tobacco industry has target groups which are adolescents and children. They don't say children, they call it young adults. I mean, this is their terminology, young adults. They don't call them children. However, I also would like to add that, I mean, in groups with different sexual orientation and different racial groups are among their target group. They haunt them. I would like to say, use this word, they haunt them. And because of their vulnerabilities, their addiction can be an easy target. For instance, cigarettes with menthol is a product they want to market. In the United States, there is a ban on menthol. And the reason for that prohibition, for that ban is especially Afro-Americans, 75% of them use these cigarettes with this flavor, and this is menthol, mint flavor, and this is against the human rights. That's why they introduced a ban. This is also very important. The menthol cigarettes in 2020 were banned in Turkey, but on the internet, you can see different websites on electronic commerce websites. There are new products which are sold, and these new products are injected into the cigarette to reformulate the menthol cigarettes once again. So the industry is rapidly developing, and they are trying to be appealing to young people as quickly as possible. We have to be alert, we have to be effective. So we have some questions from the members of the audience following us. One follower asks the following question. A journalist said, if people are using this, then just like Özal, banning the smuggled cigarettes, IQOS should also be legalized and there should be no loss of taxes. So do you think this journalist is right? What do you think about this? Well, the journalist might think that he is right. Well, I have been working in this area for 30 years, and I have to tell you that this is a tactic used by the tobacco industry. Tobacco industry in Turkey, I mean, in order to compete with tekel cigarettes, opened a cigarette company, a factory in Bulgaria, and there was a high rate of smuggled cigarettes to Turkey. I don't know whether this was a facilitated methodology or this was just a coincidence. Then it was stated that there's a lot of loss of taxes, so let's open a factory in Turkey. They opened a factory in Turkey, and the consumption of cigarettes increased by 80% in 10 years, and there was more cancer cases, lung cancer cases, and that was it. So when there's an illegal product, there are policing methods and also other methods that require the authority of the state to stop them from coming. If there are illegal products coming to the market, and if you want to legalize it, not to lose taxes, then you have to legalize the drugs as well, and you have to apply this to the other products. So stop smuggling. This is possible. You can do it. There are methods, and I'm not the one to tell you how to do it as a medical doctor. But if you can't control illegal products coming to the market, do not try to legalize them. Because through our foundation in Turkey at the moment, these products enter the market. I mean, this project of lobbying for legalization of the product is a campaign run by a foundation, because tobacco companies in the past years, they set their targets to include Turkey in one of the top 3 markets, and they are trying to circumvent, because they couldn't do it, they are trying to circumvent the situation. Thank you very much, Professor Dağlı. This is a real pandemic for the humankind, tobacco pandemic, and we should have a strong will to end this pandemic as all members of the society across the world. Thank you very much. Have a good Congress. Thank you. Thank you very much, Dr. Aslı.
önlem almazsak çocuklarımıza ve torunlarımıza yaşanmaz bir dünya bırakacağız.
Biz çocuklara yaşanılabilir bir dünya için, geleceğimiz için fosil yakıtlara dur deme zamanı. Daha fazla geç olmalı.
27 Şubat Pazar günü saat 15'te Halk Kongremizde bunları konuşacağız. Bekleriz.
Distinguished audience, I'd like to welcome you all to the second day of Pulmonary Diseases and COVID-19 Congress for the Public, organized by the Turkish Thoracic Society. We're going to talk about the impact of climate crisis and air pollution on our health. Before we start discussion, I'd like to say a few words. As you all know, this planet that we live on, this world, this globe, was created 4.5 billion years ago, and the human-like creations occurred 4.5 billion years ago. But now, the Homo sapiens, the human species today, came to the planet 250,000 years ago. Our ancestors were hunters and gatherers for a long time. Around 10,000 years ago, they settled and started doing farming because of the climate changes. And 250 years ago in the UK, the first factories were opened, coals were used for power, and also water was vaporized, and the first vapor-generated factories, ships and trains were run. This is referred to as Industrial Revolution. So by the end of 250 years, today, the world is heading destruction. Because of natural reasons, the world have already disappeared so far, and this is going to be the sixth one. And contrary to the previous ones, this is going to be man-made, not through natural causes. Could you please show the slide? So, in the last 250 years, could you please come back to the first slide? This 150 years is Anthropocene, human age, not because of the natural reasons, but for the first time, the nature will be extinct because of the man-made causes. And if you look at the reasons for that, in the last 250 years, the economic and political system was the reason, because in that period, we had the liberal economy or free market economy or capitalism that started. The typical characteristic of that period is that, especially in the last 3 decades, the whole world was influenced by the desire to earn money, and the companies and the system, in conciliation with the government, used the nature as a commercial item and commercial commodity or an object. For that reason, this system, this capitalist system or free market economic system in which profit is generated, polluted our nature, distorted our soils, polluted our waters, and brought our planet into extinction. And now the temperature increased by 1.2 degrees after the Industrial Revolution. If it exceeds 3 degrees, the world will be in a place that we can't live. Could you please show the second slide? Because of that, this is quite vital both for our planet and for the future of humanity. It's quite vital. So, what was the effect of 250 years? There are environmental impacts on the nature. First, air pollution. Climate crisis is the other one. and also loss of biodiversity. The diversity of the living creatures and organisms in the nature decreased by 50%. Acidification of the oceans and seas is another reason, and soil degradation is another consequence. In addition to environmental impacts, there is also other impacts. Until last century, people died because of infectious diseases, accidents, and traumas, but now they are dying because of chronic diseases. And the reason for that is the process in the last 250 years, because the food industry produces high-calorie products leading to obesity, and also automotive industry increase sales of cars. That's why green areas are destroyed and walking ways are destroyed, and also the tobacco industry produces and disseminates the use of cigarettes, and therefore the tobacco-related diseases increase, and fossil fuel industry try to put efforts in order to increase the consumption of coal and fossil fuels. For that reason, cardiovascular diseases, chronic diseases, cancers, and pulmonary diseases increase because of these impacts, economic and political impacts created in the last 250 years. But the wealth was accumulated in only one segment of society, and people got poor. This led to inequalities between the countries and also inequalities within the same country. And in the last 2 years, the COVID-19 pandemic is the result of that destruction in the nature and this ecological destruction. This was created because of this capitalist system and free market economic system. Habitats were destroyed due to industrial livestock husbandry and industrial farming and agriculture, and also the wild animals were destroyed, and some pathogens in those animals were transmitted to people, leading to pandemic. If this goes on like that, it seems that the pandemics will increase and we will see more pandemics. We will discuss about all these aspects in this session. And air pollution, climate crisis will be the specific themes under this session. I'll discuss this matter with a colleague. I'd like to introduce him, Professor Sabahat Genç from Muğla Sıtkı Koçman University, Chest Diseases Department. Sabahat, welcome. Thank you. Sabahat, let's start with one point. What is air pollution? How does it occur? Can you please inform us about that? Right. Thank you very much for this comprehensive introduction. Air pollution, in terms of definition, is the presence of solids, liquids, and gas and foreign items in the air, in the atmosphere for a long time, in a way to harm human health and also ecological balance. And air pollution is unfortunately one of the biggest threats to human health. How does it occur? As you said in the beginning, there is anthropogenic air pollution because of industrialization. In addition to that, there is also natural air pollution force. For example, electricity generation, transportation industry, and fossil fuel use at home for heating, coal, petroleum, and natural gas is an important source for air pollution. And also in mining sector, fuels or mining itself, industrial processes, agriculture, and waste treatment leads to air pollution. As regards the natural sources of air pollution, the volatile organic compounds, volcanic eruptions, and also dusts emitted through winds and fires, and also leasehold spray are the natural reasons. What are the polluters? Which particles or which substances get infiltrated into air? There are several substances, such as particle substances. These are the most dangerous ones. These are really tiny, which are invisible, like 10 micron, 2.5 micron, and also nitrogen oxides, sulfur dioxide, ozone, carbon monoxide. You know, they are emitted through carbon dioxide. It is important in global warming, and also there is whenever there is an ambient air pollution, these particles, bacteria, especially when there is smoking, these are important ambient air polluters. How can we monitor pollution? havaizleme.gov.tr is the website of the Ministry of Environment, Urbanization and Climate Change, where you can follow the data. For air quality, you can see the data from the air stations, air quality monitoring stations. Actually, this shows the air quality. You can check the quality of the air in your location by checking this map. Green, yellow are good, but orange ones are dangerous for chronic diseases. If it is red, everyone is affected negatively. So air pollution affects negatively and distorts the health of people in this way. So what I understand is that there is an outdoor air pollution and indoor air pollution, but they may be interrelated. But in the last 5 and 10 years, outdoor air pollution affected people more, and ambient air quality, air pollution is observed in poor countries. So what are the impacts of them on health? What are the negative impacts? There are several negative impacts of air pollution on health. Scientific studies demonstrated those impacts. You know that chest diseases specialists are interested in this area because this leads to respiratory diseases. They are taken and through the respiratory system, leads to COPD, lung diseases, lung cancer, and cardiac diseases, infertility, reproductive disorders, and congenital anomalies, respiratory tract infections, seizure, and also autism, early birth are the health impacts. Specific to politics also leads to asthma crisis and excessive response to allergens, increased hospitalizations and admission to emergencies, and also increased mortalities when they are taken for a long time. Hydrogen oxides lead to increased respiratory viral infections, especially in children, and shortness of breath in asthma patients, and also sulfur dioxide leads to increased shortness of breath in asthma patients, and also was associated with mortality, increased mortality, and also hospitalization increases because of cardiovascular diseases, mortality associated with cardiovascular diseases, and also mortality due to all causes, and also admission to emergency because of asthma increases. As far as I understand, cardiovascular diseases, seizures, cancers, and chronic respiratory diseases in children, pneumonia, and similar diseases are the results of air pollution. Let's talk about the climate crisis. So, how did it happen? Let's move on. I will move the slides. Cancer effect is important. What is a climate crisis? This is related to air pollution because after combustion, especially fossil fuels, and through other industrial procedures, carbon dioxide, methane, and nitrogen oxides and greenhouse gases are emitted to the air, and they create a greenhouse effect leading to increased temperature heating in the world. As I said, compared to the levels before the industrial revolution, carbon dioxide levels were around 280 ppm for long years. But after industrialization, it now reached and went beyond 414 ppm, leading to almost 1 degree of increase in the surface temperature of the world, and also heating of the oceans and acidification of the oceans. As a result of this increase, the world is like heating car parked under the sunlight. If you like, I can talk about the health effects. Yes, please, about global temperature increased by 1 centigrade since 1880, according to the records of 130 years. The hottest year was also observed, and it led to several events because of the climate crisis. According to the records of 130 years, the hottest 18 years were since 2001, and also glaciers are melting in the northern pole. And also sea level increases by 3.2 millimeters every year, and also carbon dioxide level in the air reached the maximum level in the last 650,000 years. What is that for? is how do they manifest? How do they manifest? After climate change, we all go through this process. There is a record level of temperature, excessive heating, and wildfires. That happened in Muğla in Turkey and also across the world. In most of the countries, there were wildfires and excessive heating and temperatures, extreme weather events, excessive precipitation, hails, floods, and snows. This happened in the Black Sea region, and also increased levels of sea level as a result. Important health outcome risks increased. So what are they? What are these health risks? Injuries in fires, floods, because these are abnormal natural disasters, and also disease and mortality due to heating, and also exacerbation of respiratory and cardiovascular diseases, contagious diseases, because of floods, no access to clean water leads to increased infectious diseases, and also there are some changes in the vector-related diseases as the world heats up and warms up. Some species that were not seen in some parts are becoming common now. For example, malaria is set to increase, and also Zika virus, which is a vector-borne disease. As the world heats up and warms up, they may be spreading more. Several viral diseases due to ticks and mosquitoes will spread further, unfortunately. In addition to that, we suffer from droughts. In some locations, they don't have access to food. That's why there will be some forced migration. As a result, physical and mental health impacts will occur. We still face that today, especially in elderly people, because of the high temperatures, cardiovascular diseases, stroke, hypertension, renal and respiratory system disorders, and metabolic disorders lead to increased risk of mortality. I'll ask you a question, Sabahat. What should we do for air pollution and to prevent climate crisis? What should we do? Because it seems till the end of this century, if we don't do anything, the temperature will increase by up to 3.1%, 1 degrees. And what do we do for that? Because the world will not be livable anymore. But what are the measures taken currently now? Today, every year, especially in the developing countries, because of the increased weather-related deaths and mortalities, the costs on health and damage on health is too much. So what should we do? All countries come together to take some measures. For example, Paris Convention was signed in 2015. In 2021, Turkey ratified it in last November. COP26 convened in Glasgow. Countries came together, but unfortunately, it was not so quick as expected. They cannot take active and rapid actions as expected. We have little time left. So carbon emissions should be reduced. For that, most importantly, we need to phase out of fossil fuels, coal, or energy and power generation from thermal power plants or coal. We need to be away from get rid of these polluting industries. Renewable energy, solar power and wind power are the most important ones, should be introduced and should be put in place. And so the polluting energy sources should be avoided, and we need to make investments in renewable energy sources. And also adaptation should be assured for health. This is happening. This is not imminent. We are living it. We are facing it. Actually, adaptation is quite important. For that reason, health systems should be adapted. And also early warning systems should be developed. In Muğla, we had wildfires, and they could be detected early. We could have taken measures early because we are in the Mediterranean zone and we are impacted by the climate crisis the most, and there was a high likelihood that there would be wildfires in that area, but this was not detected early and no measures were taken. So excessive cold weather and also excessive air pollution can be detected through early warning systems. And also, we need to improve the advocacy of healthcare sector. We need to be involved more in this process. And local administrations Local authorities should also give priority to health in their plans. For example, in Muğla, we are dealing with a cement factory. They should say health first. And also we need to raise awareness. This Congress, this conference for the public is one of them, in order to raise awareness and disseminate information. We can summarize in this way. Thank you. Now in Konya, Climate Council is organized. In October, Turkey ratified Paris Climate Convention, and by 2053 we have net zero decarbonization target. And by 2030, all the thermal power plants are expected to be phased out, and the government will be asked to do so. Another problem is we want to invest in renewable energy, but in Karaburun, wind power plants destroying lives, as geothermal power plants are damaging life in Aydın and Denizli. But of course, this doesn't have to be renewable energy sources governed by the private sectors. They should be governed by the government and local authorities. We need a new energy source, which should not be as a commercial commodity. I agree. Actually, if we see energy as a source of profit, this is not going to solve the energy problem. For that reason, we need new structures and local energy generation and cooperative work in order to generate cheap energy, and this is quite important initiatives. There is also another aspect, because we are in a growth economy, because they are always telling us sustainable development, but we have to defend and advocate for sustainable life, and we need to get smaller to a certain extent, because this economy makes people poorer. So we need to increase welfare, improve welfare. We need to get smaller, and we need to use as much as we need. We should not increase consumption in this new world order. What do you think? Right. I can talk about the carbon footprint. We don't have time for that, sorry. But we need to be aware of our carbon footprints. Let's say something else. We talked about ecological destructions and also their impacts on climate crisis. But in Ukraine, there's a war ongoing. And this war also leads to ecological crisis, destroys the nature. And now in Ukraine, people are dying. Animals dying. The whole nature is destroyed. For that reason, for human health and climate crisis, war is an important risk factor against democracy, rule of law, and equality, which are quite important. We observe once again, and we have to highlight it once again here on this occasion. And finally, is there anything that you'd like to add? We have to act quickly and rapidly. If this goes on like this in 2100, the temperatures will be much higher, and Istanbul and Izmir will be underwater in 2100 if this goes on like that. So everyone has to do its own part as individuals, and governments should have the political determination in order to solve this large problem, taking strong steps. And we say fair and just transformation from dirty energy fossil fuels to renewable energy in an equitable way. We say equitable way or fair and just transformation. The richest 1% is polluting the world 50 times more than the poor people. So the rich is polluting, but the poor is dying. So it has to be equal to all segments of society, I believe. So another point is all physicians, societies, medical societies should promote and protect health as one of their basic functions, and we need to fight against climate crisis effectively altogether. Now you're in Muğla, I know. You work in Muğla. So in Kaz Dağları, in Black Sea region, Muğla are the most important ecological places. I am from there originally, you know. For that reason, we need to be actively, I know that you're also actively involved in such activities and actions. As a physician, as physicians, we need to be involved in these efforts more for the future of our world and for the health of people, I believe. And also ecology associations in Muğla are actively working to this end, right? Yes, there is an action, there is a protest now in Muğla, in the location where they are going to, they are trying to establish a cement factory. I know that area because my childhood was there. For that reason, fighting against that is one of our basic physicians' functions and duties, and it's also one of the basic objectives of the medical societies. Thank you very much for this nice talk, Sebat. Thank you very much. Thank you for your contributions, Professor. Thanks a lot.
Have a good Sunday, everybody. So do not underestimate snoring. This is our title for this session. We are going to talk about respiratory problems during sleep, and we have a very experienced colleague, Associate Professor Baran Balcan from Koç University. Baran, so we are talking about snoring and how much is this frequent? Is there a gender difference? Is it related to age? For instance, I mean, after marriages get older, I mean, people talk about their spouse starting to snore after some certain years of marriage. So, can you talk about its frequency? So, all people snore, and there are lots of excuses about snoring. So, in 30% of females and 50% of males, we can see snoring, and everybody snores at certain stage of their life. They eat a lot, they snore. They were very tired, they snore. They took alcohol, they snore. They are tired, they snore. But if there is snoring, there is a pathology, so there is a need for an intervention, in my opinion. So as people age, there is more snoring because the muscular strength is getting lower as people age, and there is more tendency for snoring as people age. So when people age, there is more snoring, and in marriages, couples come and they complain that 20 years ago their spouse was not snoring, but now they snore. Well, as they age, there is more snoring. That's a fact. What happens? I mean, we know that the sound comes from the upper respiratory tract, but are there any changes or where the sound coming from? Well, yes, at the upper respiratory tract, there are some changes with aging. The airway, I mean, the air we take from the mouth and the mouth, from the nose and the mouth also helps us because it goes to the lungs and there is healthy breathing. But as we age, the soft palate, the hard palate, and also especially in the upper respiratory tract, the structures become weaker and they may lose their muscle tonus, and automatically the snoring may take place. This is related directly to age. So, what about its relation to the weight? So, as people gain more weight, they snore, and when they lose weight, they no longer snore. This is what people say. So, can you comment on that? Well, scientifically, it is related to weight because, I mean, as there is more fat tissue in the throat, the muscle tonus goes down, and depending on the position during sleep, the snoring may occur much more frequently in those patients who gained weight. And when they lie on their back and the tonus weakens, and because of the increased fat tissue, the snoring increases. So when I started working on the sleep in English, simple snoring, I translated that as basit horlama in Turkish. And one of the first patients I had, I told him, you have simple snoring, not apnea. This is a different treatment. But the spouse said, it is not simple snoring at all. I can't sleep until the morning. So snoring, okay. So when people snore, there is a noise and it seems like there is an aesthetic problem. But when there is apnea and stop of breathing, there is a different situation. What is apnea? What is hypopnea? So can you talk about these terms? Apnea is the breath stopping for 10 seconds and more. So the breathing stops during apnea. So 10 seconds and more, the breathing stops. And in addition to that, if there is 30% and more decrease, and if in the blood oxygen there is a decrease, that is hypopnea. So in 1 hour, apnea and hypopnea in total gives us the best measure. So apnea hypopnea index. In the sleep clinic, looking at the current literature, we try to make the arrangements according to the number of apnea and hypopnea. So apnea hypopnea index. So okay, so apnea and hypopnea index and the number of apnea and hypopnea. So this is actively used in the diagnosis of sleep apnea. And those people with sleeping disorders, they learn about the terminology present at the doctor's office. So how do we measure this? I mean, for blood pressure, we have the blood pressure measurement device. And how do you measure this one? If we have a suspicion about sleep apnea, the first complaint, the first symptom is the snoring, and snoring is something described by the other partner. So usually couples come and say that my spouse has a stop of breathing, and during the day these people feel very, very sleepy. And of course, being very sleepy during the day is another indication. They say that I go to bed, I sleep, but I feel very tired during the day. And we apply a test. There are two, options. Polygraphy, polysomnography. There are also simple surveys which can be applied in polyclinics, but these are the two main instruments. Polygraphy is something that can be done at home. Polysomnography is something that requires hospitalization. All stages of sleeping are evaluated, whether there is stop of breathing during sleeping, which position, breathing problems, and arrhythmia, and the blood oxygen levels are all checked according to the polysomnography test. So there are 6 standards according to which we do our checks. So snoring, people talk about snoring and they don't immediately go to the sleep disorder specialist. They go to family physicians and otorhinolaryngologists, the ear, nose, and mouth specialists, throat specialist. So, polygraphy, polysomnography, in order to apply this, do you think snoring is sufficient as an indication? Who should go to sleep disorder specialist? Usually snoring, is it enough? Is it sufficient enough to have it as one indicator, one symptom? I listed snoring. If there is apnea with a witness, that is the most important thing. Usually spouses talk about apnea. And if people feel sleepy despite having slept for long enough, I think everyone should go to the sleep clinic if they have these symptoms. I snore, I have sleep apnea. I came from the sleep laboratory, and you conducted a study and you read the study and you present me with a report. And Baran Bey, you say that as a doctor, you have severe sleep apnea syndrome. So I am not going to talk about the figures and the statistics. Well, so I have severe sleep apnea, and I say that. So we are going to talk about the treatment, but I say I don't want to be treated. If it is not treated, if sleep apnea syndrome cannot be understood, what happens? I feel sleepy during the day. So traffic accidents is one consequence thereof, and I feel very sleepy and I fail at school, I fail at work. And so if sleep apnea syndrome causes these, if not treated, what can it cause? It can cause anything. All chronic diseases are one way related to the sleep apnea syndrome. So cardiac diseases, blood pressure, and diabetes, regional fat tissue, chronic cardiac failure. Sometimes we hear the patient didn't have anything but found dead in bed after going to bed. So there is blood oxygen level going down due to apnea, and people may not tolerate that. There might be cardiac arrest and sudden death. In addition to that, in social life, as you said, concentration problems and traffic accidents may be consequences. If people are professional drivers, there is a requirement. If they have a BMI higher than 30, they have to pass the sleep apnea test. And if they are not treated, they are not given a commercial driver's license. The commercial driver's license is much more important. A lorry driver or a coach driver, if he is not treated, if he has sleep apnea, he may cause death of a lot of people. And some people say that they have a blood pressure problem, they use medication, but that doesn't help. So it may be related to a lot of chronic diseases. So it's really very important to treat it. In my practice, I have seen a lot of patients diagnosed with sleep apnea syndrome. And I mean, after being treated, they reduce the number of blood pressure medication, or the dosage of anti-diabetic medication can be reduced after being treated for sleep apnea. So the message we would like to convey is, if you're snoring, if you have apnea with a witness, if you're feeling sleepy during the day, if you have high blood pressure and diabetes, you have to see a doctor immediately, which will be good for you, definitely. Sleep apnea. So, what are the treatment options? What can we do in order to treat our patients? We always say there is no disease, there is a patient. I mean, so there are different options for different people. Let's say a person has a problem, high tonsils, and I mean, surgical treatment can be a problem. So otorhinolaryngologists can help us, and operation can be one option, and sleep apnea can go away, can disappear. There are simple options for people. For instance, positional therapy. If there is apnea when the person lies on his back, but no apnea on the right hand side, then we have to find some measures to prevent him from lying on his back. He can turn to his side. So, for instance, they used to put a tennis ball on the patient's back. I saw it abroad. That really makes sense. And when he tries to lie on his back, there is a pain because of the tennis ball. Therefore, the patient doesn't turn back. So, positive airway, CPAP, BPAP treatments, these are the other treatment options. So, the mask, yes, the mask. So, people wear the mask while going to bed, and the equipment gives you the air, and the obstructed airway is opened, and that is the cleanest way of treatment. Dr. Baran Balcan, so mask equipment will be used. So you mentioned this option for medium level and for severe sleep apnea. People have prejudices. They are afraid of it. In your practice, what can you say about these equipment? I mean, how many patients refuse these equipment and this machine support? I mean, after using it for once, what are the first impressions? What are the comments by patients? So, I mean, sleeping with an equipment, with an instrument, is something that patients can't accept quite easily. They say, this is such a big mask. No, it is not a big mask anymore. The equipment is less and less noisy, so the equipment instruments are much more silent. In practice, I'm also a sleep apnea patient. I use an equipment. If I had another treatment option, me as a medical doctor, I would prefer that one. But I mean, when you say this to the patients, they are persuaded, and I see reactions from the patients. Usually in sleep practice, we give people the equipment and we just let them go. This is wrong. I call them for a follow-up visit in 2 weeks' time, and usually people say that for the first time I have slept. So during traveling, they say they want to take the equipment with them. And sometimes one of my patients once said that I can give up on my wife, but not on this equipment. I mean, after sleeping with the equipment, the device, they don't want to change their life for the worse, because it has such a tremendous positive effect on their life. When I worked at Istanbul University, I remember a patient wanted to take the equipment that belonged to the university hospital. He wanted to take it with him because he said that it was the first time that he had ever slept. Of course, there are difficulties. There is a mask pushing some air to your lungs. Well, if this is the prescription, if you have problems, this equipment, this device will help you to solve those problems under the supervision of your doctor. So I also would like to underline for members of the audience, I mean, don't complain about me looking at my mobile phone, because I'm looking at my cell phone to follow up with your questions. I receive the questions that you ask, which are arriving in my phone. So, Baran, there are some questions. If I may, I would like to ask those questions to you so that you can answer them. So, when we initially consider this situation, sleep medicine in Turkey is almost 30 years old, and all across Turkey, in almost all chest disease clinics, we have sleep laboratories, and they play a major role regarding the chest diseases. Neurologists and also otorhinolaryngologist specialists also work heavily on the sleep disorders. So the question is, there is a sleep apnea diagnosis, and he is overweight, and he cannot lose weight. And the doctor said, when you use CPAP, the mask, it will be easier for you to lose weight. Is it really the situation for, treatment of sleep apnea? Is it, when you have this treatment, is it easier to lose weight? This is like the egg and the chicken, whether the egg comes from the chicken or the chicken from the egg. Sleep apnea is a fact when you gain weight. As I said earlier on, there is fat tissue that accumulates, and there is pressure from your abdomen to the respiratory tract, and there is more sleep apnea. But you are overweight and you are treated due to sleep apnea. And in sleep apnea treatment, I'm going to talk about some technical knowledge. Oxygenization is much better. It is correct. It happens in the correct way. And free oxygen radicals, they cause inflammation, and they have lung mechanisms, and after lung mechanisms, they lead to being overweight, and this is eliminated. So especially regional fat tissue accumulation is something that we have to talk about. I conducted a study about it. They say the part around your stomach is where is the most problematic, and that regional accumulation of fat tissue is something that we have to consider. So sleep apnea treatment has a positive impact on losing weight. So I read your study, and it talks about CPAP and the positive impact of CPAP. Another question comes. I was not snoring so much. There was a sleep study, and it did not show severe results, but they told me that I had sleep apnea. Is it possible to have sleep apnea without snoring? Well, yes, it is possible. Sleep apnea has different types, different varieties. So central sleep apnea and obstructive sleep apnea. So 90% of people have obstructive sleep apnea, and obstructive sleep apnea may or may not have snoring as an accompanying symptom. When there is central sleep apnea, there are signals from the brain, and there is lack of signals sent from the brain, and because of that, there is sleep apnea, and without snoring, it can happen. So is it possible to treat it? Yes, of course, it's possible to treat it. Positive pressure, airway equipment and devices are used, and there are some other subtypes. So there is a device specifically made for that, and by using it, we can solve the problem. Both of us are adult doctors, and I think we can also provide an answer to this. Is it possible to have sleep apnea in children? So in a multidisciplinary laboratory, you have worked for a long time, and you have also worked with our colleagues who are pediatricians. Yes, we were curious about what happens with the children. Well, it may happen with children under polyclinic conditions. Some children come to the polyclinic, and usually this is related to adenoid hypertrophy, big tonsils, and also other jaw-related problems, structural problems. These may all lead to sleep apnea. If there are some neurological conditions, central sleep apnea may also occur in children, not as much as among the adults, but we should not underestimate sleep apnea. We have another question. In sleep apnea syndrome, there are some treatment methods implemented by the dentists. They are right. Unfortunately, we do not use them in Turkey. They have a significant place in Canada. The Sleep Association, they had the association's president as a dentist. And what can they do? Dentists, where do they play a role? Well, if there is an advanced stage sleep apnea, CPAP, positive air pressure device, is the solution. So far, based on my clinical experience, I have driven this lesson. This is a lesson learned for me, but sometimes in mild and medium level apnea, when there is no mask adherence, when they cannot use the device, some specialist dentists can use some techniques, some structures that they can place in the jaw, and they produce those apparatus that they can place in the mouth according to their mouth structure, and thanks to the contributions of dentists, their sleep apnea can disappear. So some device on the tongue. So I would like to provide an answer to this question. In sleep apnea, Dr. Baran explained that there is a narrowing of the upper respiratory tract, and if we stimulate the muscles, maybe there is a treatment. That was a treatment method that was tried, and it has some side effects, and it was successful partially. Well, of course, long-term use created some problems, and because of that, it is not so much frequently used. But I mean, otorhinolaryngologists, our specialist colleagues, especially in mild cases, mild and medium level cases, in simple snoring cases, up to a medium level of snoring, they use this. And the back part of the tongue, and also with some interventions in the jaw. There are some different treatment modalities, and also they also involve the uvula, the epiglottis. So as I said that there are lots of sleep apnea cases which lead to severe problems. Therefore, these cases should not be underrated. We talked about the drivers, the professional drivers, and I mean, in the legislation. So, do we have to check sleep apnea in professional drivers? Yes, definitely. So, in the health report that they will take from the family physician, if they have a BMI higher than 30, they should be referred to the sleep apnea laboratory. I never had a BMI higher than 30, but if you ask my opinion, all drivers, not only professional drivers, should be controlled with a simple polygraphy, and there should be sleep screening tests for everyone. So I think there are some questions which we should ask people. And there are also some surgeries for losing weight. I received a question about that. We talk about BMI and gaining weight, and there are some metabolic surgeries for losing weight. Do you recommend them? Well, I mean, I always recommend losing weight, not only the metabolic surgeries. If you can lose weight, of course, please lose weight, please do so. That is what we would recommend. If you have some severe sleep apnea, if you are overweight, maybe you're using CPAP, BPAP, after losing 20% of their weight, they get rid of the CPAP. They no longer need it. I mean, it is not necessary for a lifetime. This is not what we assume. If the sleep apnea is because of being overweight, then when you lose weight, you can get rid of this problem, this condition, and you can lose weight on your own, or you may need a metabolic surgery. So people who need metabolic surgery, they are significantly overweight, they are severely obese, and their sleep apnea should be checked before the metabolic surgery. And of course, it is really very important that they are seen by a chest specialist and they are prepared to the operation, because those are not very simple surgical operations. Thank you very much for your kind attention. Thank you for joining us on a Sunday and for sparing your time on a Sunday. We are here with Dr. Baran Balcan, and we talked about a chronic problem which can be a red flag for a lot of health problems. We talked about snoring. So snoring, there is a noise, but there is another aspect, which is sleep apnea. We talked about its diagnosis and treatment. Thank you for giving us this opportunity. Thank you, Dr. Baran. Thank you very much, Professor.
Çamaşır suyuyla kireç sökücüyü karıştırdığım zaman banyoda küvet, lavabo, fayanslar her yer pırıl pırıl oluyor. Bu da beni çok mutlu ediyor. Aslında bir de kötü bir koku çıkıyor ortaya ama sağlığım için zararlı değildir, değil mi?
Sadece Arap sabunu zorlu kirlerde de işe yarar mı? Peki sirke?
Bu iki deterjan aslında aynı. Ama spreyini kullanmak daha pratik. Fark eder mi acaba?
Astımım var. Ev temizliğinde zorlanıyorum. Hangi deterjanları gönül rahatlığıyla kullanmalıyım?
Hamileyim ve bu süreçte yardımcım yok. Bu sürecimde önceden kullandığım tüm deterjanları kullanabilir miyim?
Basitmiş gibi görünseler de bunların hepsi çok önemli sorular. Gündelik telaşlarımız içinde gözden kaçırdığımız ya da ciddiye almadığımız ama baş ağrısından astım ataklarına kadar birçok sağlık sorununa neden olan deterjanlara etraflıca konuşmamız lazım. Bütün bu sorularınıza ve daha fazlasına cevap bulmak için kongredeki temizlik hastalığı beni akciğer hastası yapar mı oturumuza bekliyoruz.
Merhabalar,
Good afternoon.
ben Doktor Dilek Sarıkaya,
My
psikiyatri
name is Dilek
uzmanıyım.
Sarıkaya. I'm
Üsküdar
a
Üniversitesi
psychiatrist
MP
at
Fener Yolu Tıp
Üsküdar
Merkezi'nde
University
çalışıyorum.
at Medical Center
Bugün
of
sizlerle
Fener Yolu.
Necdiye
Today,
hocamızla beraber
together
temizlik
with
hastalığı
Necdiye,
beni akciğer
we'll
hastası
talk
yapar
about
mı
obsession with hygiene,
sunumunu
and
aslında
we will
sunacağız ve
discuss
üzerine de
is my
tartışacağız
obsession
sizin de
with hygiene
sorularınızla
making me
beraber.
pulmonary disease
Öncesinde ben
patient.
biraz
Based on your
temizlik
questions, we'll
hastalığından
discuss this
bahsetmek
matter. I
istiyorum
just
eğer
would like to
hocamızın
talk about the
müsaadesi
obsession with
olursa.
hygiene, if my
Şimdi
professor allows me to do so.
temizlik hastalığı
Of course,
aslında halk arasında takıntı hastalığı
mesophobia
olarak
is a
bilinen
kind of
obsesif
obsession.
kompulsif bozukluğun
It is an
alt
obsessive-compulsive
grubu
disorder.
diyebiliriz.
It's a subgroup of obsessive-compulsive disorder.
Aslında
Obsessive-compulsive
kişinin
disorder
zihnine
is
gelen, ona rahatsızlık veren,
a kind of
fazlasıyla bunaltan,
a
saçma olduğunu
disturbing
bildiği ama bir
situation.
türlü
Although a person knows
engelleyemediği
it is nonsense, it cannot
düşünceler,
be prevented.
dürtüler
These
ve
are
bazen de
thoughts,
imgelerden oluşan
impulses, and
ve bu sıkıntıyı
images.
gidermek için de
And in order to
yineleyen,
avoid
tekrarlayan
that
bazı
distress,
davranışları
there is a
içeren önemli
repeated
bir ruhsal hastalıktır.
behaviors.
Her 100 kişiden
It's an
2-3'ünde
important psychological
görebildiğimiz bir
problem. You can
hastalıktır.
see this
Ergenlik
in
çağında
2 or 3
başlayabilir.
person out of
20-30'lu
100.
yaşlar
It can
özellikle en
start in
sık gördüğümüz
adolescence, and
gruptur.
20s and 30s
Ve
are the
bu
most common
hastalığın
age groups where we see
özellikle
this
temizlikle
OCD,
ilgili olan, daha doğrusu
OCD, and
kirlenme ve
also
bulaşla ilgili olan grubu bugünün de konusu aslında.
today we are going to
Çünkü
discuss the
kişinin
obsession with
bedenine,
hygiene and cleaning.
kıyafetlerine,
Because the body, the
evine,
clothes,
eşyalarına,
home, furniture
kir, pislik,
of a
mikrop,
person
kimyevi madde,
is perceived
yağ,
to be contracted
bazen
with
vücut
dust,
artıklarına
oil, or
bulaştığına
chemical
dair çok yoğun bir
substances
sıkıntı
or body
yaşaması
parts.
ve bu
They feel
sıkıntıyı
very
giderebilmek için
disturbed.
de
In
tekrar
order to
tekrar
avoid
yineleyen bir
and
biçimde ve
overcome this
bazen
distress,
saatlerce
they display
temizlik
repeated
davranışını
behaviors and they
sürdürmesi
clean for hours sometimes.
bizlerin
So
aslında
this
kirlenme
is a pattern of
obsesyonları ve
behavior.
temizlik
These are
kompulsiyonları dediğimiz
related
bir
to
tablo.
hygiene and
Halk arasında ise temizlik hastalığı,
hygiene
titizlik hastalığı
obsession.
olarak bilinen
This
bir
is referred to
tablo.
as
Ve özellikle bu
cleaning
yıkama ve
obsession
temizleme
in
kompulsiyonları da
the public.
az
And
önce de
these
sunumun başında gördüğümüz o
obsessive-compulsive
aslında
disorder
soruları akla getiriyor. Çünkü
or
fazlasıyla işte
cleaning addict
çamaşır suyu
brings
katkılı
about
maddeleri
several
kullanma,
questions that we saw in the
birden
video
fazla
because they
ürünü
use several
karıştırma,
chemical
hem
substances.
cilde
They mix
hem
substances.
vücuda
This
hem
damages and
eşyalara
harms the
hem de
skin,
bunu
body,
hava
and the
yoluyla solunma
furniture.
üzerine
And also
pek
they
çok hani hem
breathe it,
ruhsal
inhale
hem
it.
bedensel
It
hem
has
fiziksel etkileri
physical,
ortaya çıkıyor.
psychological,
Bugün
and
Necdiye Hanım da
bodily
bize bu
impacts.
konu
Necdiye,
üzerine
Professor
oldukça
Necdiye is
ayrıntılı bir
going to
sunum
provide
yapacak.
detailed information on
Necdiye
us
hocamız
on
Necdiye
this topic to
Güngör'de
us.
göğüs
Necdiye
hastalıkları ve
Güngör'de
iş ve
is a
meslek
chest diseases
hastalıkları
specialist
uzmanı
and
kendisi.
occupational
Ve şu anda da Cerrahpaşa
and
Üniversitesi
job-related
Tıp Fakültesi'nde
accidents and
göğüs
diseases at
hastalıkları ana bilim
Cerrahpaşa
dalında
Medical
ve iş ve
School
meslek
as chest
hastalıkları
diseases
bilim dalında
department
doktor
in the
öğretim üyesi
occupational
olarak çalışıyor.
diseases department. She's a doctor. Over to you, Necdiye. Over to you. Thank you. Thank you very much, Ms. Moderator, for this nice introduction. Distinguished participants, I'd like to say good afternoon to all of you. Today I'm going to talk about is my hygiene obsession making me a pulmonary patient? This is the plan of my presentation. It starts with introduction, define and describes the cleaning materials, and then the overall health impacts of cleaning substances and respiratory problems related to cleaning substances, and then I will conclude. In the COVID-19 pandemic, we said first hygiene. We washed our hands, we cleaned our home, and in doing that, we used several chemical substances in the cleaning materials. We used a lot of them and very frequently, but these cleaning substances, are they innocent as we expect? Are they harmless as we expect them? Actually, cleaning is a necessary activity to create an appropriate hygienic living environment. Since all times, various substances have been used for cleaning purposes. As you may guess, in the past, these cleaning substances were quite natural, and we're still using them. For example, soap. Maybe plant-driven and animal-driven. The fats, plant-based and animal-driven fats are mixed with the chemicals, but now they're replaced with artificial chemical cleaning substances. To give an example, detergents. Detergents are made of crude oil through artificial ways. These are very frequently used in our daily life and also in our works. These cleaning substances or materials include several chemical substances and compounds, and some of them are really harmful and poisonous for human health. And cleaning substances create health risk for the person who's doing the cleaning and also sharing the same environment. It also leads to environmental pollution substantially. How does it cause such environmental pollution? When we use these chemicals, they go to the sewage system and infiltrate into water and soil and affect organisms in water and soil and leads to substantial degree of environmental pollution. Cleaning materials contain chemicals for four purposes, complementary purposes, and used on surface. The main purpose is to be surface surfactants, and the second purpose is to care and polish the surfaces. The third purpose is to sanitize the surfaces, disinfection of the surfaces, and the fourth one is to create a nice smell and to eliminate bad odors. And the frequently used cleaning materials are available today, and there are several chemical compounds in those cleaning materials. The most common ones are detergents and also laundry soda, bleach, mixtures and glass cleaners, softeners, and also room perfumes in the rooms, in the cars, the sanitizers, and also caustics. Caustics are used. These are used for cleaning the ovens or dissolve dirt and fat, and also open the drains. So how are they affecting our health? In terms of exposure to cleaning materials, there are certain factors. Amount of cleaning substance. If we put more, it will be more clean as we put, but it's not the case. Of course, the health impacts are more severe in that case. And also the concentration. If the concentration is too much, if you're using it more frequently, health is impacted negatively. Of course, the temperature of the environment where we are exposed to the cleaning substances and humidity and aeration or ventilation, the effects vary. As regards the health impacts of the cleaning materials, chemicals in those materials have acute, instant, and also chronic impacts on health, human health. Cleaning substances affect skin, eyes, and other sensitive organs through direct contact or through inhalation and exposure to volatile compounds and vapors, or through ingestion. Accidents may happen, they may be ingested, and chemical burns may occur. The volatile compounds are vaporized and then infiltrate into the air that we breathe, leading to acute symptoms. And if we are using them in the form of sprays, the density of volatile compounds is increased and we inhale them more. For that reason, the negative health impacts increase further in our patients. As regards acute effects, we may see irritation on the skin, in the eyes, or irritation of the respiratory tract, or asthma attacks. Of course, depending on these cleaning substances, the health effects vary. It may be runny eyes, or irritation in the throat, irritation in the eye, or sneezing, or runny nose. This happens in the bleach, ammonia-containing materials, and also powder detergents and room perfumes. If there is cough or sense of burning in the chest, shortness of breath, or wheezing respiration and respiratory complaints, they mainly use bleach, caustics, oven cleaners, and also liquid detergents, disinfectants, sanitizers, and mixtures, and also hydrochloric acid. So it may be carcinogenic as well in human body, especially sanitizers have formaldehyde, which is carcinogenic. It leads to neurotoxic effects affecting the nervous system. People who are using room perfumes, they have headache and depression more commonly. according to certain studies. Or there may be endocrine disrupting effects. They lead to some disorders in growth, reproduction, and behavior. Of course, we want to have a good smell in the room. They may be emitting good smell, synthetic smells in the room, phthalates or endocrine disrupting substances affecting human health. So who are at risk when they use the cleaning substances? First of all, people actively using them and domestic chemicals, for example, housewives are at risk. But also cleaning persons at workplaces and at homes or domestic workers using these chemicals present to our clinics due to respiratory problems they face. And during the use and consumption of these products, if they are exposed right after the use at home or in the workplace, these people are also at higher risk group. We have vulnerable groups such as children and people having chronic respiratory or allergic diseases are at risk, and pregnant are at risk as well because of the prenatal exposure to domestic chemicals. Respiratory problems related to cleaning substances include if you're exposed to cleaning substances frequently and intensively, there may be important damage on the respiratory ways, such as asthma, chronic bronchitis, chronic obstructive pulmonary disease, which are obstructive diseases in the lung, may be observed in these people. And also, professional cleaning workers may present with respiratory symptoms. They may be diagnosed with asthma. These are occupational diseases, because at my occupational diseases unit, I have lots of patients presenting to me in this category. And if they are working in the cleaning sector, if they have known asthma or chronic bronchitis, after they start working, it is very difficult to control their disease. So work-related asthma is an important reason why patients heavily present to our clinics. And also some of the chemicals trigger allergy. So they may be associated with allergic asthma according to certain publications. There are several perfumes and essence, and they also may lead to asthma as described in some of the studies. I talked about the sprays because they contain more volatile compounds, and people using spray form, the incidence of asthma was found to be higher. In a study, the strongest independent risk factor for asthma was found to be bleach and the frequent use of bleach and cleaning substances. There is a study conducted in Turkey when the bleach and hydrochloric acid is mixed, 55 people presented to the clinic emergency service for respiratory distress. 7 people had severe respiratory failure and 1 person died. In certain groups of people, they are mixing bleach and the hydrochloric acid, HCl, for better cleaning, they perceive so, but this is wrong. It may lead to severe cases and it may be fatal. These 2 chemicals, when mixed together, a chemical reaction occurs and chloride gas is emitted, which is quite harmful and dangerous. And these substances mixed lose their purposes. They are not effective for cleaning. In terms of health effects, they lead to important and significant health problems, especially in the eye, in the throat, in the lungs. They lead to damage. They lead to chemical burns. If exposure time after mixture is long and if the ventilation is not adequate, we see eye and respiratory system irritation in the people who are exposed to that. If there is mild exposure, first, the main symptoms are irritation in the nose, conjunctivitis, inflammation in the eye, and also dry throat, cough, or mild shortness of breath may be the symptoms they present with. But if there is a very dense exposure, if they stay in the indoors for a long time, no ventilation, there may be severe respiratory distress and marked respiratory distress and shortness of breath, headache, cough, and also phlegm, white and pink colored phlegm, maybe the reasons why they present with GI clinics. And also ammoniac and chlorides containing cleaning substances should not be definitely mixed. When mixed together, fatal ammonium chloride gas is created, and ammonium is dangerous for the lungs. If you are exposed to it, chronic bronchitis may develop, and also oversensitivity to airways of the airways may develop. When mixed with chloride, it leads to cancer. In our country, there is a study conducted. 127 housewives with asthma were included. 12% of them reported that their asthma symptoms increased when they used the cleaning materials. And when they asked which cleaning substance they use, 60% of them reported to use bleach, and 34% of them reported that they use HCI. We need to be aware of these invisible chemicals, and some protection measures should be taken while using them. This is important for public health. What kind of measures can be taken while using these substances so that we can avoid these health effects? First of all, we need to read the labels of these substances. We need to know the ingredients. As much as possible, the less harmful cleaning substances and products should be preferred. For example, to wash the baby clothes, we are checking the labels to see less chemicals. They say no alcohol, no paraben, no phosphate, for example. We need to check the content one by one, volatile organic compounds, and also the scents and irritating products that do not contain irritants, and also other combustible substances should be avoided. We should not mix substances like bleach or vinegar or hydrochloric acid. And these materials should not be applied on the same surface one after another. Let's say that we have a liquid surface cleaner. It may contain ammoniac, and when we put bleach onto it, there's chloramine, which is really poisonous, and this leads to significant and serious burns in the throat, and also respiratory problems. There are two types of drain opener. They should not be used together, and we need to avoid pouring those products to another vessel. And spray foams lead to respiratory complaints more. For that reason, we should not use spray foams. We should prefer the liquid ones. We can pour them on a cloth, on a fabric, and then do the cleaning afterwards. So we need to ensure good ventilation, especially in closed areas, small areas like bathrooms and toilets. We need to keep the door open. If any, we need to open the windows or ventilators. And also we need to select safer products and ensure ventilation. So there may not be need to use a protective mask, but we are still using protective masks. We have asthma patients whose complaints have been triggered. So we recommend them to use masks and ensure ventilation, good level of ventilation. And also, it is important to avoid skin impact, because through direct contact on the skin, they distort the skin barrier. It may be itching, burning, or blisters. Many complaints may occur. So what should we do? While using chemicals, we should use gloves, for example, but there is a paradoxal reaction because the hands should also be ventilated and aired. We need to use a suitable hand cream or lotion afterwards. And cleaning substances should be stored in places not accessible to children to prevent accidents. So what should we do for our health? Because we can't get away from cleaning, and this was the case for us in the pandemic. Maybe we can find safer alternatives. For example, warm water and soft soap can be used. And also for surface cleaning, we can use carbonate as an option. Or for the cleaning of the glasses and windows, we can use a mixture of vinegar and water, which may be adequate. In conclusion, cleaning materials contain poisonous chemicals. For that reason, they may be harmful for environmental and human health. So we need to be aware of these harmful effects. This is quite important. To this end, the harmful chemicals and that may be contained in the cleaning products should be avoided. And we need to be aware of the fact that being careless or mistakes done may lead to severe health problems. For that reason, we need to be aware of safe use and storage of cleaning substances. This is important for human health, for environmental health, and for the health of people around us. Thank you very much for your attention. Thank you very much, Necdiye. Thanks a lot for this detailed presentation and for all the information you provided. Regarding this topic, if you have any questions, they will send us the questions. Yes. There is a question. In touristic areas, in hotels, there are several cleaning ladies and cleaning workers, and they are using the cleaning substances. Because of that, many health problems may occur. They talked about it. This was just a comment. That is very important because we know the housewives, but there are professional cleaning workers subsisting on this, and they do not have any idea about the cleaning materials at the hotel. If they don't take necessary measures, if the content is too bad, they do not use the gloves, masks, using it excessively. No ventilation, health effects are quite common. In my occupational diseases outpatient clinic, there are several people admitted. But in the pandemic, the number of the cases decreased by because people paid attention to ventilation and protection. That's why the cases decreased in the pandemic. This is relevant to occupational diseases. There is a comment, another question. In the past, someone working on ammonia cooling system is now COPD, severe COPD patient, and he's a candidate for transplant, lung transplant. Not only in the cleaning substances, but in these areas of work, there may be significant and serious pulmonary disorders that may develop. Ammoniac is really harmful, hazardous for the lungs as well. I recommend this to many people. It is also in the dishwashing detergents. Exposure of that person is much more, I believe, but when I'm using it at home, I prefer the detergents not containing ammonia. But if we have to use them, we have to do it, rinse it twice. We can recommend rinsing twice with water. Thank you. I think we don't have further questions. Let me check again if there are other questions or further questions. As a psychiatrist, I can talk about my experience at the clinic. So people with skin irritation present to us because while cleaning at home excessively, because of that hygiene obsession, they wash their hands with liquid soaps very frequently, excessively, and even for the bodily hygiene, they are, for example, washing their hands and body with water containing bleach. They are never sure about the hygiene, and those materials that should not be used for the skin are used for the cleaning of the body, especially on the hands. They have serious irritation, deep wounds. And in the clinical evaluation, I see these cases very frequently, very commonly related to hygiene obsession. I think skin irritation is quite common, right? Yeah, actually, healing of the skin lesions also an indication of improvement in the mental state, because when the lesions on the hands heal and there are no scars, it is the indication that we are on the right path for the treatment and there won't be any obsession. So cleaning materials, the huge problem I guess for skin irritation. That's right, exactly. There is also another question. Although there are no health problems, warm water, vinegar, and soft soap, are they ideal cleaning materials? For now, these are alternatives at home. These are less harmful for the health. They may be adequate, but of course, we raise awareness across the world. There are green certificate products, especially in the USA. Environmental Protection Agency, EPA, has a website. You can check it there. If you don't think that you do not have adequate hygiene with the carbonate and vinegar, you can check those products on EPA's website for the selection of safe products that have green certificates. I use vinegar and water. I don't use ammoniac or blue water. But sometimes people may not feel so comfortable, so they can prefer products with safer content. Thank you. Thank you. You are right. I think EPA has a list of shampoos, skincare products which are safe. We need to check all of them maybe from EPA's website. So this is important for our personal hygiene as well. We can check it out. Thank you. That's right. That's it, I guess. As far as I see, there are no more questions. Thank you very much for your detailed presentation. I obtained a lot of information from your presentation. Thank you very much. And hope to see you around in another session, hopefully. Have a good day. Thank you indeed. Have a good day.
Merhabalar, ben Türk Thorax Derneği Torasik Onkoloji Çalışma Grubu Başkanı Profesör Doktor Sevin Başar Öncel. Akciğerinizde bir nodül mü tespit edildi? Aklınıza muhakkak şu sorular geliyordur. Bu nodülü ne kadar sıklıkla takip ettirmem lazım? Acaba bu nodül bir an evvel cerrahi işlem ile çıkarılmalı mı? Kanser belirtisi olabilir mi? Yoksa aslında pek de önemli bir bulgu değil mi? İşte sizler de bunları canlı olarak çok değerli hocam Profesör Doktor Pınar Çelik ile birlikte konuşmak istiyoruz. Bunun için 26-27 Şubat tarihleri arasında Türk Thorax Derneği'nin düzenlediği Halk için Akciğer Hastalıkları ve COVID-19 Kongresi'nde sizlerle buluşabiliriz. Akciğerdeki nodülleri konuşacağımız bu toplantımıza 27 Şubat Pazar günü saat 16.30'da Türk Thorax Derneği'nin tüm sosyal medya hesaplarından katılabilirsiniz. Sizler sorun, bizler cevaplayalım. Bekliyoruz.
Welcome to Pulmonary Diseases and COVID-19 Congress for the public. Welcome to our second day of the Congress. My name is Professor Sevin Başar Öncel. I'm the president of the Thoracic Oncology Working Group. We have Professor Pınar Çelik with us today, and we are going to talk about the nodules detected in the lung. Welcome, Professor. Thank you. Yes, in this Congress, in this session of the Congress, we are going to talk about nodules in the lungs. So there is a stain, which people refer to as stain in my lung, the nodules in the lung. Can we define the lungs? So what do we refer to when we talk about nodules in the lungs? So nodules, so we are talking about the diameter of 3 centimeter and less, and there is a pulmonary structure that is around it. So we are talking about a pulmonary tissue around a creation that is 3 centimeters and less of a diameter. So people refer to it as a nodule. So we can refer to it as a nodule. So are they frequent? Lung nodules, well, we do not have strict data about its incidence rate, but there is more lung tomography over the years, and as a result of increased frequency of tomography. So in 1 every 4 or 5 lung tomography, we can see nodules, the appearance of nodules. So we can talk about it as a frequently observed phenomenon. So what can be the symptoms? Are there any signs and symptoms? Usually there are no signs and symptoms. There are no problems caused by it. Usually the chest X-ray and usually the chest tomography show us these nodules. And people do not realize before that it is 3 centimeters. If the diameter is around 3 centimeters, there might be some consequences, but those smaller ones may not be seen in chest X-ray, and we can only see them in chest tomography. These are very small nodules with a diameter less than 3 centimeters, and they may be detected in tomographies that are taken by coincidence due to other reasons. Okay, so Professor, we may see it in chest X-ray and we see them more clearly in tomography. What are the radiological findings? Are they dangerous? Are there any radiological findings which show us that those nodules are dangerous? They have a lot of features. When we see a nodule in the chest X-ray or chest tomography, there are some radiological findings which indicate that this might be of danger, and some of other symptoms may also give us some idea. Looking at the radiological features, so the bigger the diameter, the closer it is to 3 centimeters, the higher the probability about its bad situation. So the structural features are also very important, and the internal structure is very important. If it is solid, it may have a solid characteristic, or it may be subsolid. So these might be the things that we have to take into consideration, and according to their content, the probability increases or decreases with respect to its malignity. So the shape is also very important. So if there is nodulation, if there is modulation, if there are some different shapes around it, and if it is not well defined, and if there are some extensions, it may also make us think about malignity. There might be calcification over time of these nodules. They may be calcified, but if it is highly calcified, it may be of benign nature, maybe due to the other diseases that the patient had beforehand. But if there are like point-like calcifications, this may also indicate the malignity. So in addition to that, in thoracic computed tomography, we can see where they are located. If this is located at one of the upper nodules, it has a higher probability of malignity. But if it is in one of the lower lobes or other lobes of the lung, they have lower probability of malignity. So in these nodules, if during the follow-up in tomography, PET, CT, there are some advanced tests that are applied, and if we can see involvement. So if PET-CT, there are some symptoms that we can see, this also increases the probability of malignity. Another factor is how rapidly it grows. We have to follow up the nodules in a short period of time and over time. And if in a short period of time they grow very rapidly, if they increase their size very rapidly, this can also lead to a high probability of malignity. Of course, it is, very important to detect them, but those which are smaller may not be detected in the chest X-ray. So 10 millimeters, 5 millimeters of nodules cannot be observed in chest X-ray. All these characteristics should be taken into consideration. Thorax computer tomography, PET-CT for thorax, is very important to see these features. So there are nodules of different kind, depending on their size, depending on their localization, where they are located, we can define whether they are malign or they are benign. So only radiologically, are we evaluating them radiologically only, or are there some patient-specific characteristics which have an impact? Without doubt, not only the radiological characteristics we take into consideration in order to decide whether it's benign or malign. So the patient-specific characteristics are very important. Heavy smokers, so they are of high risk. Those who are actively smoking still, or people who quit smoking 10 years, 15 years ago, those are also high-risk patients. And when we see nodules in them, there is a higher probability of malignity. There might be other carcinogenic substances that people have been subject to, exposed to. For instance, if they dealt with asbest soil due to their occupation, if they worked in a shipyard, for instance, where there are carcinogenic substances, if they have been exposed to radon gas for a long period of time, if they are exposed to environmental carcinogenic substances, we have to take it into consideration. Age is an important factor. So nodules can be benign in young people, but in those people who are older, there is a higher probability of having malignancy. So, if there are some other cancers, but lung cancer, if there's a female patient having breast cancer or a bowel cancer in a male patient, when we detect those cancers, we have to consider that they have metastasized in the lung and there are nodules related to that. If there is another cancer, when we detect that cancer, we have to consider the metastasis. And if that is the case, we have to consider the nodules because they may be of malignancy. So other characteristics, some other diseases like chronic obstructive pulmonary disease, emphysema, or fibrosis, pulmonary fibrosis might be among the other diseases. And when these people have nodules, there is a higher probability of having malignancy. Gender, maybe we can consider how to act when we see the nodules in female patients and how to act when we see nodules in the male patients. So solid nodules, when we see solid nodules in the male patients, it may be of malignancy. In female patients, the subsolid or sponge-like structure or partially or complete sponge-like nodules, when we observe them in female patients, we should think about malignancies because these are highly probable in female patients. Okay, so are there any other guidelines? So all tomography or tomography reports, should we keep them when we present at the doctors? Should we take our old tests with us? Should we take our old tomography and X-rays with us? Yes, that is very important. If there is a chest X-ray or tomography taken for other reasons, by looking at the size of the nodule, the shape and the features, the characteristics, the doctor has to observe what has changed over time. That is going to be very important guidance. In solid nodules, in 2 years of follow-up, when there is a change in the structure, in the size, it is of much more importance. But if there are no changes, we may not need to follow up for the small nodules I'm talking about, for those smaller than 1 centimeter and those smaller than 1 centimeter. So if we are seeing solid nodules and other nodules which look like a sponge, it is not enough to follow them up for 2 years, because over longer period of time, they may change shape and they may turn into malignancy. We have to follow them up for at least 5 years. So the size and the shape of the nodule, these are both very important. If they are solid, shorter period of time, follow-up is okay. But if they are in spongiform, then we have to follow them up for a longer period of time. Another important thing we have to pay attention to is, together with the change in the size, it may shrink, it may grow. Do not only consider the growth. Shrinking is an important characteristic. Change of structure, having a different character, may also be an indication for the malignancy and evolving into malignancy. Another important thing that we have to pay attention to is the fact that whether people are in high risk group or low risk group. We have to detect that when we see patient for the first time. There are some findings, people specific findings, for instance, being a heavy smoker, still being an active smoker, and also having COPD or emphysema in those patients. If there are some comorbidities, cancers, or having an older age, if these are the characteristics that are present, these people are in the high risk group. And those changes in people in the high risk group are much more significant. But in a low risk patient, when we follow up them with smaller nodules, we can be much more relaxed depending on the size, the structural features, and the individual risk factors. The follow-up process changes and the procedure changes, and the follow-up intervals also change accordingly. So, of course, we have to look at the risk benefit. We need to conduct risk benefit analysis. Tomography also involves some radiation. We shouldn't have the tomography too frequently, but we shouldn't have too long intervals. There are some international guidelines and we have to follow them. The diameter, smaller, bigger, the individual characteristics and all other features should be taken into consideration, and we need to have the regular follow-up. When there are changes, we need to intervene without losing time so that we can have a definitive diagnosis. Thank you very much. If there is a solid nodule, the follow-up period is 2 years, but if there is a nodule with a sponge-like structure, the follow-up can go as far as for 5 years. So if there is a suspicion of cancer lesion, if there is a high level of suspicion about having a cancer lesion, if there are some risk factors that the patient has, and if we think that there might be cancer in the specific patient, then different treatment modalities should be implemented. So how are these nodules treated? What are the treatment modalities? Can you talk about them as well? Yes, of course. So let me explain by saying that those smaller than 1 centimeter are regularly followed up, and those smaller than 6 millimeters are not required to be followed up according to the guidelines. But if they are 8 millimeters up to 1 centimeter, and if they are bigger than 1 centimeter, 8 millimeter, if there is a nodule bigger than 1 centimeter, in those modules, if this is a risk group patient, older, heavy smoker, active cigarette smoker, if there are some other risk factors, if there is a nodule bigger than 1 centimeter, this definitely should be diagnosed and there should be advanced tests. And if this is not right for advanced tests, then surgical removal of the nodule is the treatment modality that should be considered. When we detect a nodule, the worst case scenario, if it is early stage lung cancer, if the high risk group is the case that we have in front of us, and if there are some malignancy features bigger than 1 centimeter, then we have to decide on the diagnosis with the tissue test. And if this is not appropriate, this has to be discussed in the council. And in university hospitals, in training hospitals, the radiation oncologists, thoracic surgeons, and oncologists come together in a council decision-making process, and those specialists should come together, discuss, and for some patients, the follow-up might be the decision, but in some cases, without waiting further, taking a biopsy, diagnosis with tissue sample, and then using the tomography, and then deciding on the diagnosis. If there are findings for malignancy, then surgical removal of the nodule would be the treatment modality after diagnosis. So I look at the questions that I have. So there is one question: can lung nodule be prevented? So lung nodule, if it is related to a malignant tumor, a lung tumor, well, of course, this is early stage lung cancer. And if this is like a tumor, if this nodule is a tumor, then we can prevent it. So quitting smoking if you're a smoker, and not to start smoking if you have not smoked, if you have not yet been a smoker, would reduce your likelihood of having a cancer. There are some early stage lung cancers, and if you have captured them during the early stage, those can be treated. It is important not to wait for too long. It is very important thing to avoid carcinogenics and talking about carcinogenics, we can talk about smoking, and by quitting smoking or not smoking, you can prevent the lung cancer. And I mean, you have to quit smoking and wait for a long term. And of course, I mean, it is not really late to quit smoking. At every age, you should quit smoking. This is our recommendation. And after quitting, 5 years later, 10 years later, the risk of contracting lung cancer also reduces over time. Another question comes: when people talk about nodule, should I immediately consider that it is cancer? Are there any other diseases? Don't only think about cancer. If there are some malignancy features, you can talk about the lung cancer, but there are some other features. Some nodules are benign nodules. So benign nodules may be related to a lot of things, rheumatoid diseases or rheumatoid disease related lung nodules. People may have nodules due to different infections. So it is important to underline that when a nodule is detected, if it has a sponge-like structure, then that nodule should be followed up. 3 months later, 6 months later, a tomography can help. So 3 months later, when you get the tomography results, you may see that the nodule already disappeared. Maybe it was related to an infection that a person had. So we don't need to do anything further. If antibiotic treatment or in nodules that are treated with any other medication, there are no other treatment modalities because they are already treated with antibiotics. If there is TB related to the tuberculosis TB, there might be some nodules that appear, and there might be some venous tangles. And of course, do not immediately think about cancer when you have nodules in your lungs, but there are people who are in the high risk group. And if there are some features that make us think the cancer, of course, advanced tests are required. And of course, the tissue biopsy and also pathological diagnosis are required in such high risk cases. Another question concerns a young female, 35 years of age, and lung tomography, 4 millimeters of nodule. So I'm not a smoker. I don't have comorbidities. I don't have accompanying diseases. So 4 millimeters of nodule, should I be followed up? What is the size? So what is the threshold after which follow-up is required? Okay, so nodules with solid character and nodules without a solid character that are of spongeous structure. These should be differentiated both for solid and spongiform nodules, those smaller than 6 millimeters, are not recommended for follow-up because their likelihood of causing malignancies is very low. Therefore, having a cost-benefit analysis, tomography, the CT will give you radiation, and there are other factors. Nodules smaller than 6 millimeters are not recommended for follow-up. So for this patient, we can see that this is a nodule of 4 millimeters of diameter, smaller than 6 millimeters. So you don't need a follow-up because you don't have any other risk factors. Due to COVID-19 in the last 2 years, a lot of lung tomographies were taken, a lot of nodules were detected. However, sometimes those nodules during the COVID, they appeared during the COVID-19 infection, and there were some pictures that we refer to as the icy glass. So those small as the frosted glass. So we don't need to follow them up if they are smaller than 6 millimeters. In the treatment of modules, I talked about the treatment of modules. If it has a structure that looks like a sponge, so in the short term, antibiotics can be administered, and with CT, we can control the situation. If it disappears or if it shrinks, we may assume that there will be no problem. Therefore, there is no need for advanced tests. And if it is infectious, if it is related to an infection, then it will shrink automatically, and some benign tumors may also occur due to the antibiotics. If it is a spongiform, we have to follow up after administering antibiotics if it is small. But if it doesn't shrink or go away, we have to look at the criteria for follow-up and do the follow-up accordingly. Another question. My father has a nodule. Should I go to the doctors? Should I have a tomography? So the father has a nodule. Well, of course, the father has to be evaluated in terms of the risk factors. Male patient, is he a heavy smoker, an active smoker? Is there a cancer history in the family? Those should be evaluated. And we have to look at the features, the characteristics of the nodule. So is it in the right upper lobe? Are there malignant features? What is the diameter? What is the size? If there are malignant features, then the father should go for advanced tests. So if the child asking, the father's child, the son or the daughter, has a nodule with high risk factors, we have to consider that the risk factors should be eliminated. And one of the risk factors is smoking. So you should quit smoking. And tomography is an important instrument, but there is a radiation. So radiation is also a risk factor. So we have to have cost-benefit analysis. So if the father has a malignant tumor, then in order to minimize the risk factors, in order to consider the risk factors, one of which can be genetic disposition. If they are smoking, they have to quit smoking as quickly as possible. Thank you very much. In order to summarize, I would like to state that lung nodules are evaluated radiologically. Their size matter, their contours matter, and their radiological report and features characteristics should be taken into consideration. Personal characteristics are important, whether the person is a smoker, genetic disposition, the family history. These are very important. These should be taken into consideration, and those characteristics should be taken into consideration and discussed by a multidisciplinary approach in a team of doctors, and the follow-up can be done, or there might be surgical removal of the nodule. I'm checking whether there are any further questions. There are no further questions. Thank you very much for the explanation. Thank you for the information you shared, which has been really very helpful. Thank you for joining us, and I would like to thank Turkish Thoracic Society and members of the audience for thank you very much for joining us. I would like to thank the Turkish Thoracic Society for organizing this Congress. Thank you. Have a nice day. Stay in good health. Thank you very much. Have a nice day.
merhaba. Türkiye'de akciğer sağlığı ile ilgilenen tüm hekimlerin en önemli derneği olan Türk Toraks Derneği aynı zamanda halk sağlığına yönelik de önemli hizmetler vermektedir. Bu hizmetlerden biri olan Halk için Akciğer Hastalıkları ve COVID-19 Kongresi bu yıl ilgili soru ve sorunlarınıza yanıt bulmayı amaçlıyoruz. Kongre sırasında sadece etkileri sağlığı değil, aynı zamanda sosyoekonomik olarak da önemli sonuçları olan iş yerinde çalışanlar ve onların yakınlarını ilgilendiren, yani kısacası tüm toplumu ilgilendiren bir oturum yer alacaktır. Oturumun konusu iş yerinde COVID-19 ve alınan önlemler.
Good afternoon. I'd like to welcome you all to the second day, the last day of Pulmonary Diseases Congress for the public, and we're going to discuss a very important topic because this pandemic has affected the whole world in the last 2 years, COVID-19 pandemic, and also the implications of it in workplaces and precautions against it at workplaces. When COVID-19 pandemic started as an important source of transmission, workplaces were discussed. After full lockdown, it was understood that this was not a sustainable method, and precautions against COVID in workplaces became very important. So in this session, the member of the environmental affects environmental health working group of Turkish Thoracic Society, Haluk Çalışır, is going to try to answer your questions. I hope we can answer your questions in your minds after his presentation. So how is COVID transmitted at workplaces and what do we do for that? Fatma, thank you very much. Could you please open my slides? Yeah, let's move on. At workplaces, transmission at workplaces is quite important because there are crowded places and many people are there at workplaces. And the most important characteristics of the COVID-19 disease is that it is transmitted in closed areas, closed environments, where a sick person or an infected person with or without symptoms may shed particles containing viruses around himself or herself. So at the beginning of the pandemic, if you look at the transmission mechanism at the beginning of the pandemic, an infected person sheds microscopic particles containing viruses to a certain distance, and then they fall and precipitate on the ground. This was the mechanism proposed, but this is a kind of 1.5 or 2 meters of distance. And in that time, they are suspended in the air for 10 or 15 minutes, and then they collapse or precipitate on the ground. For that reason, since the beginning of the pandemic, mask hygiene and also distance rules were set in workplaces, in community. Personal protective measures were taken. Do you think they are enough? Mask, hygiene, and distance. Do you think they are enough? There are several studies as a result of which it was understood that the transmission route is a kind of different, slightly different, because now relatively larger droplets do not travel greater distances. They could they could be collapsing in a shorter period of time. But according to several studies, it was demonstrated that smaller particles now can travel much greater and longer distances in closed areas, and they can be suspended in the air for a longer time. To give an example, let's think of a workplace, a large workplace, or any person just smokes in an environment. That smoke of that cigarette or smell of that cigarette will cover the whole workplace. If this smoke of the cigarette is virus, it means it could be disseminated across the whole room. So basically, at workplaces, what kind of precautions need to be taken based on all this information as the concept has changed? Yeah, this concept has changed. Now, several measures need to be taken together. So this is a Swiss cheese model. These are stepwise or layered measures. I just list some of them here. Vaccination is important. This is the primary one. All workers, all employees must be vaccinated to protect against mortalities and hospitalization. But of course, for occupational health and safety, ventilation should be guaranteed at workplaces. I mean, the environment, the atmosphere at workplaces should be ventilated, masks should be worn, and there should be fewer people, and shifts should be shorter, organized shorter. And also, very recently, rapid antigen tests were introduced, and this is an important pillar of this protection mechanism. If these are not adequate, mitigating measures can be taken. For example, at the ceiling, ultraviolet lamps can be placed, or HEPA filters, or portable HEPA filters or devices can be installed and used at workplaces additionally. So employees assume an important role for that purpose, I believe, especially those who have complaints related to the disease should recognize them, notice them, and should isolate themselves. Because infected people should recognize the symptoms very rapidly and should be isolated from the environment. This is important. Let's start with ventilation, if you like, because ventilation is one of the most important pillars for that. Because mask, hygiene, and distance are uttered one after another. Sometimes we can't think of other measures, but ventilation should be the first thing to do. Is it complex? No, it is not complex. Just open the windows. This is just classical method. These are conventional methods. Just opening the windows is enough and important. This is natural ventilation. If there are windows in the buildings, and especially if there are two windows open opposing each other in just minutes, in a very short period of time, the environment will be ventilated, because aerosols containing viruses can be suspended in the air, but when the windows are open, they can be cleared off in the environment in just minutes. To make it more understandable, we just should ensure air circulation in the room, so that we can have a safer environment. Of course, we should not be in that circulation. Maybe we can wear something, put on a coat, for example, to avoid cold. But if there are two windows opposing each other, or doors, this is going to create a safe environment for us if we keep them open for a while. Let's see the dispersion or spread. You can see the aerosols after a cough from a person. These are the clouds of particles. So a special technique is used to make it more visible. You can see that this is a cloud of aerosols containing viruses. These are particles spreading to the whole environment, whole space. So imagine a closed area. There are different scenarios regarding the use of masks and presence of windows. On the right-hand side of the screen, you see people not wearing masks and wearing masks. And in the upper side, the cloud, blue cloud, is less. But when they are unmasked, in the vicinity of the infected person and around, that person, they can breathe the blue air coming out of the infected person. When the windows are opened at the bottom of the screen, you can see that when the windows are opened, you can see that blue clouds is cleared off very rapidly. But if the infected person wears a mask, despite the mask, there may be a cloud of microbes outwards. So in the right corner, bottom corner, windows are open. Everyone is wearing a mask. So in that environment, in that space, you can see the air is clean. Only at the top of the ceiling, there is a slight amount blue cloud. For that, ultraviolet lamps can be practiced for possible solutions and appropriate solutions. What about the masks? Yeah, people wear masks, and initially people thought that the masks will not protect you, but it will protect the infected persons. There were some debates about who will wear masks. Who do we wear masks for? Should the infected persons wear masks or also healthy ones? Both of them should wear masks because it will protect the person who wears it. There are 3 types of masks. On the right side, you can see at the bottom that if they are wearing a fabric or cloth mask, only 33 particles out of 100 can be inhaled, so they can get infected. If they wear surgical mask, 25 out of 100 particles will be inhaled. But if they wear FFP2 or N95 masks, you can see the examples here. There are different models of that in different shapes and forms. If they wear such masks to cover the mouth and nose completely with a high filtration efficacy, then only 1 out of 100 particles containing virus will be inhaled. If they wear mask, this happens, and also this happens for the other person around the infected person. So we have a fabric mask, looks great, but no filtration. It only blocks it. When they wear it, so the viruses can be spread. Particles containing viruses may be transmitted to other people around. How long should we use these masks? You can use these masks for a long time. After 4 hours, they say you have to replace them, or after this time, you have to replace them. The basic point is, when the masks are destroyed, worn out, visibly, or dirty, you should replace them. But if not, you can use it for a long time. Contrary to what is thought, you don't have to replace them so frequently. If you feel discomfortable or uncomfortable, you can change it, you can replace it. But we can't say 3 hours, 5 days, or 2 days, or 5 hours. They can be used for a long time because they still preserve their filtration effects for a long time, according to studies conducted. It protects the person who wears it and the other people around. In this slide, you can see there is a surgical mask used, and surgical masks. The most important problem with the surgical masks is that, especially on top of the nose and on the back side, under the chin, there may be some leakage. For that reason, it may not be so safe. And also, it does not cover the nose and mouth completely. And compared to FFP2 and N95, these fabric masks do not have filtration too much. That's why we do not recommend them. So in closed areas, in all closed areas, definitely we need to wear FFP2 masks or other N95 masks. Here, there is a comparison. If there is an infected person and a healthy person, on top you can see female pictures, which are healthy. The red ones, male ones, are sick. If in a closed area, both the infected and non-infected person does not wear any mask, in 15 minutes they can transmit the disease. But as the filtration effect increases, if they are wearing FFP2, both the infected and non-infected person can be protected up to 25 hours in the same place. So there is such a huge gap between the two. So this is a huge recommendation for the use of these masks. But when you use them, we have to be careful about the fitting of the mask on the nose and on the mouth and on the chin. So if you do have to do something somewhere, and if you do not know what's going on around, in just 10 or 15 minutes, we have to keep away and get away from that place. Let's imagine that you're in a market and the workers there do not wear masks. When they see you, they're just wearing the masks when you are inside. But of course, when you get inside, those aerosols are suspended in the air. So it's a risk to stay there for a long time. What about wearing double masks? Just like the surgical mask, there's a problem about the surgical masks to fit on the face. If you wear double masks, it is suggested that it fits better on the face. But what is ideal is that you can wear a surgical mask, and on top you can wear a fabric mask so that it fits onto the surface of your face better. There are different characteristics and criteria for the mask. The two criteria important. Filtration is important. To what extent it filters the small particles, especially N95 masks can filter 95% of the small particles, tiny particles, and also it should fit on the face. So in order to increase its fit, a second mask can be worn in order to improve its filtration effects. To what extent is it reliable to measure the temperature, body temperature at the entrance of the workplaces? We accepted it since the beginning of the pandemic, and we stated it on the different occasions. If this is spread to the world very frequently and very rapidly, infected people, important number of infected people, days before the first symptom is manifested, continue transmitting it. I mean, in society, people may look normal, but they may have high viruses and particles, may shed particles containing viruses. When the symptoms are manifested while entering into the closed areas, by just checking their temperature, we thought that they were sick and we tried to isolate them. But the number of the patients manifesting fever is very low, and also in that time, because they also have viral load, another method was introduced, which is rapid antigen test or quick antigen test. So in a crowded workplace, if there are several employees, if they feel bad, they can do this at home. It is better for them to stay at home. But when they come to the workplace, if they don't have any symptoms, periodically rapid antigen tests can be performed because it gives you the results in just 10 or 15 minutes. And also, just like pregnancy tests, it is easy to apply them. And in this studio, while delivering these speeches, we also don't wear any masks, but because while entering into this studio, and all the people here in this studio, everyone who made a presentation here in the studio performed these tests. As we tested negative, we thought that we would not harm each other, so we don't wear any masks here. This is very important at workplaces as well. If these tests are performed periodically, employees or workers who do not manifest any symptoms but have virus, right at the front of the door, they can be detected and isolated. They can have rest and they can be treated. So in this way, it will be prevented. I mean, transmission will be prevented. There are several countries having this practice. Hopefully, Turkey is also producing and manufacturing these tests. I'm very pleased to hear that from the statements of the minister, especially at workplaces and especially at schools. These tests are introduced and put in place. And also, there are some mitigating precautions. Let's have a look at them. So at the ceilings, at the rooms, ultraviolet lamps can be placed and installed. You mentioned about that. It was a kind of blue glass. it's not in the eye level, but on the top of the ceiling, they can be placed. On the left side in the image, you can see that part is the target. And also on the right side, you can see an example to that, blue lamp. I have a question now. Ultraviolet irradiation, do you think that is harmful for the skin or the eyes? There were people, I saw it in the image, actually this practice is directed towards the ceiling. I mean, people do not see it. Do not see the irradiation. Here, for example, this is a healthcare facility. People are sitting below it, and there is no direct irradiation into their eyes. There are different practices, of course. Maybe they are confused with that. It is possible to perform the surface disinfection with the ultraviolet lamp or radiation. So that lamp, blue light, is turned downwards, but there must not be any person under it. This has been used for many years, especially in the USA. In tuberculosis clinics, we also used it. At our hospitals, we still have them, and hospitals, TB clinics also have it, and also at schools in the US. During the measles outbreaks, they used it as an assisting method. This is quite effective. It is as effective as ventilation. Another method is HEPA filters. These are portable HEPA filter systems. I do not want to name a brand here. Porter Razanta, two scientists, designed a HEPA filter that you can do it yourself. Which one should we use? Which one should we select? We need to be very careful about one point. Different devices are sold claiming that they are filtering the air in the room. These are not HEPA filters. They have bipolar ionization system. So in the room, they create ionization, and they claim that they destroy the viruses through those devices. But there isn't any scientific approach or scientific acknowledgement that they destroy viruses. And devices, bipolar ionization devices produce ozone, and ozone is harmful for human health. So we need to pay attention to that. Another important point is, while buying these devices, we need to pay attention to the volume of the room where you want to use it. If you buy a small one, you cannot make a large room safer. You have to make a calculation depending on the size and volume of the room, and then decide on the size of the device. To sum up what we have discussed, as you can see in these pictures, mask and distance have been focused in certain practices all around. So this creates the perception of safety because of the visibility, but we are not so safe as safe as this one. For that reason, the whole space should be ventilated, and also all the other measures I listed should be taken. I'd like to grab your attention to one point, especially workplaces should be evaluated in terms of risks, depending on their occupations. High risk, very high risk, or classification should be made for the precautions to be taken at workplaces. What do you think? That's right. This is the most basic step. Risk analysis should be performed for each workplace. Depending on the risks in each workplaces, risk factors should be identified and the precautions should be taken accordingly. For example, a hospital is a very high risk place, or family medicine center is a very high risk area. Or if there is a service outdoors, there is not much that risk. Maybe milder forms of precautions can be taken outdoors. So inside hospitals, we need to segregate the places. I'm against the classification of the places as risk or high risk. All healthcare facilities should be considered as very high risk places. That's right. WHO, CDC, and our ministry. Recommended that these masks should be used for the interventions and procedures to be performed on the patients. But the studies showed that patients in the wards or outpatients that are coughing and sneezing have more particles containing viruses, and these particles are small size particles, smaller size particles. So it means that we need better filtration fitting on the face. For example, at all hospitals, healthcare facilities, all healthcare professionals should be provided with these masks free of charge. This is really important. And we do not know which patient will come where. So we need to take our measures depending on each case. I believe so. I agree. What about the shields, face shields? What do you think about the shields? There are a few slides about the shields. Let's talk about sanitation and then I move on to that question, because sanitation is one of the visible practices that we all see. Studies revealed that sanitation is not that important, contrary to what we think. Washing your hands frequently is enough. Instead, just ventilate the environment. And also, there are some shields around the office tables or tables at restaurants. These are transparent barriers. They think that this will create control. This is not useful, contrary to what we think, especially that air containing virus is concentrated in certain areas, not cleaned through the circulation of the air. That's why this is not adequate. What about the shields, face shields? Maybe in high-risk areas or high-risk procedures in intensive care units, for example, we can use those face shields. But it's not as effective as thought, because it's like kind of smoke of the cigarettes. So it can spread everywhere. Thank you very much. Today, since the emergence of this pandemic, especially in the health sector, it led to dramatic results and consequences, as we all observed. It led to several fatalities and mortalities, occupational problems, and workplace problems. So precautions against COVID at workplaces were discussed in this session. I'd like to thank Turkish Thoracic Society for allocating a session for this important topic. Thank you very much. Have a good evening. And I'd like to thank my speaker. Thank you. Have a good day.
Ayrılık saati çaldığı zaman ansızın kurudu dalında bahar. Dilimiz bağlandı sanki bin yerden. Sen sustun, ben sustum, sustu şarkılar. Ayrılık saati çaldığı zaman ansızın kurudu dalında bahar. Dilimiz bağlandı sanki bin yerden. Sen sustun, ben sustum, sustu şarkılar.
Gerçekten sıkıntı toplantıdayız. Arkadaşlarımızın her gün hastalandığına dair veriler alıyoruz. Bu çok ciddi bir şey. Yani biz kardeşiz. Biz meslektaşlarımızla kardeş olmayı öğrenmiş insanlarız. Onların bir tanesinin hastalanması bizim için sıkıntılı bir durumdur. Bunun önlenmesi lazım.
Covid-19 nedeniyle hayatını kaybedenleri yakınları son kez göremeden toprağa vermek zorunda kaldılar. İnsanlar sevdiklerine istedikleri gibi bir cenaze töreni düzenleyemediler. Bir arada olup dayanışmayla hafifleyen yaz süreçlerini yalnız yaşadılar. Yasa dair sağaltıcı hiçbir ritüeli yerine getiremediler. Covid-19 nedeniyle hayatını kaybeden sağlıkçılar birer sayı olarak kalmasın diye onların hikayelerini Biyanet'te yayımlanan Yaşayamazlar mıydı video söyleşi dosyasıyla duyurmaya çalıştım. Neredeyse her gün kaybettiğimiz sağlık çalışanlarının yaşam hikayelerine ışık tutmak, bu ölümlerin önlenebilir ölümler olup olmadığını tartışmak ve tartıştırmak için bu dosyaya başladım. Çalışmamı ve deneyimlerimi aktarmak için ben de Toraks Derneği tarafından 26-27 Şubat 2022 tarihlerinde düzenlenecek olan Halk için Akciğer Hastalıkları ve COVID-19 Kongresi'nde yer alacağım.
Türk Toraks Derneği'nin Halk için Akciğer Hastalıkları ve COVID-19 Kongresi'nin son oturumunda pandemide yitirdiğimiz sağlık çalışanlarını saygı ve özlemle anıyoruz.
Merhaba.
Merhaba Pınar Hocam. Good evening. Good evening, Dr. Pınar Bostan. Hello, Tuğçe Yılmaz. Welcome to the last session of our Congress. As you already know, during the pandemic, we lost a lot of things from our older lives. So we lost our hope, we lost our joy of life. And due to the pandemic, there were some fluctuations in our hope, but we try to regain our hope. And there are some people who we lost for good. And we are going to talk about those people who lost their lives. According to the data on the Turkish Medical Society's webpage, we have lost a lot of people, more than 500. So on the page that is called Black Ribbon, you can see the numbers, and it is really important for us to remember them, and it is really important that they don't stay as numbers. My personal opinion is that this is not sufficient. They deserve more than this. They were mothers, they were fathers, they were sons, daughters, and there were things that they contributed to life. And in this session, especially in this axis, we are going to organize a commemoration event for them. We have a guest with us, Tuğçe Yılmaz. Tuğçe is a journalist, editor, and a researcher. Biyanet K24, 5 letters, newsletter, Karınca, and 1+1 forum. So in many platforms, she has news and she has interviews, but in Biyanet, she has a series of articles which is titled, "Would it be possible for them to survive?" Because this is a concept that people consider as normal, but those are our colleagues who lost their lives, and it is really important to consider what happened to them, and they have loved ones that they left, and she interviewed their loved ones, and she wrote about their lives. Welcome, Tuğçe Yılmaz. Thank you very much, Dr. Pınar Bostan. Wouldn't it be possible for them to survive, to live? So you have the series of articles. This is a research. And what was your motive? Well, I can talk about it, but before that, I would like to thank you very much for your kind invitation, because news like this one are not those that people are highly interested, unfortunately. So, it is really important that people see the value in what I did. So thanks for the appreciation. One of the reasons why I started this file is, during the pandemic, the healthcare professionals lost their lives, and they are not only black ribbon, they are not only numbers. It is really important to make them known to people who survive. Since the beginning of COVID-19, the pandemic, they had to live far away from their parents, relatives, spouses, children, and loved ones. And being a healthcare professional is something difficult. And I mean, they also lost their loved ones, and some of them lost their lives. So people lost their loved ones due to COVID-19 because those were healthcare professionals, and they couldn't bury them themselves. They couldn't touch them. They couldn't say goodbye, and they could not fulfill the rituals. So we couldn't set up the houses for accepting the condolences. And wouldn't it be possible for them to live, survive? So this is an important series of articles, and I wanted to shed light on their life stories, and I wanted to discuss whether those losses were preventable or not. I wanted to have this discussion because I knew that they were no numbers. They were more than numbers. Unfortunately, they are measured with numbers. So when I started working on this series of articles, there were 494. In the Black Ribbon webpage, I can see 550 healthcare professionals who lost their lives. And we shouldn't think that this is something normal. 494 healthcare professionals lost their lives, and you took into consideration the figures that you received from the Turkish Medical Society, age, gender. You took into consideration many breakdowns related to those people who lost their lives. Can you also talk about those breakdowns? Well, I got the basic information thanks to Turkish Medical Society and the Black Ribbon page, but we didn't have the details. So in line with the journalism ethics, I tried to reach the family members of those people who lost their lives. I called the regional chambers, the provincial chambers of medical society, and I would like to appreciate the efforts of Professor Onur Hamzoğlu because he supported me since the beginning of the file and my work. And I received a lot of data, and it shows that the average age of healthcare professionals is 66, 67. So this is based on the data that I received. 43 were pensioners and 450 worked in the field, and 31% of them were in the three big cities, Istanbul, Ankara, and Izmir. And 78% of them were male and 13% of them were female. And this is the same across the world, and we have the same data. Usually the male healthcare professionals lost their lives. And I mean, we can see that those working in the private sector has the higher number, and 66% worked in the private sector, and especially the number of dentists. So especially 87% of them worked in the private healthcare centers regarding the dentist. This data is applicable. And we can see that some of them worked as family physicians. And according to the recent reports published by the Turkish Medical Society, 48 healthcare professionals had comorbidities. So this, I mean, in those comorbidities, we can see diabetes, cardiovascular diseases, hypertension, and some other comorbidities. So during the pandemic, healthcare professionals who had comorbidities were in a high-risk situation. So other public officials had some facilities. They did not go to full-time work. They did not go to the office, but that was not the case for the healthcare professionals. There was a study in the United States titled Lost in the Front Line. So there is also a public database, and they are talking about the healthcare professionals that lost their lives during the pandemic, but they also describe the tragedy that people had to go through, and there are different variables. And for instance, access to personal protective equipment. This is also another important thing that the study shows us. When you compare it with that study, what are the different profiles of healthcare professionals? In terms of age and gender, there are some similarities, but in the other variables, there are not so much similarities, because in the United States, concerning home-based care and also in those low-income groups of healthcare professionals, we can see the loss of lives, and we can see, in low-income positions, Latino and colored skin healthcare professionals lost their lives in the United States. But in Turkey, in those provinces where there was access to personal protective equipment, there were higher cases of those losing their lives. So there was a long time after the start of the pandemic where there were no lives lost. But when we look at China, in the beginning, a significant amount of healthcare professionals lost their lives, but there were some very important and effective methodologies they implemented, and they could prevent the loss of lives.
Socioeconomic inequality in the field of health was also demonstrated here. So in that study, thousands of healthcare professionals were lost, but they tried to reach out to their relatives. And as far as I remember, more than 60 news stories could be created. As we discussed in the past, you told me that you tried to reach out so many people, but in that news series, you had interviews with the relatives of 9 healthcare professionals lost. What kind of barriers and challenges you faced in reaching out to people? There were several challenges, of course, but the survey in the USA included 1,000 journalists who actively were involved, and they created a database. And as I said, more than 60 stories were created, detailed stories created. But in Turkey, we heard about the stories of the people already known, but I just wanted to try to find unknown stories, but this was not easy. And during the pandemic, I conducted a systematic review, which was very useful for me. But of course, the relatives of those people were not ready to share their feelings and emotions with us. For that reason, according to the Medical Association's records, there were 494 healthcare professionals who lost their lives due to pandemic, but I could only reach out 9 of them. But they were not negative to me, but of course, they expressed themselves. They could not even describe their grief and pain to themselves. How could we explain it and express it to you, they told. For most of them, they did not want to criticize the healthcare policies, and they just wanted to reserve their stories to themselves. They did not want to reveal their stories. That's why they rejected my request for interview. And during the interviews, what happened was they cried and they interrupted interviews, or they could not continue the interview. So of course it is very difficult to overcome the situation, and you had to be professional. But of course you have the same feelings, you may share the same feelings, and you have to control this feeling. Yeah, I can imagine that it was very difficult for you. And thank you once again for being so sensitive, because in the USA, more than 1,000 journalists and researchers were included. Unfortunately, in Turkey, it's not so possible for us. We don't. Only you conducted this survey or study. During your interviews or conversations, they asked a question: couldn't have they just survived? So this is a good this is a good reason why they did not want to speak. So it was very difficult to talk to them during the interview. According to the study in the USA, on the website, there was a command. I'm just going to read it exactly. Some of these deaths possibly could have been prevented. There is a lack of crisis preparedness in the USA, wrong steps of the government, that overly pressurized system increased the risks of the healthcare professionals. Lack of access to tests and lack of personal protective equipment, and also social resistance to hygiene and social distance and masks were among the factors that led to increased number of deaths among the healthcare professionals. So we know that similar reasons also apply to Turkey, but of course these factors are more painful, must be very painful for the relatives of the healthcare professionals who died, I believe. When you had an interview with them, did they ask this question, couldn't have they just survived? Yes, of course. Most of these deaths could have been prevented, they think. For example, a pediatrician, Nabil Emir, who died. His wife said something about his death. It was not possible to see the patient in the pediatric clinician, and a parent should accompany. But despite the pandemic measures, that person, that warning that only a clinician, just one person should be in the room. The grandparents or father want to also be in the room. That's why the viral load increases. And Nabil was 45, which was much lower than the mean age, and he didn't have any comorbidities. Vaccines is really painful, because we wish that we had this vaccine earlier. But of course, Turkey came to Turkey later. Although they had additional doses, they had difficulty in accessing the second dose. This did not create any permanent solution. And Esat Öztürk's daughter, he was the chair of the Medical Association of Aydın. If there was a vaccine, if my father died, I would feel worse, she said, for example. I'm so sorry. Esat Ülkü's daughter's video I'd like to show that video for your interview. So, who did we lose? Who were they? What they contributed to this life? This is a video that is summarizing these aspects. Could you please share that video?
Salgınla mücadele eden sağlık çalışanlarının ölüm haberleri ard arda geliyor.
Türkiye 4 doktorunu aynı gün koronavirüs nedeniyle kaybetti.
Hastanedeyim, bekliyorum, ilaçlarımı aldım, kendimi iyi hissediyorum.
İzliyorsunuz, görüyorsunuz, o sayılardan bir tanesi bir gün siz oluyorsunuz.
En başından beri söyledik. Ne yazık ki bu yaralara kulak verilmedi.
Yeter! Bir daha yeter!
Doktor Esat Ülkü'nün kızıyım. Kendisini Ekim ayında COVID-19 nedeniyle kaybettik.
I'm the daughter of Dr. Esat Ülkü. We lost him due to COVID in November.
Aynı zamanda da muayenehanesinde serbest hekim olarak çalışıyordu. Yani birinin kaybından sonra onu anlatmak inanın çok zor. Çünkü ne söyleseniz eksik kalıyor. Ve o kişinin bunu tamamlama imkanı da yok. Bunu bilerek anlatmak çok zor. Babamı anlatmak bence daha zor. Çünkü hayatta çok rolü olan bir insandı babam. Yani hani benim babamdı, bir eşti, bir hekimdi, birilerinin iyi bir dostuydu, bir fotoğrafçıydı. Çok rolü var gerçekten de, dedeydi. Ama hani belki babamın hayatta nelere değer verdiğini anlatmak, onu da anlatmak gibi olur diye düşünüyorum.
But of course,
Babamın hayatının
if I
merkezinde
tell
hep
what my
insan vardı.
father
Çok insanlara çok değer
valued, it will be
verirdi.
better to describe
Ailesine de
him.
öyle,
He
dostlarına da öyle,
valued
hastalarına da
family,
öyle.
friends, patients,
Bu yüzden de
everyone
belki
in
onun
his life.
kaybı bizim için o
That's
kadar
why,
zor oldu. Çok boşluk bıraktı geride.
that's why
Emeğe
it is
çok
very
değer
difficult for us to
verirdi.
lose
Hep
him.
yani
He
kendim
valued
bildim bileli hep çok
labor,
çalışmıştı babam
efforts.
gerçekten
He
de.
always worked hard.
İyi bir vatanseverdi.
He was a
Memleketini çok
patriot
severdi.
and he loved his
Hani
country a
insanlar
lot.
şey der
And
ya işte kendi
people
halinde
say
yaşayıp giden bir insan. Babam hiç kendi
there were
halinde
some
yaşayıp
people who
giden bir
just
insan
were
olmadı.
confined
Yani
with
hem
themselves, but my father was
yakındaki
not like
insanlara
that.
çok yakın davranırdı.
He was very
Onların
close to
dertlerini de
people
dert
around
ederdi ama
him.
etrafında
He
olup
was
biteni
also
de
feeling sorry for the
çözmek için ne
problems of the people
yapabileceğini
around
hep
him.
düşünürdü
And also
aslında
he was trying
bakarsanız.
to
Çok iyi
find
yetişmişti,
solutions
neşeli bir
to their
insandı, çok
problems. He was well
espriliydi.
educated, he was
İnsanları bir
successful, he
araya
had a good
getirmeyi çok
sense of
severdi.
humor, and he
Dostlarıyla bir
used to
araya
like
gelmeyi
bringing
çok
people
severdi.
together.
Yemeği, yedirmeyi,
He
içmeyi,
liked
gezmeyi,
coming together with the friends. He
edebiyatı, müziği,
liked
fotoğrafı çok
traveling,
severdi.
literature,
Mesleğini çok
music,
severdi.
photography,
Hastalarına
and
çok
his
kıymet
profession.
verirdi.
He valued
Nazilli'de
his
büyüyor.
patients. He
Ama
grew up in
ilkokuldan
Nazilli.
sonra
But after
Bornova Anadolu
primary school,
Lisesi'ni
he
kazanıyor
went
ve
to
Bornova Anadolu
Bornova
Lisesi'ne
Anatolian
gidiyor.
School.
Bornova
He
Anadolu
went to
Lisesi'nden
that
sonra da
high
Ankara
school.
Fen
After
Lisesi'ni
that,
kazanıyor
he
ve
went
Ankara
to
Fen
Ankara
Lisesi'ne gidiyor.
Science High
Liseden
School.
sonra
After the high
Ankara Tıp
school,
Fakültesini kazanıyor.
he
Orada
went
tıp
to Ankara
eğitimini
Medical
tamamlıyor.
School. After his
Sonrasında da Ege
education, medical education,
Üniversitesi'nde
then he went to
uzmanlığını
Ege
tamamlıyor.
University for his
Kadın hastalıkları
specialty
ve doğum uzmanı oluyor.
in gynecology
O sırada
and
annemle evleniyorlar. Mecburi
obstetrics.
hizmetini
Then they got
tamamlamak için
married.
Şanlıurfa'ya
My
gidiyor.
mother and my
Şanlıurfa'dan
father
sonra
got
da
married.
Nazilli'ye
After
dönmeye karar
compulsory
veriyorlar.
service in
Aslında o
Şanlıurfa, they
dönem
decided to
örneğin
come back to Nazilli.
ihtisasını yaptığı Ege
So,
Üniversitesi'ne tekrar dönmesi söz konusu oluyor ama
at
işte
the
o
time, he
zamanın
was about to
hem
go back to
sosyal
Ege
hem ekonomik
University,
şartları
but
nedeniyle
because of the social
oraya
and economic
gitmiyor ve
circumstances, then
Nazilli'ye
he did
dönüp
not go there, and he
Nazilli'de
came
hem
back
devlet
to
hastanesinde
Nazilli,
çalışmaya
both at
hem
the
de
public
muayenehanesinde
hospital
çalışmaya
and also
devam
in his
ediyor.
private office
Zaman
he
zaman
worked.
bundan pişmanlık
From
duyardı.
time to time
Bence
he
çok da
regretted
iyi
it.
bir üniversite hocası olurdu babam.
He would
Hani
be a
okumayı,
very good
öğretmeyi,
professor
anlatmayı
at
çok
university
severdi
because he
çünkü.
really
Belki bir
liked
son 10
teaching
yılda zaman
or
zaman bununla ilgili
educating. In the last 10
pişmanlığını dile
years, he always
getirmişti.
told about his
Meslektaşlarını da
regrets.
danıştı. Herkese
And
de yardım
his
eden,
colleagues
yenilikleri
also
de takip
consulted
eden
him.
bir
He
hekimdi
also
aynı
helped
zamanda.
everyone, also followed the
Sonrasında
novelties.
da ölümüne kadar Nazilli'de
Until
yaşamaya
his
devam
death,
ediyor.
he continued
Nazilli'de
living in
babamın
Nazilli.
hala
In
görüştüğü 60
Nazilli,
yıllık dostları vardı.
there
Hala
are
da oradalar,
friends of my
yaşıyorlar.
father
Orada
for 6
kurduğu
years. They are
bağlar onun
still
için bence
there,
çok
and I think
kıymetliydi.
his bonds that
Nazilli'nin
were
evet
very
doğası,
valuable for him.
sokakları
The
bunlar da
nature
eminim
streets of
önemlidir ama
Nazilli
bence
are
onu
important
esas
to him.
orada
But of
tutan
course,
şey orada
what's
kurduğu
kept him
bağlardı.
there is the
Kaybından
bonds
sonra
and
şöyle
connections he
haberler çıktı
had.
mesela işte Nazilli
After
Esad
his
Türkiye
loss,
ağlıyor. Yani bunlar bana çok
there
abartılı
was
gelirdi ama
news
gerçekten öyleydi. Herkes
that
çok üzgündü
Nazilli
yani. O
was
kadar
crying for
kimler
Esad
kimler
Ülke,
aradı,
but
hastaları
I
bizi
thought this
yolda
was so
görüp
exaggerated.
çevirdi,
But patients
arkadaşları.
called us, so us on the
Kaybı
street
hakikaten
and felt sorry.
üzdü.
And offered their
Yani
condolences,
ailesi dışındaki
and we
insanları
really
da
felt sorry,
gördük
and
biz de
people
onu.
apart from his family members were also sorry. That's what we said. While watching all these videos, I feel so emotional, sentimental, because all of them were fathers, mothers, husbands, wives, friends. What would you like to say? Who else could you reach in this study? Cemil Taşçıoğlu. I just wanted to start with Cemil Taşçıoğlu because he's really distinguished professor, and everyone wants to tell a story, and here is the story. And Timur Selçuk used to tell us about Cemil, and Dilek Tahtalı's story. I heard this from her uncle. Dilek Tahtalı was at the patient admission unit at Hacıbadem University. She was the desk officer, cash officer. Unfortunately, she died at the age of 33. She had a chronic disease. Esad Ülkü, I showed you the video of his daughter. Short after, before his death, he was elected as the chair of the Medical Association of Aydın. He stayed there for a very short period of time. He lost his life at Ege University, where he was treated. Melih Aktan is like a genius in hematology, and he really took active role in the literature club of the Medical Association. He really likes philosophy, reading, music, and literature. And for example, he even opened an elected subject for mythological medical terms. And one of the Syrian volunteer doctors also died because of the crisis in Syria, left Syria in 2011, went to Qatar, and then had to migrate to Turkey. And also Nebil Emir, who is a pediatrician, is one of the most liked pediatrician in Hatay. Taki Türk Yılmaz is from Ankara City Hospital. After his death, they named the research center after him. And Avni Nezersoy is one of the most known pediatrician in Hatay. He's also known for not charging any fee for examination. That's why his funeral was very crowded despite the measures and precautions. Many people attended his funeral. And Mehmet Molla Mahmutoğlu is a healthcare professional. He's known as Mehmet Reis in Hakkari, and also he's a member of Hakkari SES. These are the stories. And in the 10th interview, the president of Medical Association, Professor Şebnem, about the problems in the workplaces and what kind of precautions could be taken. Tuğçe, thank you very much. Dear Tuğçe, we are grateful to you because you remind people that healthcare professionals are also humans. That's why your research is quite important. So we can't bring back who we lost. But of course, to avoid new deaths and also to save lives, we should always remember they are also people, human beings. And that's why today's session was quite important for us as a reminder. Thank you very much. As a final remark, yes, we can't bring back losses, but we can prevent violence in health, and we can prevent victimization, traumatization, death, and even suicide of healthcare professionals. It is up to someone. There must be a way. I just wanted to end with this remark. The only thing we want is that we have peace in our workplaces that we like. Thank you very much, Tuğçe, and thank you for your attention. Thank you very much, professors. Have a good afternoon. Thank you. Distinguished audience, I'd like to thank you very much for your attention to the pulmonary diseases and COVID-19 for the public. Thank you very much for your attendance. We came to the end of this Congress. I hope this has been useful and helpful for all the aspects, or many aspects you may need. We shared great information about COVID, how should we spend the time at home during COVID infection, and also about COVID vaccines. We provided information. I hope that you can get your booster doses and other necessary doses on a regular basis. And of course, patients with chronic pulmonary diseases should be vaccinated for flu every year and pneumonia every year, definitely. For that reason, please get vaccinated and vaccinated. And apart from that, we talked about the precautions against COVID at workplaces and how we should protect ourselves against COVID at workplaces. And also related to pulmonary health, we try to give you information, and also about smoking, how to quit smoking, how to cope with smoking. And environmental problems were also discussed because as we are a society dealing with lungs, it was our duty to talk about the environmental issues. We have environmental problems working group. So we say One Health. Protection of environment is important. Not only human health, animal health, plant health is important, and also conservation of nature is quite important to promote health and to protect health. We are a whole. That's why we suggest One Health. It is necessary to protect ecosystem, and wars destroy the ecosystem significantly. For that reason, we say no to war. And every day, except war, every day, a healthcare professional, a physician, is exposed to violence, subject to violence. We are really sorry for that. And our young colleagues do not want to exercise their professions. Most of them commit suicide, most of them resign, and most of them go abroad, migrate to other countries, and they abandon our country, and we have a significant level of brain drain. So it's not easy to educate a doctor. I'm a mother, and my 2 children are doctors too. For that reason, I can see their efforts, and they are working under very challenging, more challenging circumstances today, because at the university exam, they get great scores so that they can go to medical school, and they have to complete their compulsory service, and then they have to get ready for their specialty exam, and they get their specialization education. Then after that, they have to another compulsory service. They have some minor education, then go for the compulsory service again. We and our male colleagues have to complete their military service. It's not easy to educate a doctor. So as parents, we witness that directly. And also another point that I'd like to say is, in health, to prevent violence, legal measures should be taken immediately so that we can prevent the loss of our young colleagues and doctors. So I just wanted to convey this message to you. What would you say, Pınar? Anything else you'd like to add? You summarize it very well, Professor. I'd like to finalize my remarks by saying that all physicians and medical societies have a duty, main duty of promoting health and protecting health. This Congress served to that purpose. As we all know, under this Congress, it was discussed widely: tobacco industry, air pollution, climate change, loss of biodiversity, deforestation, and several factors and reasons lead to chronic cardiac and pulmonary diseases that we are trying to prevent and fight against. For that reason, disease control also covers control of all these factors. We need to look from this perspective, and that's why we organize these congresses. And promotion and protection of health, for the protection and promotion of health, peace is a must. So I'd like to finalize with Atatürk's saying, peace at home, peace in the world. Have a good day. Have a good day. Thank you very much for watching us. Thank you.